Come on, let's go! Everyone, pull together! We've got a threat to on our hands! You there! Here we go! Narito na! Wimpo! Okay, pivotara! Pomelo?
Uh-oh. Yeah.
Sundari, ma'am, we are able to hear you.
Yeah.
Yes, ma'am. Start.
Shall we start?
Yes, ma'am.
Very good morning, ma'am.
Very good morning. Very nice to see you all. And I'm very
Yes,
happy
ma'am.
to be
So
present.
I'm also very happy to see you, ma'am. In this COVID time, we are meeting very long time, no? After a very long time.
Yeah,
But
that's true.
it is very, very much happy to all of us, ma'am, to see you.
Yeah,
Yes.
happy to see you all.
Yes.
So shall we start?
Yes, ma'am. Yes, ma'am. We'll start.
Yeah.
Yes, ma'am.
Yeah. Good morning. At the outset, I take this opportunity to thank all the organizers and especially Dr. Kanyamal for giving me this opportunity. Now
Ma'am,
let's go into the...
with pleasure, ma'am. Always we are welcoming you, ma'am. Yes.
Okay.
Dear
Now-
delegates, for your information, a live streaming in YouTube is also available. Those who have any technical issues in connecting through Zoom, click the YouTube link given in the chat box so that you can attend the webinar through YouTube. Or else, dear participants, share the YouTube link to your colleagues who cannot able to join through Zoom. We will start our next session. Practice makes a man perfect is a proverb which talks as the importance of continuous practice in any subject to learn anything. I'm so excited to hear from an eminent person in the field of nursing fraternity, Dr. Sundari Edwin, former Chief Clinical Nursing and Education Administration, SRM General Hospital, for the session on Bridging Gap Integration of Nursing Education. I call upon Mrs. Angeline Dhanalakshmi, Assistant Professor, SRM College of Nursing, to introduce Dr. Sundari Edwin ma'am.
Morning to one and all gathered here. The only way to do great work is to love what to do. It's my great privilege to introduce Dr. Sundari Edwin ma'am. Ma'am did her BSc Nursing in Christian Medical College, Vellore, MSc Nursing in Child Specialty, Christian Medical College, Vellore, PhD in the year April 2014 at Vellore Christian Medical College. Ma'am had worked as a chief clinical and nursing educational administrator in SRM Medical College, director in SIMS SRM, Hospital, Vadaparni, deputy director, professor and head of the nursing in pediatric department. Additional training and courses are teacher exchange program in Kolkata University, Sweden. To do need assessment and educational program, University of Sri Lanka. As a visiting scholar in University of Washington, School of Nursing, USA. Training course on medical negligence, consumer protection act and medical ethics, women's and Christian hospital, Adelaide of South Australia, National Institute of Health and Family Welfare, New Delhi, clinical placement on internal JIPMER Pondicherry, management of patient care for nursing administrators. Ma'am achievements. Third prizes were poster on neonatal resuscitation 2030 and a biennial conference. All India Nursing Excellence Award, third prize for poster presentation on neonatal resuscitation, awarded by a cash award for raise 50,000. Best Teacher Award for College of Health Sciences for Feminist Abnona KSA 2002. Best Nurse Award, Kristika Ratna Award for the Akila Baranchita Kristika Sang, Rajasthan 1996. MSc Nursing passed with the highest marks in MSc Nursing program, awarded at a golden medal in the PCBSc Nursing also. Paper presentation, 7th National Nursing Conferences, Mutual Stimulation, Cutting Edge in Nursing Education, Factors Affecting Professional Ethics in Nursing Practice, Resource Person for Senior Nursing Reviewer, Inspector, Maintenance and Removal for IV Catheter Monitor. Basic life support, formulation of comprehensive clinical documentation, enhancing excellence and innovation in newborn care. Look at the design, keeping adolescents healthy, future of child health care. Now I welcome you, ma'am, for your very valuable speech, ma'am. Thank you, ma'am.
Thank you, Angeline, for your kind words.
Thank you, ma'am.
Okay, now let's start. My topic for today is Bridging the Gap, Integration of a Nursing Education and Practice. Next slide, please. Yeah, our father of nation, Mahatma Gandhi, has said, you must be the change you want to see in the world. If at all we want to make change, we have to be the change first. Next slide, please. Okay, we'll see the introduction for this. The concept of a theory-practice gap is not a new thing. Globally, the goal of nursing education is to ensure professional clinical competence. Practice experience is the hallmark of nursing profession. Graduate nurses, though proficient in theory, are less proficient in clinical skills at the time of registration. Bridging the gap, integration between education and practice is pivotal in ensuring clinical competence. Integration in nursing. What is it? Is the purposeful process of blending nursing education and practice where members of the discipline like educationalists, practitioners, and also the administrators share their knowledge as well as their expertise to achieve common goals. It is threefold. Number one, students learning. Number two, patient care. And number three, scientific advancement. Can I have the next slide, please? Now let's see the objectives of integration. This is to achieve quality care for patients and sound education for nursing students. This is the prime one. First and foremost one is mainly for the quality patient care. Not only that, also for a sound education for nursing students. Next one is to improve interpersonal relationship between the college faculty and nursing service staff. Create a healthy, conducive environment in the clinical setting. Improve efficiency of college faculty by staying clinically updated. Promote the spirit of inquiry and research in nursing. and to provide opportunities for involvement of senior staff from the nursing service and College of Nursing at policy making level and advice at advisory boards. Can I have the next slide? Now let's see what's the need for integration. The first and foremost would be to have smooth transition from student to practicing nurse, that is staff nurse. Number two, emerging health concerns. See, these days there are so many emerging health concerns. For example, more of graying population. Even COVID-19 is an emerging health concern. With integration, if there would have been proper integration, the faculty or nurse managers will be whoever is in the ward, they will be able to help the staff nurses in arranging staffing, teaching the staff about donning and doffing, etc. So it is very important that we have integration. The third one is advancing technology. If integration is there, we will be able to have pace with advancing technologies. Nowadays, there are new advancements in managing clinical conditions. For example, to manage diabetes, we have not only syringes to give injections, but also flash glucose monitoring system, where you need not poke the patient all the time. For the management of asthma, there are multiple types of inhalers. So if we don't really spend time in the clinical area, we will not have pace with advancing technology. Now, next one is increasing clinical competency in healthcare. That's because of rapid knowledge expansion. Those days, whatever doctors have prescribed, they will buy and they will listen to the doctors. But these days, patients are aware of many things about treatment modalities of their disease when they when they ask about something, and if we don't answer them properly, they will lose confidence on us because they are thorough of everything. Before they come to hospital itself, they will learn about the whole disease condition and all the treatment modalities, and then only they come to us. So we have to have really good knowledge. Only if we are in the clinical area, we will be able to have good knowledge. Patient has access for all sorts of drugs except sleeping drugs, sleeping pills, and some psychotic drugs. Some patients may even say, Dolo, if you give, no, Dolo, it will not help me. To tackle the patients, we need to have adequate knowledge. Unless we are there in the clinical area, I'm sure it's not going to be feasible. The next one is prevailing socio-demographics and diverse culture. Only if faculty come to clinical area, they will know the socio-economic problem and cultural problem of patients. Book may not explain everything. For example, if a patient has to take chemo drugs, there are available. So many drugs are available. It may be 5,000 or sometimes even same drug costs 8,000. But if we are in the clinical area with the patient with integration, the faculty will know whether the patient is affordable to buy 5,000 rupees drug or 8,000 rupees drug. And the next one is continuation of existing political and global issues, including disasters, violence, and terrorism. One of the present global issues, as many of you have already said, COVID-19, which is a pandemic. We have learned pandemic in part book, and we all know pandemic means a disease that spreads over a whole country or the whole world. Only when we work and be in the clinical area, we will know how to handle rare things. We cannot get all the information from books. The next one is increasing professional and personal responsibilities. Consumer Protection Act came into force on April 15th, 1986. Ever since, we find there are a lot of litigations against healthcare personnel. I would like to narrate an incident. A student nurse was posted in neonatal ICU in abroad. A baby was admitted with a rare congenital anomaly. She was very much interested in that condition, and the clinical instructor also said, why don't you present this condition? So she had taken photos of the baby, but care was, and also she has taken care to hide the baby's face. But after 2 weeks, the family filed a case against her. And she was wondering, oh, I have already hidden the face. I've already deleted from my PowerPoint and all that. And she did not know how it happened and how they were able to get this. And I heard that one of the relatives, they came to know later through this, they were searching for something and they found it. And when she was thinking loudly how it happened, she came to know, though she deleted, digital capturing cannot be deleted and it remains in the cloud. And that was the reason she found out. And later on, she was sent off from the college for not getting permission from the parents. You see how important it is, how all this plays an important role. Shall we go to the next slide? Why integration is the need of the hour. Nurse educators no longer practice nursing in the wards, or wherever there is no integration, they don't practice in the wards or directly involved in the delivery of nursing care. Bedside nurses have very little opportunity to share their expertise to the practical the practical knowledge with students. The gap between education and practice has widened to such an extent that there is significant difference between what is taught in the classroom and what is practiced in the clinical setting. Like, the gap, for example, some time back, I think we were all taught, after giving IM injection, massage with the heel of your palm. But now researchers have proved that massaging the area after injection leads to tissue injury. So nowadays we don't practice. So unless we are in the clinical area, it won't be possible for us to practice the updated ones. And the next one is about challenges in the contemporary nursing education, that is reliance of didactic teaching approach. In didactic approach, teaching approach, the teacher, for example, teacher gives information, all the information to the students. Teacher is the authoritative figure and students learn from the teacher. This happens because of the load of teaching hours that the teachers have to finish. I have witnessed in Sweden, the students are given a few questions and they are asked to find the answers. The students are expected to get the information through net, referring many books and journals, and that will help them to creative thinking and innovative learning. The next one is passive learning. That's again, it's something same thing. Like here again, the students, they are just listeners and they won't actively participate in learning. The next one is focus on individual nurse-patient interaction. The nurse has the tendency these days to focus only on the patient as an individual, not as a holistic care. She doesn't really look into the holistic care of the patient, looking into the environment, looking into the patient's family, and so on. The next one is outsource clinical posting. Okay, this is oriented model. In disease-oriented model, they only look at the disease and they don't look at the patient as the patient-centered one. So again, the family has not been taken care. They just look at the patient as a disease. Only the disease has been really seriously looked into. Like for example, if a patient is with COPD, the nurse may be able to just write the care plan using the book, which will not be patient-centered. Whereas with integration, they'll be able to concentrate on the family care and will get to know how the patient disease affects the patient's family and how it affects the quality life of the patient. The next one is outsourced clinical postings. As of today, many colleges do not have an attached parent hospital. Hence, they are forced to send the students outside for the clinical experience. When they go for outside posting, they will not be allowed to give medications, injections, starting IV. And why all this? In some hospitals, they will not even allow them to touch the patients and assume responsibility. The next one is memorandum of understanding with other hospitals for practice where minimal or no clinical supervision is possible. In this scenario, the students when I was in SIMS also, we receive many students from many other hospitals as visiting students. With MOU, we have them. And when they come to hospital, there may be about 50 people or 30 people in a group coming along with only one tutor. How will she be able to supervise optimally? Hence, they don't learn what they are expected to learn. Next slide, please. Nursing education without practice is just like a cup of tea without a sugar cube if you are a lover of sugar. Next slide, please. The key to achieving success and surviving in the future world is collaboration and connection. So we need to build bridges. Before we build bridges, we have to approximately find out what is the gap, and building bridges is very, very important. Next slide, please. Now let's see what are some of the existing gaps in the education. What are some of the existing gaps in the education? Ideally, that is first and foremost one thing. One is lack of competency testing in day-to-day student evaluation. Ideally, the faculty is expected to evaluate the students daily in their clinical area to see what knowledge and skill they have acquired by taking report. But this is not being practiced where there is no integration. Often, it's not feasible as the student-tutor ratio is very high. In many colleges, there is no control over the number of students intake. Hence, day-to-day evaluation is not feasible. And we may say, okay, we have to recruit many faculty, not to be many faculty, but that may not be possible too. If there is integration, the senior nurses will be able to teach many students and see some of their procedures too. The second point is practical exposure and hands-on training. This is very clear. Unless we have practical exposure and hands-on training, there is a lot of dearth in that. So we have to see that we have hands-on experience. The next one is attached hospital, which I have already spoken. Lack of attached hospitals, lack of critical thinking and decision making. Only when we are exposed to clinical practice, we will be able to think critically and take appropriate decision. The next one is lack of updation in clinical skills, especially for the faculty. The next one is lack of responsibility assumed by students in the patient care area. The next one is lack of systematic learning process in clinical areas and innovative teaching methods. Next slide, please. The reality gap in practice. What is the reality gap in practice? We know faculty do not assume responsibility for quality patient care where there is no integration. Inadequate SOPs, practice manuals, critical pathways, and standing orders. For example, for SOP, SOP is catheterization. Here, if we have to do catheterization step by step, the procedure is very clearly written and it is informed to the readers or the people, those who are doing procedure. So it's easy. So SOP is mandatory. The procedure and also the clinical pathway is something very, very important. That is, for example, I want to say that we have prepared many clinical pathways, both in SRM as well as in SIMS while I worked over there. And one thing I can just say, that is how we manage hypoglycemia. It states if blood sugar goes less or equivalent to 70, we have to check whether patient is conscious or unconscious. If conscious, give 2 teaspoons of glucose or sugar and check the blood sugar after 15 minutes. And if still less, inform doctor. If patient is unconscious, inform doctor. Start the patient on 25% dextrose and may initiate CPR. Same way, standing orders also. Like this, there are so many clinical pathways written for each disease condition. Same way, standing order states clearly what the nurse is expected to do during emergency in the absence of a doctor. That is there. So when it is written and signed by the nursing superintendent or nursing director and also by the medical superintendent, the staff over there in the department, they have clear idea as to what exactly they have to follow. This we have in CMC, standing order for in every area we have. This provides uniformity and consistency in care. Next one is most of the nursing supervisors and charge nurses are diploma holders. Diploma holders may know everything, may have good skill, but they may not be fluent in teaching in English. So that may be the problem. Next slide, please. Now, bridging the gap. So how are we going to bridge the gap? On-the-job training is something very, very important, and attitudinal change we have to make, and soft and hard skill training are important for senior staff nurses. Like any staff nurse, when they join the institution, induction program is very, very important. And the seniors are given on-the-job training. On-the-job training is nothing but example, when they join, they will know. For example, she must have worked in ICU. In that ICU, she must have had some other ventilator. But when she comes to our ICU, the ventilator type, the model may be different, or the cardiac monitors may be different, syringe pump may be different, the infusion pump, the company may be different. So we have to teach how to handle in the clinical area. That's something very important. And also education integrated with practice. So we have to deploy nurse educators to train and teach the students and junior nurses. Following SOPs, we already said, supervised clinical posting, real world experience. Student, by being near the patient bedside, they will know how to care for a patient with a specified illness. Example, meningitis. The student will be able to compare the book picture with the patient picture and will be able to learn and remember better, and teaching learning process becomes more effective. And also, if she comes to the clinical area, she will know why we are telling after taking LP, after doing LP and all, we have to put the patient in head low position, because she will see if we put the patient in a little bit elevated position, patient will have headache. So if she is in the clinical area, she'll be able to understand all this. Next one is panoramic view that encompasses healthcare system, quality and safety. That is bird eye view. Through this, the student, when she is posted in an orthopedic ward, will learn grab in the importance of grab bar. If she is in the surgical ward, she will learn the importance of using a surgical checklist and so on. So this is important. The next one is team approach to problem solving. For example, patient has gone into hypoglycemia and the patient is unconscious. Here, the team approach would be how a nurse responds to it, or then how a doctor responds to this problem, and how a CART team responds to this in solving the patient's problem. So team approach is something very important. The next one is assess competency using ASCII. At the beginning of the student's posting, identify the important procedures to be signed in that clinical area. Secondly, demonstrate each procedure with a checklist. Thirdly, allow them to participate or allows them to practice in the ward with supervision. Fourthly, at the end of the ward posting, test their skill competency by objective structured clinical examination. OSCE can be done for both students as well as for the staff for the maintenance of the quality. The next one is continuous intercollaboration and joint classroom teachings. As the students come to clinical area for practice, faculty teach in there, and doctors also teach them. PCBSE students may attend some of the classes like microbiology classes or anatomy classes along with the BSc nursing students. With all this, they'll be able to improve their knowledge and understanding. Next one is e-learning or web-based learning. This can be given to staff nurses so that they will teach the other people. They will first of all update their knowledge, and then they'll be able to conduct classes for others also. And Sometimes we find the senior most nurses, they feel very delicate to attend classes if some juniors are taking. So what we can do if we have online classes, like Tamil Nadu Nursing and Midwifery Council is trying their best to teach staff nurses by online CNE classes. That if we introduce to them, I'm sure they'll be able to learn that. Teleconferencing and video conferencing, rare condition like rare surgeries can be shown or taught through video conferencing. Audio conferencing is very much outdated. The next one is engage in audit or research activities. Students are expected to do small research project as fourth years, and they present their findings. And also faculty are also involved in doing audit of nursing care. So this will enhance this will prevent or certainly reduce the gap. Now, strategies to close the pre-existing gap in the integration. So first and foremost is preceptorship. Let's see who is a preceptor. Experienced practitioner who provides transitional role support and learning experiences to new staff. Preceptors need to be a good role model. They should be a good socializer, educator, protector, and a good evaluator, and should be good at communication. IPS skills should be good. Teaching and learning theory is very important. And for them, we have to conduct series of classes before they become preceptors. Preceptee is asked to work along with the preceptor. So we have to find out list of procedures need to be signed by the preceptor and then slowly do it. Preceptee training is very important. At least it should go on for 3 months. The next one is mentorship. We have done this mentorship very much in SIMS as well as in SRM. Make a list of all senior staff nurses and then under them assign all the junior staff nurses. See that they all take care of them, not only in the clinical area, but also guide them in the professional life. For example, the senior staff nurse should know everything about her likes, dislikes, future plans, about her family, her problems, everything she should know, so that there won't be much of uh, attrition, or there will be a conducive environment to work with. And in SRM, we have got foster parent. In CMC, we used to have foster parentship only for these students, but we thought it will be good if we do the foster parentship for the staff nurses, and also for the especially for the novice nurses. And this really helped. They were all assigned to some senior staff nurses, or even to the DNS, ANS, charge nurses, and all those people. About 5-6 nurses were assigned, and they were periodically meeting them in the beginning, so that reality shock was very much reduced, and they were able to really go and explain them their problems. And by that, they were able to build their relationship, guide them, coach them, and all that. Using human patient simulator, this is something very important, and this is for enhancing training outcomes. For example, we practice CPR in mannequin. How do we know that we are doing the compressions correctly? It's by looking at the light. When the light comes, we know, okay, what I have done is right. And same way, when we place IV line in the mannequin, if we are able to see the red fluid coming through, then we know, okay, I am in the right track. And also we use so many multifunctional mannequin to learn tracheostomy care, colostomy care, and so on. In SRM, we have a fantastic art of the world simulator lab. I think I have never seen such a one. Probably I have seen it in Sweden. After seeing that in Sweden, this is also equivalent. Well, I mean, it is also superb setup what we have in SRM. Next, and also nursing process approach. These days we find, though nursing process approach is very good, it's a holistic approach. Not many people are using it. We are jumping into problem-based approach. Suppose if a patient comes with pneumonia, we know We just sketch out to say these are the problems 1, 2, 3, all that we put in, and we try to solve the problem, dyspnea, fever, or whatever it is. We just put it according to that, prioritize it, and then give care to the patients, that is through problem-based approach. Next one is holistic care approach. This means to provide not just their physical needs, but their emotional, social, and spiritual well-being. And the next one is getting research into evidence-based practice. We do research, and to what extent are we disseminate the information findings? And also we have to assimilate it, that is using the findings in the practice. Next slide, please. Elements. What are the elements for achieving integration? The shared values. I think trust is something very important. Trust is the firm belief in the relationship of someone. And also we need someone, and cooperation has been based on the principles of mutuality, which is relationship between two parties. Reciprocity is a practice of exchanging matters of concern with others for mutual benefit. Of course, again, effective communication, decision making, and leadership are very important. Next slide, please. Now, dual responsibility. Before we go into the dual responsibility, I would like to introduce the integration model, which I had been practicing while I was in CMC. CMC is a 120-year-old institution. The founder of CMC is Dr. Ida Sophia Skada. Many of you know, most of you know, but for people, those who do not know, I just would like to say a few words. It provides primary, secondary, tertiary, quaternary outreach services. There are about 3,500 inside inpatient beds and 1,000 employees working over there. 3,000, among that 3,500 nurses, and we can say that apart from that, 6,500 students are studying in CMC, and among that 1,000 people are nursing students. In the year 1904, Dr. Ida Sophia Skada found informal nursing school. And in 1946, the first BSc nursing course in India was started in CMC. 1960, the nursing situation was the nursing supervisors and charge nurses were only diploma holders. There was compartmentalization of nursing education and service. At that time, there were only 11 faculty in the College of Nursing, and they were all MSc nursing holders, degree holders, as because CMC sent them to abroad to do their masters. Even after they came back from abroad with master's degree, they continued the same function. And only in about 1960, this 11 faculty approached the then administrators and said that they were willing to do dual responsibility, which means as faculty, they'll be teaching in the college, and as nurse managers to provide quality care in the nursing service. They had accountability to the dean for student learning and accountability to the nursing superintendent for patient care. So this integrated model pilot was done in 1968. Dean College of Nursing and Nursing Superintendent, both were faculty, had high qualification. Administrative position are only term-based. 12 HODs were also recently, and after this is later, 12 HODs were selected and they were all accountable to nursing superintendent and to dean, had role in hospital and college. Under them, there were junior faculty, charge nurses, staff nurses, and students. They looked after the student teaching in the college as well as in the clinical area. This brought a huge change in education and practice. 52 years of successful dual role of nurse manager and nurse educator is there in CMC. This model was evaluated in 1976 and in 1990, and they found it had congruence between the teaching practice and research. We sit in the College of Nursing meeting for student curriculum with the nursing superintendent to discuss about, and then with the nursing superintendent to discuss about quality care. The advantages overweigh the challenges. You may say, no challenges. Yes, there are challenges as well as advantages. The advantages are for the faculty. Number one is abundant learning opportunities that improves clinical competencies, professional recognition and status, variety of novelty of work. They get authority both in hospital as well as in the college. But the challenges is that we require graduate degree to teach these students and staff. Competency in teaching and clinical skills are also very important. It has to be experts in these, they have to be experts in these areas, but they have to also set boundaries. Shall we go to this dual responsibility? Now, faculty, I have already said most of it. Fact, I will just read it. Faculty, nurse educators have dual responsibility as a faculty. The faculty is accountable for student education. I already told you the senior faculty at the hospital are responsible for classroom, clinical teaching of students, patient care, staffing, budgeting, and staff development in the clinical area. The organizational chart brings all the faculty to hold both responsibilities. Next slide, please. So here we find the faculty comes to the clinical area and then teaches how a steam inhalation to be given to the students. There, when they see that, we can say we can prevent, we can prevent burns by not filling the water or fluid till the brim. I mean, it should be 3/4. All that, if we come to the clinical area, we'll be able to teach. I think it is much beneficial. Next slide. Now, what are some of the benefits to the patients? That is improvement in standard of care, innovative ideas for patient benefits due to research, innovative ideas for patients and benefit. Example, they have done so many studies. Even some studies proves that music therapy for patients when they undergo dialysis. So all this researchers are very important for patients. Team approach and evaluation of care, improvement in quality indicators, reduce nosocomial infection, less pressure injury, and also fall number also decreases. Next slide, please. Benefits to the students. Humanistic approach to learning supervision by qualified staff, clinical teaching by doctors, well prepared and efficient nursing students, develop interdependence of colleges of nursing and service organizations, uniformity, consistency in teaching. Benefits to the clinical environment, empowerment of nurses at all levels, assumption of professional responsibilities. Staff feel that students are coming and learning from them, and that keeps them very happy and thereby assume more responsibility. Even we hear many doctors saying that I have learned this such and such things from a particular nurse, and by that the senior nurses are very proud, like doing this thing, starting IV, giving injections. All these have been learned by doctors from the senior staff nurses. Good working and team spirit. Basic care is given by students, staff nurses give injection, and there will be some give and take policy, so that's something very beneficial. And also staff are updated by on-the-job training, preceptorship, mentorship, efficient flexible leadership, teaching and learning support of nursing from qualified staff, promotion of quality nursing care, and enhancement of continuous learning climate for staff and students, promotion of research in nursing too. Next slide, please. What are some of the benefits to the organization? The benefits are effective utilization of nursing manpower. Number 2, promotes decentralization. Number 3, enhances research. Number 4, good quality care. I have said all this, so I'm not going into the details. Fifth point is promotes interdisciplinary collaboration. Number 6, recruitment of staff nurses enhanced by the OSCE. Next slide, please. What are some of the challenges and demands of effective collaboration? Feedback from some students regarding classes by hospital staff, not very appreciative. And they also say hospital staff, they are not very eager to take up student supervision. There are also complaints saying that difficulties like hospital staff expect College of Nursing staff to be there round the clock, not realizing teaching load and other college activities. Even when they do night, they feel, why can't the teachers come and be there? So that is not possible. So we have to understand College of Nursing staff stress and burnout at times, not able to complete task on time. So this can be reduced by senior staff nurses and charge nurses. They can give some hand or help and share the burden of the faculty. For example, if the faculty has class in the College of Nursing with the students, some other group of students, and some other students are already there in the clinical area, the charge nurse should not think, oh, let them come and put the assignment. She can pitch in and help them by putting the assignment according to their needs. So that's something very important. Increased workload, but no additional increment for the same. Next slide, please. Now, challenges and demands. What are some of the demands? The demands are, it requires, I already told you, expert knowledge and skill in nursing education and service. Set firm boundaries outlined in dual areas. Like we say, you have, if suppose dual responsibility is there, we have in CMC, what we have is from junior lecturer till professor, how much of time they have to spend in the clinical area, what percentage of time they have to spend in clinical area, what percentage of time they have to spend in College of Nursing. That is very clearly given to them. So that helps them to manage their time and do their work. Inadequate time for research. So because of all this, we very often find there is inadequate time for research. And workload may be huge, but still it's worth a try. Next slide, please. Outcomes of effective collaboration. Okay. Improved quality of patient care. A win-win relationship, integrated education and service, reduce attrition of staff nurses, attend to efficient nursing faculty shortage. Next slide, please. I would like to give only 4 take-home messages. Number 1, integration is the need of the hour to achieve quality patient care and prepare well-equipped professionals. It is a boon to the patient, organization, students, and to the nursing faculty. It creates a positive learning and working environment, synergistic effect to achieve the pinnacle in nursing. Next slide. We need each other to achieve the destination. So here we find a railway track. Unless it meets together, we won't be able to reach the destination. Same way, we have to see that we integrate both. Thank you. Thank you for your patience listening.
Thank you, ma'am.
Yeah, I think I finished on time, 45 minutes. Thank you.
Thank you, ma'am. Your in-depth insight knowledge on integration makes us to motivate to bridge the gap between education and practice.
Thank you, ma'am. Thank you so much.
Thank you very much.
Sharing of all your practical knowledge wherever throughout globe where you had that experiences you share for our young leaders, young generations of students, and then the faculty staff, so that it will be definitely bring an eye opening for all of us how to move about with this integration. So that is the main core we are thriving for. Definitely it gives a meaningful vision for every one of us. So we are fortunate, very good presentations, and then involvement in the practical aspect. So that only I expect. So it should be reaching for all. So that is my aim. It is coming into reality. So that's the thing. Thank you once again for all your good effort and having association still and ever accepting whichever we accept. We ask, you are saying yes. So I too also the same way. I'm thankful for that, madam. So now shortly, I think Sar has joined. We will have our inaugural session, ma'am. Shortly, you join for that also, ma'am.
Inauguration is the start of something. To start anything peacefully and beautifully, certain important tips are absolutely necessary. Here is a list of beautiful inaugural session by the dignitaries. If we had no winter, the spring would not be so pleasant. If we didn't sometimes taste of adversity, prosperity would not be so welcome. Now, I would like to request our Honorable Dean Ma'am, Dr. C. Kanniyamal, to welcome the gathering.
Yes. So it is my immense pleasure to welcome the gathering of a second national webinar on leadership challenges in bridging gap of nursing education, practice and research. So good thoughts precedes great deeds. Great deeds precede great day, filled with success, joy and happiness. I wish you all a great day ahead. A pleasant morning to the dignitaries and to the impressive participants. I thank God Almighty for divine guidance for today's proceedings. Wherever the art of medicine is loved, there is also a love for humanity, a quote by Hippocrates. Art of nursing, with a healing touch, compassionate care, has an inherent love for humanity, the ultimate purpose of life. Excellence is never an accident. It is a result of high intention, sincere effort, intelligent direction, skillful execution, and the vision to see obstacles as an opportunities. Yes, to work towards excellence in nursing practice with high intention and sincere efforts, this second national webinar aims to explore on the same leadership challenges in bridging the gap between nursing education, practice, and research. On behalf of SRM College of Nursing, I am immensely pleased to offer my welcome note. Leadership is capacity to translate vision into reality. A leader takes people where they want to go. A great leader takes people where they don't necessarily want to go, but ought to be. According to the quote, Rosalind Carter, a true inspiring leader whose contemporary thoughts and action derives others to do more and become more. Our Honorable Pro Vice Chancellor, Medical and Health Science, Dr. Ravi Kumar Sir, SRM MCH RI, and in SRM IST, we are privileged to extend our heartfelt welcome to our Honorable Pro VC Medical and Health Science. We express our sincere gratitude for accepting our invitation and gracing the occasion to inaugurate the second national webinar and for the constant support and motivation in all our endeavors. We welcome you, sir. Thank you, sir. A genuine leader is not a searcher for consents, but a molder of consents. According to Martin Luther King, humility is a great quality of leader which derives respect. These words are more suitable for our renowned Dean Medical, Dr. Sundaram, SRM Medical College and Hospital, remains as a strong motivation by expressing his trust and confidence among his team members. I am immensely pleased to welcome you, sir. Thank you for your presence here to offer a special address. Leadership is practiced not so much in words as in attitude and action. Dr. M. Balasubramaniam, Associate Dean Research, SRM Hospital and SRM IST, practiced leadership not only by his affirmative attitude and action, also with his scholarly and fascinating words. I am fortunate to offer our cordial welcome address for you, sir, for being with us to enlightening the felicitation. True leaders always practice 3 R's: respect for self, respect for others, and responsible for their action. Leadership is unlocking people potential to become better. As an amazing administrator, madam, I unlocked the potential of his subordinates to bring about the best in them. On behalf of SRM College of Nursing, I am delighted to welcome Dr. K.V. Neela, Professor and HOD of Microbiology Department, Vice Principal, SRM Medical College and Hospital. Madam, we are grateful to you for accepting our invitation and gracing the occasion. Thank you, ma'am. I am privileged to welcome you for this felicitation. Efficiency is doing the thing right. Effectiveness is doing the thing right thing. So according to Peter Drucker, so I am pleased to offer my hearty welcome to Professor Vijay Lakshmi, Vice Principal, SRM College of Nursing, co-chairperson of this national webinar, with highlights principles and value and meticulous assistance in planning and delegation for the successful organization of this national webinar. I also extend my warm welcome to Mrs. Associate Professor Deena Jodi and Ms. Priya, as Assistant Professor, SRM College of Nursing, helping in organizing this webinar. I feel greatly honored to welcome the distinguished experts and the resource persons who will share their expertise today. We are honored by their presence of our esteemed expert speakers of the day. I am extremely obliged to welcome our associates, the nursing community, dear delegates, the nursing students from various nursing colleges and staff nurses from the hospitals, our own SRM hospital and other hospitals. It gives me a great pleasure to welcome respected deans of other discipline, OT, occupation therapy, PT, and HODs, faculty, staffs, whoever attend this webinar. I am welcoming each and every one of us. I take this opportunity to welcome our own aspirants, the faculty members and the dear students of SRM College of Nursing, who had put their sincere efforts for the admirable organization and conduction of this webinar. On behalf of SRM College of Nursing, once again, we convey our deep appreciation and offer our most grateful welcome to one and all gathered here. Thank you for the opportunity for the organizing team. Thanks.
Thank you, ma'am, for your warm welcome. Light symbolizes knowledge, while darkness represents ignorance. Light is the knowledge principle which removes the darkness of ignorance and by which all can be achieved through light. Here is the virtual lightning Kutvalaka to enlighten the session by all the dignitaries.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
Thank you, sir. Accomplishment will prove to be a journey, not a destination. Ladies and gentlemen, we rarely get this kind of an opportunity to listen to the words of great personnel, humble, light-hearted, nobler with intellectual character. With due respect, I would like to welcome Dr. Lieutenant Colonel A. Ravikumar, Pro Vice Chancellor, Medical and Health Science, SRM IST, to address the gathering.
Good morning, everybody. I hope I'm audible.
Yes, sir. Good morning, sir.
Thanks to all of you for having invited me to deliver an address on this August gathering today. I'm very happy to be here, and I personally thank Dr. Kanyamal, the Dean, for having me over for this occasion.
Thank you, sir.
I also extend my heartiest greetings to all the persons who are assembled here today. And I see the number is more than 500,
Yes, sir.
which is a good number to have. That means there are so many people who are interested in this field which you have chosen.
Yes, sir.
So we have the topic, the theme of the webinar as leadership challenges in bridging gap between nursing education, practice and research. I think you nailed it because this is the problem which you are facing today in your field of nursing. They are excellent nurses, they are excellent professionals who have got very good not only knowledge and technical skills, but somehow some inhibitions are there in order to share it. Some inhibitions are there in order to lead a team. They have some feelings that they may not be heard. Those have to be overcome in order to be a leader. If I go plunge in straight away into the topic,
Yes.
I just heard the last bit of Dr. Sundari Edwin's lecture,
Yes.
and
Yes,
she addressed most of these issues. I think she embodies what a leader should be. According to me, a leader is one who is able to do things what he expects the follower to do, and also shares his experience or her experience with the junior and tries to make them better than what he is or she is. That is the true quality of a leader. But what we find today is that there is a little inhibition on sharing that so-called knowledge, skill, and the third component, the behavioral aspect of a medical or a nursing service. We belong to an elite service. Elite because it is some gift that God has bestowed on us to share, empathize, as well as relieve pain and suffering of a fellow human being. The judge in the court might give a lot of orders about how to give a good judgment and resolve disputes, but it may not be acceptable to, or it may not be translatable to the persons concerned. Here we have a strange situation where we are not only relieving the physical health as well as the mental health of the other person. So that is why it is termed as a noble profession, and the noble profession has to live up to its standards. What better example can we give of a profession which translates in a very short span of time theoretical knowledge, research onto clinical skill and translates into healing powers, healing responses on the patient. So this is a very unique profession which I feel personally has not been recognized as much as it should be. But don't worry, the pandemic has actually caused it to get enough advertisement without being without indulging in any self-advertising. Today, the frontline health workers, the doctors, nurses are worshipped all over the world for their selfless deeds, and that is what the real appreciation is all about. Whether it came out of fear or favor, we don't know, but it has come, and it is up to us to sustain it, to make sure that we are able to live up to the expectations of our fellow human beings, whether they be rich or poor, young or old, tall or short, male or female, whatever it may be, whether the color is black or white, doesn't matter. We are all the same, and those 3 or 4 qualities which Madam exuded already, that is compassion, feeling for the other person's needs, put yourself in his shoes and imagine how it would be, then you'll realize what is empathy and what is service. If that can happen, the rest can follow. It is easy to impart knowledge and clinical skills, but most difficult part is the attitudinal and behavioral skill. And that, if it can be brought about, it can be a success of the training which you impart on your students, whether they be first-year students or interns, doesn't matter. That behavior skill has to be not only imparted, it has to be imbibed. What I mean by imbibed is we have leaders have to show the way how it has to be done. As they say, a spoonful of medicine goes down easier if it got little bit of sugar. So we have to make it in such a way that it is done in a way that it is absorbable and appreciated by the learner. In that way, it can be actually achieving a lot more translation than just thrusting it down the throat that it is medicine, you have to just gulp it and swallow it. This profession demands a lot of training, lot of patience, lot of self-sacrifice, and a lot of family time. It's extremely courageous of women to choose this profession and excel in it. And this is one profession where I can say the gender is definitely in favor of the women. So we are up to you to show your prowess as leaders. Say to our medical hospital nursing superintendent that please strengthen the middle level of nursing service. Middle level is the ones who are senior nurses, supervisors, ward in charges. It is up to them to take it on themselves as a sense of responsibility, not only to just perform their duty, but also see that the juniors perform with all the qualities that I mentioned and also work as a team. Individually, one can shine, but it doesn't matter. What is important is to shine as a team and be a part of the team. And I promise you, one day you will become the team leader. I'm talking this from my personal example. Leadership qualities are not only taught, but they are imbibed. When they are imbibed, they last longer. They make a character change in your own self, and that character change is copied by many people, and you become a leader automatically. So that is the message I want to give. You don't have to wait till you become a senior person to become a leader. You don't have to develop the skills later on in life. It has to be started from the very beginning. That is why even in schools we have class leaders, school leaders, college presidents, etc., etc. So that this quality has to be there. And transnational medicine is one of my favorite topics. There is no use in learning a lot of theory and getting a lot of degrees unless it translates into action and benefits the persons or the organization that it is supposed to benefit. That is only possible if you have integration with the hospital. We are in a unique position in India. We have large hospitals, teaching hospitals, not very well equipped or facilitated, but still the large ocean of patients who are the real textbooks. I often tell my students, read from the patients and later on go and refer the textbooks, not the other way around. Textbooks are there written by somebody with their own personal experience. But here you are learning by your own experience. And that is the real experiential learning that is vital. I still remember my days in the government Rayapata hospital as a sole house surgeon dealing with 120 odd babies in one ward, not only doing the investigations, treatment, writing case sheets, and also giving injections, because in those days nurses were not allowed to give injections. So using the same syringe and about 4 or 5 needles which are supplied to us, how the struggle was. It was not the right thing to learn, but then that made it very hard and hard working. And without food or water for 24 hours, it's possible. It tests in endurance, and then it really touches your heart when those people, even though they are in discomfort, come and thank you and go. So that is the benefit of learning by experience. But here now we offer in SRM very structured teaching and learning method for the nursing college. When they come here, we are allotting special nursing instructors to accompany them and treat them properly. Doctors have been sensitized. So please use this opportunity. And I think this is the right theme. Leadership begins from the beginning and it matures as you get higher and higher. Leadership imbibes others to follow you. And transnational medicine is what is the current trend, whether it is medicine, nursing, occupational therapy, whatever branch of medicine, health sciences, it has to translate into patient care and patient remains the center of focus, and he or she is our God for all purposes. I once again thank you all and wish you the very best in your webinar. I'm very happy that you have started this. God bless.
Thank you, sir. Thank you, sir. So we will abide all these your suggestions and then experiences shared. So definitely all our nursing fraternity will be getting benefit out of this webinar, and we will put into practice, sir. Thank you, sir.
Thank you, sir, for your wisdom of words. All we need is always your support towards our profession as of now. Thank you, sir, once again. Leaders don't force people to follow, they invite them on a journey. We are honored to have Dr. A. Sundaram, Dean Medical, SRM MCH and RC, to felicitate the gathering.
Respected Vice Chancellor, respected Dean, College of Nursing, respected Vice Principal, and the faculties of College of Nursing and resource persons who are going to talk in this webinar. At the outset, I congratulate the team headed by Madam Kanniyamma for organizing such a wonderful webinar.
Thank you, sir. Yes, sir. With all your support, sir. Yes, sir.
Inviting me to give a special address,
Yes, sir.
I have to thank them.
Thank you, sir.
One more thing is the choice of the topic. I just reserve need of the hour,
Yes.
the research, education, and the practice. There's got a wide gap now, and we are trying the integrated nursing, and it's not yet completed. That's what I feel. We have to go a long way,
Yes.
and it necessarily it's going to help the service better. And as far as the research is concerned, research in the medical field by medical men and women are comparatively less than the other field. Because we are service oriented, we are time mostly spent on the services, and we find less time or we are not able to involve much in the research. But we know that many people are doing research and it is upcoming field. And what we need at this time is the guidance to the students. The students have got a wonderful brain. The young brain needs a lot of things to be cultivated. The service orientation, and also the education and the research. Research should not be left alone. And we need a lot of things to happen. And we know nurses, staff nurses are doing a wonderful job. Nursing profession is the most important field as far as the healthcare delivery is concerned. As our Vice Chancellor said, the whole world is looking at us when the pandemic started. And our never hesitated to do services. And the nursing profession did a wonderful job in that field. That we have to congratulate one and all. And what I am coming to tell you is the young brains, we have to divert them in a proper way. Then only we can find good results. And the leadership, involvement of leadership in that is challenging, quite challenging. We know asking them to do a research, they take a pinch of salt. And now people are oriented towards monetary benefits more than business service orientation. All these things are changed due to the changing environment. And as leaders, we have to change their attitude. As our Vice Chancellor repeatedly telling, the attitude and behavior is the most important than the skill and knowledge. That we have to give a proper direction, and the leadership role is most important. And also by being a role model, we have to help them a lot. The bridge between these 2-3 gaps, we can bring it down by the sincere effort done by the senior leaders like the deans and the staff, senior people who can involve these children into the field they want. With these few words, I thank the organizers for inviting me to participate in the wonderful seminar, and I congratulate them for organizing such a wonderful seminar with good participants. Congratulations once again. Thank you, Monica.
Actually, some more has to still join, sir. Till yesterday, they accepted for more than 900. So still we are waiting for a few more colleges also will be joining shortly, sir. There is some network issues. It is there, sir.
All the best.
Thank you, sir. Thank you for your good appreciating words. We will abide to that, sir. Thank you very much, sir.
Thank you, sir. And the words that you speak have always stayed as your signature in our hands. I once again thank you, sir. It's time for new generation of leadership to cope with new problems and new opportunities. It's time for new generation. It's time for new generation of leadership to cope with new problems and new opportunities. There is a new world to be won. Now I call upon the optimistic research leader, great inspirer, Dr. M. Balasubramanian, Associate Dean Research, SRM, MCH and RC, to felicitate the gathering.
Is it audible?
Yes, sir.
Yes, sir.
Good morning, sir.
Okay. Yeah, very good morning to Honorable Provisy, Dr. Ravi Kumar, Dean, Dr. Sundaram sir, and Dr. Kanyamal, Dr. Leela, and everyone.
Yes, sir.
In medicine, there is a paradigm shift in CME, continuous medical education, to continuous medical education and research. This is also true for nursing. And I have a lot of actually ideas, and probably I will help actually in whatever the way for a nursing research kind of thing. Let me just start with actually one poem actually adapted from Kaviyanbu. Suriyanukko iravil oivu, nilavukko pagalil oivu, செவிலியர்களுக்கோ இல்லவே இல்லை ஓய்வு. கரோனா காலத்திலும் கரோனா கடந்து போகும் காலத்திலும் இரவு பகலாய் பணி செய்தாலும் சூரியனாய் சுட்டெரிக்காமல் அமாவாசையாய் கடுமை காட்டாமல் நித்திய புன்னகையை முகத்தில் காட்டும் புத்தொலி பௌர்ணமிகள் செவிலியர்கள். But whatever you do, there is a say, best is yet to come. We live today where the buzzword is next generation. We need next generation medicine, we need next generation doctors, and so forth. We need next generation nurses too. Therefore, is the emerging revolution on nurse education, practice, and research very apt to this webinar. Today, we are seeing next generation patients also confused with authenticated as well as unauthenticated information from the Google and internet. These patients expect more from doctors, nurses, and the dietitians. In the lighter vein, their expectations are வேற level. Therefore, உங்கள் அயராத ஆயா சேவையும் தொடரட்டும். அதே சமயத்தில் AI, artificial intelligence சேவையும் கற்று தெளியுங்கள். Let the decades-old nursing continue, but supported by digital world nursing too. When precision medicine initiatives started in US, the document warrant the need for precision nursing and precision nurses. I thank Dr. Kanyamal and everyone. My best wishes for the successful deliberation today. Thank you.
Thank you, sir. Thank you very much, sir, for your good appreciation for the nursing and encouraging words, sir. Thank you so much, sir.
Thank you, sir. Your words are thought-provoking, and it has always been a pleasure and privilege to hear from you. With equal pleasure, I would like to call upon Dr. V. Leela, Vice Principal, SRM, MCH and RC, to felicitate the gathering.
Most respected Pro Vice Chancellor of SRM, Medical and Health Services, respected Dean Sir, Medical College, Madam Kanyamal Madam, Principal of Dean of Nursing College, Dr. Balasubramanian Sir, Associate Dean of Research, and all the team members of this organizing program of the day. Wish you all a good morning and a warm, nice appreciation from. And Madam, thank you so much for introducing me during your welcome address.
Yes, ma'am.
And about this program, beginning with Florence Nightingale since 1800, this medical community has developed with evidence-based practice, especially with nursing discipline. And nurses, I would rather say, are the pillars or the backbone of any hospital because they are the first line approach or first contact persons for the patients for during their crisis, or who are the people who identify the crisis of a patient. That is any emergencies, they are the first person to identify and let the doctor know it and handle it. So there is always a leadership quality persisting in each and every nurse or a nursing student even. So this leadership quality is inborn in you. That is what is I feel. And practice that converting that or introducing that into the learning, practicing and converting into research and also the outcome, everything you have to gain, you are gaining the experiences of the leadership quality during your process. So this is era of reflections. When we are thinking of reflections, these students are to be taught to analyze themselves and learn with the need of the society. Then with this, I feel I appreciate, rather than I feel, I appreciate the team for organizing such a wonderful seminar. That is the challenges you are going to face during the leadership, or what are the leadership qualities you have to have, which you will be transmitting to the students, and they will be again following it up in their professional practice. I can bank on this team headed by Dr. Kaniyamma, the whole SRM nursing team, the college, the staff nurses in the hospital, everyone are very good and they are all leaders by themselves now itself. Only thing is they have to address to the challenges and come out with the solutions or share their experiences and find out the solutions. So this is an apt topic for the day, and congratulate you for all, congratulate you all for organizing this program, and thank you for giving me this opportunity. Wish you all a good luck.
Thank you so much, ma'am, your kind words and appreciation for organizing the program. Definitely, we need all of your good collaboration to move with a good note. Whatever we learn, we put into practice, and we need your support from the hospital side, ma'am. Thank you so much, ma'am. Yes.
Thank you, ma'am, for your unaffordable suggestion.
Now it's time to start back our presentation with the engrossing topic, Transformation of the Leadership in Nursing Education and Practice by Dr. Rebecca Sampson, Director of Nursing Research.
The essence of all beautiful heart, all great heart is gratitude. Gratitude creates the most wonderful feeling. It can resolve disputes, it can strengthen friendships, and it can make us better man and woman. Now I call upon Professor R. Vijayalakshmi, Vice Principal, SRM College of Nursing, to deliver the vote of thanks.
Pleasant good morning to all. On behalf of SRM College of Nursing, I am privileged to propose the vote of thanks. We express our heartfelt gratitude to Honorable Pro Vice Chancellor Medical and Health Sciences, SRM ISD, for being with us today to inaugurate the national webinar, and we thank you, sir, for all your support and motivation in all our endeavors. Thank you, sir, for your enlightening words. Your words of wisdom ignited our souls. We express our sincere thanks to respected Dean Medical, SRMMCH, for his notable presence and motivating, encouraging special address, pointing out the need for research and its utilization, significance of training and leading the students. Thank you, sir, for your illuminating words. We thank respected Associate Dean Research, SRMMCH, for being with us and for his inspiring felicitation. Thank you, sir. We express our heartfelt thanks to Professor cum HOD, Department of Microbiology and Vice Principal, SRM Medical College and Hospital, Madam, for gracing the occasion and Madam's motivating words. Thank you, ma'am. I extend my heartfelt thanks to our respected Dean, SRM College of Nursing, for her directions and for the constant guidance and support for the successful organization of the program. We thank the expert members who are sharing their valuable time and their expertise with us. I extend my sincere thanks, gratitude to all the HODs, faculty and staff of SRM MCH who joined us today for today's national webinar. I express my sincere thanks to Mrs. Deena Jyoti, Associate Professor, and Mrs. Priya for coordinating the national webinar activities. We are pleased to have the faculty, students, and delegates from other institutions. Our sincere thanks for your participation. I thank our all SRM faculty for their constant support and their tireless efforts for the successful organization for today's event. We thank the ITKM and the technical team for their coordination, specifically Mr. Kannan sir. I take this opportunity to thank our own faculty for their sincere efforts for the conduct of today's program and our students for their participation. Once again, our heartfelt gratitude to all who made significant contributions for the conduct of today's program. Thank you for the opportunity.
Now it's time to start our presentation with the engrossing topic, Transformation of the Learning in Nursing Education and Practice by Dr. Rebecca Sampson, Director of Nursing Research, Arubade Medical College, Pondicherry. Transformation learning is about changing how you think and the thoughts you think. It involves changing your perspective and acting from a new, more empowering perspective. Now I would like to call upon Dr. Susila, Associate Professor, SRM College of Nursing, to introduce the speaker.
And all. With the blessings from Almighty, a pleasant good morning to one and all. Kind words can be short and easy to speak, but their echoes are truly endless, echoed by Mother Teresa. I am immensely pleased to introduce Dr. Rebecca Sampson, Director of Research in Arubade Medical College, Puducherry. Madam has completed her BSc Nursing in 1976, MSc Nursing in 1982, and PhD Nursing in Community Health Department in 2003 in the College of Nursing, CMC, Vellore. Madam has 42 long years of experience. In College of Nursing, Vellore, she worked as tutor, lecturer, reader, professor, and associate professor. Madam has worked as a Dean in Pondicherry Institute of Medical Sciences from 2010 for 10 years. Madam has worked in abroad as a tutor in Oman from 1993 to 2007, as a graduate midwife program in Queen Victoria Women and Children's Hospital, Australia. Madam has worked as a charge nurse and staff nurse in King Khalid University, Riyadh, KSA. Madam has national level membership in government and other 12 institutions. Madam is a lifetime member in TNAI, Nursing Research Society, life member of Nurses League, alumni of CMC, Indian Red Cross Association, life member PhD Society of India. Madam has attended around 6 short courses in the field of nursing. Madam is a research guide for PhD and PG scholars. Madam has organized 77 conferences at regional, state, and national levels and workshops. Madam has 26 scientific publications and she is author for 8 books and journals. Madam has received 8 awards: King Memorial Award in CMC Vellore, Award from TNI for Enrollment Life Members in 2007 to 9 and 2010 to 11, Best Medical Social Worker Award in 2013, Best Citizen of India Award in 2015, Dr. APJ Abdul Kalam Gold Medal in 2015, National Florence Nightingale Award in 2016, Lifetime Achievement Award in 2016, Best Educationalist Award in 2017. Now I invite Dr. Rebecca Sampson to deliberate the session on transformation and leadership in education and practice. I thank Dean ma'am for the opportunity given. The platform is yours, ma'am. Welcome, ma'am.
Thank you all.
Thank you.
Good
morning, ma'am.
Good morning, all of you, and I am very much pleased to be with you this morning.
Yes, ma'am.
And had been listening to various speeches, starting from Dr. Sundari Edwin, and then inaugural sessions.
Yes.
And it's beautifully organized. It's going on very well. And the Dean, College of Nursing, SRM University, with her team, chosen a right team and chosen right people to deliberate various sessions.
Thank you.
And I want to congratulate all of you for your teamwork.
Yes, ma'am. Thank you so much. And immediately, as whenever I ask, all of you are accepting. So that is my grace. So that is the one which I achieved in my life. So
that is the leadership.
Yes, ma'am. Thank you, ma'am.
Transformational leadership that you are exercising, I think so.
Thank you so much.
So today's topic given to me is transformation of leadership in nursing, education and practice. So the word transformation itself has a lot of meaning. So traditionally we know leaders and supervisors, guides and so on. So what is transformation? Transformation is from what is existing to achieve something new, which is to be appreciable with everyone. So this is what I believe and I want everyone to understand. Transformation is now a trending word and everybody is looking for transformation. Every individual, not only leaders, in the students, faculty, at home, children, everyone in life, there should be a transformation, time of transformation for changes as we are passing through this life. Next. So I thought I'll just give you an outline what I'm going to present. Maybe I'll skip in between if time is not permissible. In leaders, who is a leader, qualities of leadership, pragmatic model for a future healthcare in India, integration of nursing education and practice, which is already elaborately dealt with, and nursing leaders, what should do. Common theories, 4 I's of transformational leadership model, and take-home message, and with concluding words. Next. So now we all know, traditionally, nurses are meant to be handmade in the hospital setting or anywhere. Anywhere nurses are little bit showing their head up, immediately there will be a lot of obstacles to push you down. So that is the thing going on. But now we are, with all these hurdles, we are trying to move on to trusted partnership in the healthcare field. So we have to have the trusted partner. So that each word means a lot. So to transform, trust is important with the healthcare team. As respect for the nursing profession has increased, so have responsibilities, expectations, and leadership roles for nurses, especially those with advanced degrees. So everywhere we see why nurses have to have a higher education. Nurses have to be at the bedside. This is the general feeling, opinion, and concept or thinking of every other discipline, especially with the medical fraternity. So now what we need to break and then bridge up these gaps. Traditionally, nurses have been overmanaged and led inadequately. Yet today they face unprecedented challenges and opportunities. What it means overmanaged and led inadequately, which means every work is pushed onto nursing professionals. If wherever we are, everybody's work is pushed onto nurse. So that we have to, though we are forced to face the challenges, at the same time we have plenty of opportunities to develop also. Now we have to draw a balance. Organizations constantly face changes that require an increasingly adaptive and flexible leadership. This is what one should recognize. Though we are with the various responsibilities, we need to understand what organization is aiming for, how we have to cope up with this. And in addition to changes in nursing practice and education respectively, strong leadership will be required to realize the vision of the transformed healthcare system. So I'm really happy Dr. Sundari Edwin has brought out very well the integration model which is practiced in CMC Vellore. I'm also born and brought up, read in CMC Vellore. We were almost batchmates, though with 1 year of difference. So we carry the same values of mission. So here, the leadership is very much essential to have a competencies to take care of patient requirements as well as for educational requirements, demand for the quality and which are demanding for quality care as a driving factors. Leadership ability is an essential component of both administrative and clinical practice. We cannot just say, we are an administrator, I cannot do anything. I don't want to do this job, that job, etc. Next, please. Now let us see a little bit on who is a leader, whom we believe as leaders. One who directs others, occupies the chief position, and therefore has the responsibility to love and care for his followers. I want everybody to underline these last two words, love and care for his followers or her followers. One, no doubt, we occupy chief position as leader and direct others. Please do this. It comes to me automatically, please. But many do this. I told you to do this. Why you did not do? This kind of abrupt, impolite statements only we hear from leaders. But what is expected of a leader is the leader has a responsibility to love and care for the fellow followers. Next. And how do you get that love and care? What kind of qualities one should possess as a leader? One is the vision. What is our vision? Am I only looking for my self-respect and self-growth or only for the chair position? Or are we understanding the institutional vision, the organization to whom we are working with? Or what is the vision of nursing practice? What is the vision for nursing education or research? So as a manager or leader, one should understand this. Clarity in thinking is a vision. Far-sightedness is a vision, not just for short-term goals or short-sightedness. Then coming to faithfulness. Whatever position we are placed in, we have to be faithful, trustworthy, then caring. When we want to care, we should have that love, passion for our work, diligence, and trustworthy. Whatever responsibilities we are giving, we have to be sincere in our work and honest and carry out our responsibilities. For all these, what is needed is wisdom, not only the knowledge. That's why it is highlighted here. Wisdom is the fundamental to a leader. Otherwise, having a knowledge, bookish knowledge is not enough at all. Knowledge boasts, and say, there's a saying, knowledge boasts and says that he knows everything. It knows everything in the world or under the sky. But wisdom humbles itself and says, I know nothing. That means those who have wisdom, they are open to open-minded and willing to learn even from the lowest, even janitors, up to the administrative higher authorities. So this is what is expected. The wisdom is needed for critical thinking and decision making. Now coming to a leadership, it is the process of influencing the activities of an organized group in its efforts toward goal setting and goal achievement. So it is very clear. It is one should be able to influence. There should not be any resistance from followers. Meaning, for positive critics, welcome. But for everything, no, it is not possible for us. We cannot do this. Why we should do this? This kind of things, resistance when you face, then you should be able to persuade and influence the activities of an organized group with the efforts that you need to take should lead you to goal achievement. Next. Leadership is an attempt to influence groups or individuals without the coercive form of power. That's why I said love and care is important for a leader, not to use coercive form of power. What is coercive? Threatening. If you don't do this, I'll see to this. I will take care of you. I will see your performance, how you are going to get your promotions. This kind of coercive form should not be used when you are influencing the groups to achieve the goals of the institution, whatever you are called for. Next. Competencies in leadership. So those involved in the healthcare system, the nurses, physicians, patients, and others play increasingly interdependent roles. Here I want everybody to understand interdependent roles. Problems arise every day that do not have easy or single solution. So we are not left alone by ourselves as nurses, but we are with the groups of varying levels. So we have a physicians, and then we have patients and other core disciplines like other supportive system. So we face problems, challenges every day, but we have to look for right solutions. There is no one single solution. That's what it says. And we need to understand we are interdependent for providing quality care or quality education. Leaders who merely give directions and expect them to be followed will not succeed in this environment. I hope all of you agree. Definitely, when you expect only, my job, I'm a leader, I'm only give direction. I have nothing to do. It's your duty. You are told to do. You won't do. You will never be a successful leader because you have forgotten the interdependent role to interact with other disciplines. The next competency one should have is what is needed is a style of leadership that involves working with others as full partners in a context of mutual respect and collaboration. And already Dr. Sundari Edwin has mentioned the mutual respect for each other is far more important and collaboration is important. Otherwise, no one will respect. It's a give and take. Unless you give respect to other discipline, you will not receive and there will not be any collaboration and there will not be successful events for us in the challenges that we want to resolve. Next. Next, please. Next slide, please. Now, a model for future healthcare, I just thought I'll share with you. Adequate and effective human resources are critical for people's health. So ultimately, the profession, nursing profession is practice oriented. So we are here to provide care to individuals, families and community. And that's why we give education we educate our students in such a way to care for others. So now people's health is the main goal. Competent and adequate nursing force with high relevance to today's healthcare system and delivery are important thrust areas that need to be addressed worldwide. So everywhere we see, even ICM, Everywhere you see articles, so shortage of nurses, switching off their roles and not liking their own profession, but trying to do something different. In today's healthcare in India, providing quality of education and clinical training to provide quality healthcare is a great challenge. Beautifully addressed previous session. What are the gaps? I'm not going to touch again that one. So this is a great challenge. We are forced in many institutions. We are working with the government institutions, quasi-government, private, trustees, etc. But many times there is force from different organizational level. Okay, you have to show the results. You have to push the students without even performing well. And they don't even know, they have not seen the patient, but they are expected to pass the exam. They are expected to write, especially last year with all lockdown time, online classes. So it is very, very challenging. And we need to really address this challenge, and leadership is a critical element in this meeting the challenge. Next. Next, please. The collaboration between education and service is the strength to provide quality care, and education and practice each provide direction to one another. This is what we have to understand. Without seeing the patient, what for you have to learn? How can you learn? Somebody from university asked me, Madam, BSc nursing, is it academic or practice, clinical oriented? What to answer? Is it academic or clinical practice? It is a both. It's a profession where you learn the theory to provide care, skills. So to provide quality care, education and practice will direct each other. Then education influences best practices in clinical area, and likewise demands evidence from practice influences educational offering. So what is required for patient care? You need to educate. What you educate, you need to practice. It is a vice versa. You have to interact with both sides. And teacher should be skillful in patient care, then only she will be a best teacher. Next. Next, please. Now, the answer is nursing is a practice discipline, requiring both knowledge and skill. It is important to have qualified nurses in the clinical area, both. Similarly, it is important for the nurse educators to be part of service to keep them updated with the clinical skills. Next. To pool the resources of both educators and practitioners. Integration is the only and an ideal situation. It facilitates both student learning and quality patient care. So it facilitates both student learning and patient quality care. Integration also improves interpersonal relationship between the nurse educators and practitioners and creates healthier and clinical environment, facilitating staff-student learning. So here, since it's already elaborated, I just want to say many medical college attached hospitals, they are reluctant to take up this integration model. Why? Because they are, one is maybe, it's my opinion, personal opinion, it could be with everyone. They are not competent to go and do the patient care, give the patient care. Or they might feel, why should we go to practice? I'm an educator, I should be only in the college, not in the hospital. Or hospital people may think they will command or supersede or override us. So this kind of mutual trust is lacking. That's the reason why the bridging, the gap is becoming more and more, where even though we have an opportunity to integrate, we want to work in isolation. But we are forgetting that integration improves interpersonal relationship between the educators and practitioners and improves the learning for both students and staff nurses. Next. Next, please. Here, the concept of integration of nursing education and practice, already since Madam has dealt with this, I don't want to go on with this thing, and I hope all of you understood now. Next slide. Next slide, next slide. Now, coming to nursing leaders. What leaders should do? Nursing leaders must translate new research findings to the practice environment and into nursing education, and from nursing education into practice and policy. This is the thing that transformation leaders should do. So, first thing, evidence-based. Anything that we do, there should be a proof. Is it right? How can we take this as a confidently put it into practice? That should be revealed first. So research results must translate into a practice environment and to the policy level. It should be. And again, I'm touching the previous speaker's quotes, and it has to be implemented from education to practice and practice to education. Now, few common theories that I wanted to touch on: the great man theory, trait theory, behavioral theory, situational theory, contingency theory, path goal theory, transformational leadership. We have moved from the oldest theory, great man theory, to the leadership of transformational leadership. So each school of thought talked about some kind of leadership. Great man theory talks about, next, born leaders. Leaders should be all born, not made. Okay, so that is the trait required. This is what the great man theory talks about. Next. So with the belief that people were born with these traits and only the great people possess them. So only such people only lead to be leaders. But over the time it is changed. Trait theory. Trait theories, certain qualities are required for leaders. That is ambition and energy, desire to lead, honesty and integrity, self-confidence, intelligence, and job-relevant knowledge. So these intellectual traits, okay, are important to differentiate the leaders. So trait theory talks about leadership's thought, personality, social, physical, or intellectual traits which differentiate the leaders from non-leaders. So not necessarily born leaders. Behavioral theory, the way someone performs the task. Based on this, the leaders are identified. Harassment theory, authoritarian, democratic, laissez-faire, and task versus relationship theories. So one of these comes with the authoritarian. Next. Situational theory. Situations. Based on that situation, one is made as a leader. So these theories suggest that traits required for a leader differ according to varied situation. So in a particular situation, this leader is not suitable. In this particular situation, this leader is not suitable. So in that way, based on situation, the leadership style changes. Next. Contingency theory. Again, he argued that he identified three aspects of situation that structures the leader's role. So this is again, it moved from great man to stage by stage to contingency according to the situations again. Next. Path goal theory. You have to make a path. Lead them to give them a direction. So here this talks about theory that is the leader's job to assist followers in attaining their goals and to provide the necessary direction and support to ensure that their goals are compatible with the overall objective of the group or organization. So here you can see this picture, how a student or a junior is trained and directed, showed a path, and then to reach the goal. What are the steps to achieve this goal? So this is the leadership theory talks about. Okay, so now coming to the last theory, which is called transformational leadership. It is the leadership style in which leaders encourage, inspire, motivate employees to innovate and create a change that will help grow and shape the future of future success of the institution. Here, every point is very, very important. So, one thing, encourage. First and foremost thing is encourage. Which leader encourages the followers? They are afraid. If I encourage, my subordinate will take the chair. Otherwise, also they will work on different levels. That is a different issue. But many leaders don't want to encourage, prepare the juniors. Inspire, nil inspiration. Seeing the leader, everybody will get demotivated. And then motivation, no motivation, but they will suppress. What? To innovate or to bring in change that will help to grow and shape the future. So everywhere hurdles. I'm telling the negative points because in existing system, in leadership, many, maybe I can say at least 75% are with this kind of motives that they're afraid to prepare their followers. So good leader always prepares the next leaders, next level of leaders. That's why we have even principal, vice principal, etc., and the head of the departments, and then class coordinators, and all these system is developed because you are introducing them to leadership so that they will function and they will be motivated to take care of at the different levels so that they will reach to the heights when time comes, when they are successful at every step and bring to create change. The change is another problem. Leaders are afraid of change. They don't want to see the change. Resistance is created. So where is the shape? Where if you're not growing, and there is no change in the leadership to shape or change your organizational setup and bring forth the success of the institution. But everybody will be successful, working for their own success, not for the common organizational goals. So transformational leadership is defined as an approach that causes change. I'm talking now positively. It causes change in individuals and social system. Unless one individual changes, there is no change in the social system. In its ideal form, it creates valuable, positive change in the followers with an end goal of developing followers into leaders. It is amazing to see the true transformational leadership. Suppose if I'm on off duty or on leave, I'm confident that my followers will take care of my role. Then only you can say you are a transformational leader. If not, if there are a lot of problems during your absence, and then that means the followers are not prepared, are not transformed to accept the change and lead. Okay, so next slide. Next slide, please. So, transformation leader is one who commits people to action. The commitment is very important. Commit people to action, who converts followers into leaders, conversion, and who may convert leaders into agents of change. Not only me, I must make everyone who follow me to be an agent of change. So that means it is like a cell multiplying and our cell into like a system into organs into tissues or cells, etc. Vice versa. Same way, a body is an organization. Every system is an organ, and every cell is an individual who should be a positive change, not a negative and causing carcinoma or cancer. Okay, so empower staff to have a vision about the organization and trust them to work towards a goal that benefit the organization. Next. Next slide. See now, transformational leadership. There are few things that we need to concentrate on. Modeling, role modeling. Even in the inaugural session, the dean was telling that role model is important. Encouraging heart, encouraging the heart. Every word is a very sensitive for a leader. And inspiring, shared vision. Not only for me, only leaders should know what is happening in the management. Others should not know. This is the kind of vision everybody exercises. But one should transform. A leader will share the vision of an organization. This is what we are aiming at. Let us work together, enabling others of followers who can work towards the success. Then challenging the process. Every time, oh, this is difficult, that is difficult. No, let us challenge this. Why not? Why can't we achieve this? Go forward with the trust and confidence. Face the challenge. So this is what is to be done through transformational leadership to the followers. Next. Next slide. 4 I's. 4 I's of transformational leadership. Idealized influence. Leader serves as an ideal role model for the followers and is admired for this. Inspirational motivation, individualized consideration, intellectual stimulation. These are the 4 I's. Okay, so transformation leaders challenge followers to be innovative and creative. So it is not by age, by experience, one will become intelligent. It's not necessary. Even a student who is your junior most can be excellent multitasker, and you need to identify the strengths and tap the resources to achieve your goals. Next. Next, please. And we are always faced with 5 types of people around us. Naturally inspired, naturally motivated, naturally open-minded, naturally passionate, naturally grateful. Here, you very rarely you will find to have everybody like this. But transformational leader can create to your all followers to be like this. It is a great challenge. Next. You see now, KAP is over. Knowledge, attitude, practice is over. I say ask. ASK. Attitude comes first, skills next, knowledge last. Unless you have a right attitude, you will not learn right behavior. Otherwise, through your right attitude, right skills, right knowledge you will gain, because nursing is a practice profession. So skills, what kind of skills? Listening, questioning, communication, responsive, experiential objectivity. Attitude, integrity, hard work, commitment, mature, positive, sensitive, emotionally stable, non-judgmental, enthusiastic, and empathic. And knowledge, even through this 85%, 15% knowledge, you can very well achieve your goals. I don't mean knowledge should be very little. Through this, your knowledge, intellectual skills, your knowledge should be intellectually, your sound. This is what this model talks about. Our leadership questions all these. But again, I'm telling that the negative aspects, nobody wants, we don't like, leaders don't want subordinates to question them. Who are you to question me? I know everything. Next slide. Next slide. We have come to conclusion. Leadership does not mean dominating. Leader's job is to get work done by other people. Effective leadership means effective and productive group performance. Next. Take home message. However, we are only at the beginning of long journey. What we need to do is change. Transformation meaning a change. Change is tough. Need to realize that the workshops, conferences is not likely to cause sustainable change, but next, to really make it happen, nurse leaders need to be placed enough at the administrative and bedside areas to deliver quality nursing care, placement of right person for right job with the right qualification to achieve right outcomes. Then only you can achieve transformation. Otherwise, every step you face the challenges, hurdles, and though you have a mind, you will not be able to achieve. But I don't want to discourage any of you, but every individual can work towards positivity to bring in change. And unless you have challenges, we will not have energy to work. You face challenges, you will be more energetic and you will be successful. And wish you all the best. Thank you.
Thank you, ma'am. So very much practical and various models with depicting examples how to create a leader, and you need to be a follower first, and then from the beginning in the morning. And exactly what you told, I believe in that, ma'am. I believe in that because one person, if I am on leave or off, that it should not the organizational responsibility. So next person will automatically have to take care. So that's a thing. So it has to go. It is not a statistics. We depend on only on me means it is not a good leader. So I believe in that, and I too also develop my followers in such a way. If one is not there, next one hand over, and then the some guidance if necessary. We can through phone and we can guide them, but they have to take up responsibility. They have to do things on the day. They have to manage. So that is the thing. So I believe in that. I accept 100%. And I believe, and all rotations for everything, maybe academic or maybe that organizing chairperson or whatever it might be, the people are keep rotating and they are learning their skill through their experience. If the opportunity, if the leader provide only, they can also develop. I believe in that, and I believe I am also following that. In that, I'm enjoying your topic and the leadership models from the great man theory to the transitional. So you have taken very smoothly. You have taken, so that is very, very essential to easy to understand from the lower group of student level. Leader is not only the bond. So it may be, but it has to be enhanced by the leading people. So that is the thing. They have to accept both sides the responsibility. As a leader, we have responsibility. As a follower, they have their own responsibilities, and we have to know the line between which is the demarcation. That only the respects and other thing. No arguing or coercing that thing, this thing and all. It is not good for both for the follower and for the leader. So we need mutual respects and mutual understanding will only enhance the leadership, and the follower also can be created into leader. So both vice versa, you are responsible. So I believe in that. Very good presentation, ma'am. That is the need to make it clear for all of us. So thank you so much, ma'am, once again. So we are very happy to be.
I'm also happy.
Yes,
and my fond subject, this one.
So,
Because I believe every individual student rep we create in the classroom. So that is the leadership to be introduced from the class, even from a pre-KG, there is a class rep. So it is cultivated, the environment, the situation, the follow. So, but only thing, the attitude of individual is very important. You want to learn, you want to face the challenge, opportunities are there, open. But you don't want to use the opportunity, then no one can help you.
And
That's the
another
thing.
one model also, it's so impressive that is learning that not KAP. So
Yes.
so I believe in that. So really, I salute for that, madam. So
Thank
because
you.
attitude and skill is foremost important. We need knowledge, but that is skillful and analytical knowledge. 15% is adequate. It is not meant what is the entire knowledge. What you told that is correct. Analytical knowledge we need to have 15%. That is more than
Yes.
adequate. Intellectual and that asking, that is attitude and the skill is equal, so that is 85%. So really it's a very I salute for that model. So that only it will actually lead us any type of a person. So that's why if we know the gap, because all the academicians without any practical experiences, if they couldn't able to justify what it is for the students or for the service, whatever it might be. So that's why this is a renowned term. So it is very nice and very apt model. So really I believe in that, madam. 100%. Yes, ma'am.
Thank you. Just if you permit me
Yes,
2
ma'am.
minutes, I want to share one example.
Definitely. Yes, ma'am.
I was in basket.
Yes, ma'am.
Supervising students. As usual, the students I went for clinical supervision. They stood. Once one girl stood on one leg at the foot end of the patient and writing. Okay. Writing, and then I went, did you speak to your patient? No, I'm writing, I'm busy. The woman is student. Then see, you first thing just say hello to your patient, and then if you do this, and of course I said, you are assessed for all your procedures, your performance checklist is there. We have to explain to them everything, the introduction itself. Then she told one word, Miss, if you don't give a good evaluation, I will not come to the institution. I will not come to the institute. Then I said, immediately I said, I was 3 months old in Muscat, just went. Then I said, okay, sit and sleep at home.
Okay.
And then she said, if you don't come to the institute, you will go back to India.
Okay.
You know, this attitude of students, what I mean to say, attitude is important.
Attitude
She
is
is A grade student. She will not get 49 out of 50 also, 50 out of 50. That kind of student. Knowledge-wise, she's excellent, 100%. But her attitude is 0 out of 100.
So that is the
and
one.
skills 0. So our nursing is a practice profession. Then of course I dealt it separately, a big story that I don't want to take much time. So that is one thing. So now our students also same.
Same. Yes, ma'am. India also.
I was examiner for fundamentals. And external examiner was there. I had to wait. And we set the tray. And we put thermometer and the thumb forceps, etc. And we showed, please name this instrument. She saw that and said, eyebrow plucker.
Oh!
Okay. This is the situation. How to, these are all challenges for teachers. How do you make your leadership as a transformational leaders? That's why I'm sharing this example. So everybody will face challenges. But it's up to us to change the attitude. It's a big challenge, and learning the skills is a big challenge. Knowledge gain anywhere you learn from books.
Anytime anyone can acquire knowledge. Yeah, that is true, madam. So that is no doubt in that. Really, I am very happy, and you also appreciate the apt topics. So I am also very glad to receive all the informations from all the eminence as like you, Madam Sundari Edwin, ma'am. So yeah, everyone is very well established, skill-oriented persons, and they shared in a better way for the students to easy to understand what is what. So they have to take as a take-home messages, as a life messages. They have to be in nursing till their existence of life. They have to follow that. So that's the thing. Thank you so much, ma'am.
Thank you very much for the opportunity. I enjoyed. Thank you.
Yes, ma'am. Thank you so much, ma'am. Thank you. Spending your time and giving a good cause. Thank you, ma'am.
Thank you, ma'am, for your motivational speech on transformation of the leadership in nursing education and practice. Thank you, ma'am.
Ma'am, there is one student named Pallavi has asked a question regarding which theory is used for leadership. Ma'am has discussed all the theories, but she has asked a question.
Ask for a theory. Which
Yes, ma'am.
theory?
Rebecca.
Where to use? She is asking for.
Yes, ma'am.
The theory. So the students' answer for that is that all the theories or the models, it is not fixed. Madam has very rightly told which place, what kind of theory can be utilized. With experiences only we can learn. Now the current translational theory, that is the leadership to follow that, the translation, the transformation of leadership. So that only Madam was emphasizing. And from the primitive, she explained very well how it originates as like a trend, and we cannot say only one theory in one place. So one may be suiting for one situation, one may be suiting for another situation. Now the current trend for a transformational leadership, why she was focusing more, because we are in the gap. So the leader has to identify the gap. Where is that? Maybe that the nursing theory, or maybe that where is the gap. So the practice gap is there, and then the research application is not there. So that's why the leader should be as like the transformation leader, and we have to translate things from theoretical bedside to from the classroom to the bedside, and from the research to the bedside. So this is the one triangle we need to help with that. We need to accept things, and we need to act as a multicultural discipline model we can able to use. And if you know all the models, where which situation it is better, so you can utilize that. We cannot say only one, so this is good or this is good. So we need to know about all the models and leadership model, and utilize it is when the time where the situation occurs, you have to apply it. You have to know for everything and apply it effectively in effective situation. So that may be the answer, I think. Madam also will like. Yes, ma'am.
Just briefly.
Yes, ma'am.
So you rightly said.
Yes,
so the leadership, no one leadership is applicable for any situation.
Yes, ma'am.
So depending on, it's a triangle, epidemiological triangle. Like that, leadership triangle is there.
Yes.
I thought I'll just tell this.
Yeah, please.
Leader, situation, and the environment.
Yes, ma'am.
So if a leader, she should assess what kind of followers she has. Are they all new people? They don't know anything, and then the environment is new and everything new. Then you have to go with mostly on a bureaucratic style or democratic style and authoritative. Proportionately, you have to use.
Yes.
Depending on the situation.
Yes, ma'am.
Next comes, if you have all known, your followers are well developed people, then you change your leadership to democratic and transformational.
Yes.
So no one leadership is suitable for any situation. Combination of these leaderships should be used.
Yes. Yes.
And in research, those who are doing research, they have to be independent. They should be allowed laissez faire, meaning independently. No need to somebody to be behind your back and push.
Yes.
It's an independent work. So you should be allowed. So this is what. But transformational should apply, adapt according to the followers and according to the situation to match. And then ultimate goal is prepare everyone to take up the leadership.
Yes, yes.
To be to assume the responsibility. To be innovative. Innovative means more creative, and with more innovation means new things. To invent new things, new knowledge, and make your college or situation very colorful, bright. Otherwise, gloomy it will be. So this is what it means. Okay, good question.
Thank you, ma'am. It's good thinking. So I appreciate that student. So that applause for the students' doubt. So I think we are very proud. So the students are very active in listening. So we are also very much happy to hear.
We are encouraged.
Yeah, that's the thing. So thank you, Ma, for the good question. Thank you. Convey the regards to the students. Yes. Thank you, ma'am.
Yes,
Thank you
ma'am.
so much, ma'am. Thank you, ma'am. Yes.
Thank you, Dean ma'am. Thank you, Rebecca ma'am. I hope the delegates have got the answers for the questions. It's better to debate a question without settling it than to settle a question without debating it. Without debate and criticism, no administration can succeed and survive. Here goes on an awaiting debate session on healthcare technology in nursing practice, a boon or a ban. An inspiring speaker, Mrs. K.P. Aparna Devi ma'am, Principal, Sri Santoshi College of Nursing, as a moderator. I request Mrs. Usha Priya, Assistant Professor, SRM College of Nursing, to introduce Mrs. Aparna Devi ma'am.
My privilege and honor to introduce Professor Abanna Devi ma'am. Ma'am had completed her BSc Nursing under the Tamil Nadu MGR Medical University in the year of 1995. Ma'am completed her MSc Nursing under MGR Medical University in the year of 2007, and ma'am currently pursuing her Bachelor of General Law. Ma'am started her role as a clinical instructor in the year of 2005, and now currently she has been principal at Sri Santoshi School and College of Nursing from the year of 2012 to till date. Ma'am have totally 23 years of teaching experience. Ma'am have received the Best Teacher Award from the Tamil Nadu MGR Medical University, Chennai. Ma'am had received Long Service Award from Sri SRM Gokulam, SRM College of Nursing, SRM University. Ma'am received Patukuyil Award from the great poet Mrs. Surada in Ulaga Kavinar Peravai. Ma'am participated in the activities of NSS program and ma'am participated activities in National Cadet Corps. Ma'am received Asia Pacific International Award from Global Achievers Foundation, New Delhi. Ma'am received Indo-Nepal Gold Star Award from the Economic Growth Society of India, and ma'am received Educational Awards Excellence Award from the Global Achievers Foundations, New Delhi, and ma'am received Bharat Viswabhushan Saman Purashkar Award from the Economic and the Human Resource Development Association, New Delhi. Ma'am received Indira Gandhi Siksha Ceremony Award from the International Institute of Education and Management, New Delhi. Ma'am received Honorary Doctorate Award from Dr. Radhakrishnan Teachers Welfare Association, Bangalore. And ma'am has a resource person in many workshops and the conferences. And ma'am has an inspector in the Tamil Nadu Nursing Council, the Tamil Nadu Dr. Injia Medical University. And ma'am is a resource person in various conferences and the workshop. And ma'am has the extracurricular activities like writing poems and Tamil scripts. Trying not to become a man of success, but rather to become a man of value. Now I welcome you, ma'am.
A very good morning to all. Can you hear, ma'am?
Yes, ma'am.
Today is the day, a debate. Normally, I love debates. Now it's the time to introduce the members. The main topic on healthcare technology in nursing practice. It's a boon or a ban. Without technology, we cannot survive. Healthcare technology, which is having a main role in 20th century itself. A simple debate, I can say tech and touch. Let me introduce the members. Healthcare technology in nursing practice, a boom. Ms. Sveta from Arulmigu Meenakshi College of Nursing, and Mr. Christopher from Rajalakshmi College of Nursing, and Ms. Jessica Sharon from Venkateshwara College of Nursing. It's a ban. Healthcare technology in nursing practice, it's a ban. These members are Mr. Praveen Kumar, Sri Ramchandra College of Nursing, Ms. Surya, Tahur College of Nursing, and Ms. Shalini from SRM College of Nursing. Welcome you all. Let us start now. Whether it's a tech versus touch. Now I call upon Ms. Veta from Arulmigu Meenakshi College of Nursing. She will speak about healthcare technology in nursing practice. A boon. Please welcome Ms. Veta.
Good morning to one and all gathered here. It's a great day where I'm going to speak about healthcare technologies in nursing practice is a boon. Healthcare, all you are afraid that technologies and robots these days will take over the jobs of nurses. No, exactly no. Healthcare technologies are not going to replace the nurses anytime soon. But not matter how scary the future might seem. Don't think more. These are all of truths and fake news and imaginary dystopies. We are undoubtedly in the middle of technological revolution in world, and here so much of nursing practices too. But we say medical technology is only a tool to make patients' care more efficient and effective, to improve safety and speed. We cannot stop technological development sooner. And later, we will find out that all areas of our life have been transformed through various digital technologies and day-to-day lifestyle too. Technological revolutions has been in the healthcare and nursing practices too. We have entered exciting new frontiers of state-of-art of gadgets and high-technique communication systems. Nurses have been enhancing and developing their technical skills to keep up with those emerging technologies in their following areas of some of them are robotics, electronic health records, digital healthcare technologies such as artificial intelligence, virtual realities, and nanotechnologies, 3D printings and genomics and genetics too. Computerized physicians, computer physician orders entries too. In some of these well-equipped hospitals, the nurses and healthcare teams should have, we are now familiarized with those latest developments in order to able to control those technologies. Some of them which we are used with patients are bane finding tools. Some I have included with this. Echoes veins, which will help nurses in inserting peripheral IV catheters by providing an immediate and clear image of veins using just 2 button controls. The other advancement in potential to transfer healthcare is STETI, which are used, it's a modern stethoscope, nothing but it was used in analyzing heart and lung sounds. It can be used with Bluetooth and operating around smartphones applications like with our mobiles too. Chip monitor blood sugar levels. Now it was constantly monitoring the blood sugar levels in the real time. It works in artificial intelligence algorithms. It was in technological developments too. It was used within software. It can be administered glucose and insulin via the drips. The patient can connect it to the drip connected to screen. It shows the metrics of the patients, and it will automatically intimate the patients with sugar levels, and it will insert a glucose and insulin via drips. Patients monitoring systems with the computers. Nowadays, it was reducing. It can be used to visualize the patients at a time. 3D printers are used nowadays. Healthcare trackers and wireless sensors are used. Medical tricodes, which is nothing but a palm-sized gadget, which can measure ECG and heart rate, oxygen saturation, and temperature, blood pressure too. Some of the importance of healthcare technologies in nursing practices are remote monitoring assets are used in diagnosis, treatment, and monitoring of chronic illnesses. Electronic health record maintenance, in which the data is available on the system for fast and effective access, which were easy to use. Medical devices such as infusion delivery systems with ventilators are used in emergency situations. Quick and timely treatment is essential to save the lives of people. So now a drug delivery system with barcodes are used. Modern diagnostic and analytic and informatics are used in local and government global health trends. Electronic nursing tools ensures times and effective interventions. So as a nurse, we are challenged to learn those skills required to use emerging technologies and integrate them into their professional practices. Technological learning curves as nurses can be steep, but the good news is that tech advancement provides better tool for provided patient's outcome. Nurses need to develop new skill sets to take advantages of technological advancement in communication, in required expertise to obtaining information and relaying that information and data properly. So the technological advancement happening in the healthcare today are truly life-changing for both providers and patients. While in such pandemic situation, the government had provided many of the robots for drug deliveries. Wherein 3D printings are nowadays, it creates a model of a person's heart or chip monitoring for certain diseases. There is no doubt the future of medicine and nursing practice is leading in an exciting direction. One potential benefit of new technology is that they may eventually free up nursing times for other traditional practices and care and patient-centered activity. So I concluding my speech that exactly technology were used were boon to the healthcare in nursing practices. Thank you.
Thank you, Ms. Shweta. She's telling, I don't want to go to hospital. Just a robot is enough. Robotic nurse. She will come. With the Bluetooth, we can do anything. Software is enough. We can reduce all hard works. Everything in our palm. The world is in our palm. Yes. Thank you. Now I welcome Mr. Praveen Kumar. He's telling about new technology have a potential to increase efficiency and improve our health outcome. Now welcome Praveen Kumar to talk about it's a ban only. With the technology, there is no good things. Please welcome Praveen Kumar. From Sri Ramchandra College of Nursing.
Very good morning to one and all gathered here on this auspicious occasion. Today's topic is healthcare technology in nursing practice, whether it is a boon or ban. I'm going to talk about it is only ban because the first quality of nurse, that is a love and affection itself reduced. There is no timing for love and caring. The Sweta said the robot in our hand. The robot is in our hand. The robot in our hand means why the nurse should be present at the hospital. Then basic skills. Basic skills of nursing and nurses are reduced because while checking pulse and temperature or respiration. Not temperature, pulse and respiration are done in now only done in machines. Before and all, we are using in a hand for checking pulse and respiration in 1 full minute. But now they fix the pulse oximeter or any monitor. They go anywhere and do the activities to other patients and come after 1 full minute and checking what is the pulse rate. Because I don't want technology is unnecessary, but we want to use wherever it is necessary. Then they always dealing with machines and they are working like a robot. In current generation, the nursing students are lacking the knowledge of basic skills. In next generation onwards, no nursing services are needed, I think, because the machines and monitors are done the nursing services and role of nurses. All are calling about robot nurse, not registered nurse. Then in a hospital, protocols are maintained. Yeah, it is good. But this technology is destroyed the individual assessment of our nursing skill. For example, one patient has raised BP of 150 by 60. Suddenly the nurse go to the near to the nurse station and call to the doctor. What I want to do. They tell give antihypertensive drugs. The nurse also administered antihypertensive drugs. Just in before past 10 years or 20 years before, the nurses are good in nursing skills and nursing services. They find out the cause and then then go to the doctor, because the technology has not improved like that and not destroyed like that and put laziness nowadays, the technology. In before 10 years back, the nurse, what will we do? The nurse sit along with the patient and talk to the patient what was the cause. Just you sit along with the patient, you talk also, the BP will be fallen and come to the normal. So there is no technology needed. So technology destroyed and put laziness only. Then now the problem is around the COVID-19 problem. The entire world has put down lockdown. Suddenly it happens while electricity problem like tsunami, volcano, like that happens, means electricity and network also connection also get a problem. It's also not working. So the nursing skills are more helpful in that time only. The technology are not come and help in that time. So don't regret the skills and services. Wherever it is necessary, please do the service and skills in necessary. Then nurses' main role. What is the main role of nurses? Means give health education to the patients. Because we are not going to diagnose. The doctors only diagnose. We are going to give the health education. So technology are improving, but health education to the patient by the nurses is reduces. That is decreases. For example, patient is complaining, I have fever. So the nurses suddenly the nurses are having many skills to reduce the fever, like a cold compress, like that. But nowadays we prescribing paracetamol in hospital or wherever, in clinic, wherever. But we are going to the home also. They are practice in 1 day, 2 day fever means they take paracetamol. They do not do any cold compress like that. So it is always technology is going to be banned. And then technology has improved, but poor people may be affected, because technology has improved, money to the hospital has been increased only. So what are the poor people can do? Then nurses' main role is writing, main thing is writing nursing care plan. All the nursing profession, like nurses and nursing students, all the faculties in before 10 years are expected in writing nursing care plan. But now they are very laziness to writing nursing care plan, because the technology has improved. We are going to the hospital for working, means they are dealing with the computers. So healthcare technology in nursing practice is always banned. So that is the concluded. Technology has been helpful wherever it is necessary. Please use nursing skills possible more times. Thank you. Thank you for the opportunity.
Ma'am, unmute, ma'am. Ma'am, excuse me, ma'am. Unmute. Yes, thank you.
Thank you, Praveen Kumar. He focused on a touch, a soft touch, heal everything. Technology should improve your life, not become your life. A social, interpersonal relationship is very important. Who are all affected from Corona, that isolation, how they will feel. He focused on that. Thank you so much, Praveen Kumar. Now I call upon Mr. Christopher He is telling about healthcare technology in nursing practice. It's a boon. Please welcome Mr. Christopher from Rajalakshmi College of Nursing.
Thank you, ma'am. Thank you for giving me this opportunity. Let me start by saying technology won't replace nurses, but nurses who use technology will replace those. Okay, Mr. Praveen Kumar said that nursing skills have reduced during this technological rise. But you can't expect not to use technology when there's an emergency situation. In an emergency situation, there's a need for this technology. You can't be checking pulse or blood pressure for a cardiac arrest patient. In emergency situations, these technology is needed. I'll start. We live in the 21st century where there's a technological advancement in every area of life. When you think about nurses, the first thing comes to our mind is a nurse checking a vital sign with a thermometer. Yes, mercury thermometer is the most commonest tool used by the nurse every day. But today, wherever we go, there's an infrared thermometer gun pointed at you. Technology is being pushed into our hands, whether you like it or not. And if we do not adapt to the situation of the changing trends, nursing will become an outdated profession. So the argument that the nursing healthcare technology in nursing is not a boon is a not valid argument. Looking back to the past few years, many people would have said, would have been able to understand how significantly technology would affect the way we work, live, and play. Patient care has drastically improved. I stress this point that patient care has drastically improved by these technological advances. So have nurses and doctors who use newer technologies. Over the years, there have been major technological enhancements that changed the nursing field. Today, these advancements are being used by top hospitals and healthcare facilities all over the world. By looking at each of them, we can surely say that healthcare technology in nursing is a boon. First, I'll talk about the enhanced communication technology. In 1980s to 1990s, nurses used pagers. Fast forward nearly 20 years, and each nurse carries a smartphone with the ability to order pizza and medicine at the same time. Most hospitals have advanced communication systems using smartphone apps. Nurses can send and receive text messages, receive alarms from their patients through phones. Next of all is the electronic records that are used in hospitals. Piles of endless paperwork consume the nursing staff for decades. They can't be working and writing paperwork. Handwritten records by themselves are heavy and hard to manage and require a lot of space. Physical paper charts and medical records is pretty much become a thing of the past. Hospitals have switched to electronic records. This allows everyone in the hospital to access the patient's information with a just touch of a button. A nurse can use see the patient information, see what medication is on, and see what medication is allergic to also. And they can also look up to lab tests and all sorts of data. Electronic patient records have saved a lot of time for the nurses by reducing the handwritten records, handwritten notes by the nurses. It also reduces various medical errors and provides quality charts for evaluating the patient. We have to stress the situation that the patient care is important more than the nurse knowing skills of what. We must say that the patient care is much more important. Now next, enhanced diagnostic devices. Most of all, technological advancements are now help to doctors, nurses, and the patients. For instance, diagnostic examinations, they can be now performed non-invasively, which is a boon given by the technology. There are more options for nurses and doctors to choose rather than the old school tests and treatments. Not only it is cost effective, the nature of testing, but it also lowers the risk of infections. And biosensors has the ability to test all sorts of disease. It requires just a body sample, a body specimen to give a definite result. Another tool is ultrasound technology. Yes, these are now used most prominently. When needed placing IV, ultrasound machine can pinpoint the exact location of an IV, which minimizes the patient's distress, which is important to reduce the patient's distress by using technology. Next one is the drug delivery system. Numerous hospitals have implemented this drug delivery system that comes with an implantable device form. These devices release medication into patients at required times. Previously, nurses used to spend a lot of time adjusting IV sets and syringes and doing fluid calculations. But nowadays, nurses use infusion pumps and syringe pumps. Just click in the button and you're set to go. Previously, nurses used to tap on IV tubes, check for air bubbles, and when the IV fluid's over, there's a risk of air entry. But now you don't need to worry about that. Today, nurses don't worry about this. But even a small air bubble present in the tube, the infusion pump will go, alarm will go on. So the flow will stop, and a nurse can come to check it. This allows the nurse to focus on other areas that need their attention. There's a lot of staffing problem in the hospitals right now. Now nurses need to take care of a lot of patients, where this kind of systems can come as an advantage to the nurses to take care of multiple patients at the same time. Smarter alarm systems. Go to any hospital room across the country, there'll be sounds of beep coming out of patients' hospital rooms. Smart alarm technology is used to monitor patients' vital signs for the nursing staff. All vitals run through one system, checking the blood pressure, pulse rates. It's never been so easy for the nursing staff. It is integrated system which checks the physiological indicators. If there's a real cause for alarm, the machine will sound an alarm and knows the patient nurse that there should be a blue code or something. The safety systems are modernized and efficient also. They provide an extra layer of safety for the patient and it alerts the nurse. I again stress that patient care is much more important than nursing. You would say that nursing skills are important, but the technology has made patient care much more important than nursing skills. These are some of the examples that show how technology has enhanced the nursing profession. With COVID-19 pandemic lockdown measures, even those who didn't like technology have begun to appreciate the usefulness of technology. Nurses in COVID ICU used to use WhatsApp technology to communicate with the patient attenders daily via WhatsApp video call. Now, during the isolation of the patients, the patient attenders can watch the face of the patient, which is also a technological advancement, not only of an audio call, but a video call. Now, also doctors have shut down their private clinics during the pandemic lockdown, and correspondingly, patients who need regular monthly visits to the doctor clinic have adapted to the technological trends of using apps to book a doctor appointment and a video consultation. They also can pay the fees with the app itself. For example, there's an app called Practo, which was developed in 2008, has become a very popular app for booking appointments or doctor consultations and follow-up. Once a consultation is over, the doctor shares the prescription to the pharmacist, and when the payment is made, the medicine reaches the patient's doorstep the following day. That shows how the pharmacists have collaborated with this app in the changing society. This app is simple and brought many benefits to the patient. The patient now does not have to wait in a queue or token or travel to the clinic or even visit a pharmacy. Everything can be done with the comfort of their home. They can just sit and book and have video consultations, whatever. If you're still not convinced that technology is a boon in healthcare, let me give you a real life example. When you call someone over the phone now, what is the first thing that you hear right now? It is the caller tune that says coronavirus vaccines are safe. Trust the vaccines that are made in India. Go to the nearest center and get yourself vaccinated. What is that? That is called health education, and it is supposed to be the role of a nurse to reassure you, the patient, and give health education. But today, government is doing that using technology. But many people might not trust the government as much they trust as a doctor and nurse. So I've resolved to start the YouTube channels where they give mass health education about vaccinated or social distancing or wearing a mask. Again, that's a nurse's role. Since we did not adapt to the situation of technology that is current right now, other sorts of people are coming into health education and giving health education. So in conclusion, I like to say, while nurses are still debating whether healthcare technology is a boon or bane in nursing, other professions have moved forward ahead and also have begun to take the role of nurses. So whether you like it or not, accepting the technology is boon and moving forward is the only way ahead. Thank you everyone for giving me this opportunity.
Thank you, Mr. Christopher. He focused on communication. I can do fastest communication, telecalls, video calls, even 19th century records, I can take it. And laser, it's the latest thing. We will do it fast. Just app is enough for appointment of doctors, and especially in Corona time, we can use the telecalls, video calls. So thank you so much. Now I welcome Miss Surya from Tahur College of Nursing. She will debate on healthcare technology in nursing practice. It's a ban only. Please welcome Miss Surya.
Good morning, ma'am. Good morning to one and all. As Christopher said that mostly all the treatments and surgeries through the technologies are very costly, like robotic surgeries and other kinds of technological machinery surgeries are very costly. And most of the patients belong to rural areas and they are poor. For poor patients, it's impossible to pay for costly surgery. Technology increased the health care, but also increased the cost of that, which is impossible for the patients to pay. So, technology is changing the world at a rapid speed. For many years, nurses have dealt with the technology concerned with the rapid evolution in healthcare. For example, electronic medical records, medication prescribing tools, telehealth and online appointment scheduling and mobile laboratories are just a few of the healthcare technologies that nurses and healthcare providers deal with on a daily basis. Is technology in nursing improving patient care? No, because nurses and healthcare providers are spending more time with the technology and less time with their patients. For example, if healthcare providers are talking on electronic medical records in the patient's room, the healthcare provider-patient connection is thwarted by the technology standing in between them. The nurse's focus is now the technology and not so much the human being. There is a lots and lots of disadvantages too. Like as Christopher said that laser treatments are nowadays very famous, I think. Increase the cost of the treatment for the patient. That is more important. Most all the treatments are laser surgeries are doing nowadays. Technology increased healthcare, but also increased the cost of that, which is impossible for the patients to pay. Then the next thing is sometimes the machineries or technology devices shows the wrong results. Sometimes it didn't show the accurate results of the patients to the doctors. So the technological missions are made by the engineers and programmers. Sometimes the errors and bugs come into it. Then it didn't work properly. If it shows the wrong result and the doctors give the wrong diagnosis to the patient, then it takes the patient's life into danger. If it shows the wrong result, it suffers a patient only. This is most one of the dangerous forms of medical technology for the patient. The next thing is lack of information of the patient. Lack of information. Safety and privacy are some of the laws of hospital to protect the patient's privacy below. But by the technology, this law can be broken. The information of the patient, which are stored in the computer database in the hospital, can be leaked. The computer systems can be hacked and the secret information about the patient treatment can be stolen and also can be changed. If someone changes the complete history of the patient treatment, so it can be danger for the patient's next treatment, for further treatment. Then the next thing, time consuming in recovery. For example, if there come some kinds of faults or errors, so no one can fix it because they did not have the knowledge about the recovering and fixing the machines. So it requires a specific person who has a knowledge of it and the engineer who made it and he can fix it. So it consumes a lot of the fixing and recovering the machines. Here too the nurses, here too the patients only suffers. Then the next thing is, as Christopher told that patients online treatment through technology. Nowadays, the doctors do online treatment. Okay, the patients contact them online and suggest the diagnosis to take. The patients have not to go to the clinics of the doctors, and they can easily get the treatment at the home. Okay, without any checkups and analysis of the patients, the doctors give the diagnosis which can be wrong and can be dangerous for the patient health one. Then automatic machine treatments, as already those details are told that. There is a kind of mission which is fixed in the patient's body. It analyzes the patient's body and insert the medicines in patient's body according to their body condition. These missions are made by programming, in their programming. If there come some errors or that, then it is very harmful to the patient because it can fix, it can insert the wrong diagnosis in the patient's body, which causes the critical conditions and the death of the patient too. Then, okay, technologies are developing as Christopher tells, as Shweta also tells. As we know that technology is constantly evolving many a times, there will be a new software, new updates, new way of doing things. In order to keep in with the competitive age, hospital staff has to keep with the such changes. This can be a struggle for some, especially for the old staff. There can be a technology barrier also. Telehealth requires the patients to have the access to appropriate technology, such as, for example, if the patient or the client is uneducated or they don't have the laptops or Android mobiles, is there any advantages to take care of health? No. So those who can't get hold of the appropriate technologies can't benefit from the telehealth. There can be a reduced continuity of the care also. Patients using telehealth may connect with different providers each time they use telehealth services. They may also come to rely on apps rather than in-person exams. The association between the patient and provider can increase the likelihood that medical issues go unrecognized and or untreated. Then it's not good for every situation. While telehealth can help healthcare providers, as well as patients need many health services from surgery to physical examinations, still requires a patient to see a provider person. Finally, I told that healthcare technology in nursing is a band on. Thank you for giving such an opportunity.
Ma'am, unmute. Ma'am. Excuse me, ma'am. Ma'am, unmute is. Thank you.
Thank you, Ms. Surya.
Thank you.
She's telling about technology is a useful servant, but it is a dangerous master. So always you should be empathetic, be compassionate, and have a good relationship with the patients. Thank you. Now I call upon Ms. Jessica Sharan from Venkateshwara College of Nursing. Please welcome. She will focus on it's a boon only. Please welcome.
A very pleasant morning to the respected professors and my dear friends. I am, as ma'am said, I am Jessica Sharan David from Venkateshwara Nursing College. Here I stand before you to present my views on the favor of the topic, healthcare technology in nursing practice, a boon. As my friend said, the one who spoke before me, Ms. Surya from Tagore College, she said that she has quoted that the data which has been collected by the technological sites, it is not end-to-end encrypted, because so we'll see under this topic. And at first, I just need to give a given quote. As nurses, we are on the front lines of healthcare. We know how important it is that everyone has access to the best medical technology and cures, not just the wealthy few. So at first, I would like to bring to your attention that why technology is important in nursing. Under this importance, technology in nursing has many benefits like faster communication, efficient chatting, increased patient safety, and faster results and improved scheduling are just a few. And it may also, physical exertion is decreased while productivity is increased in this. So I submit that a survey of 600 nurses shows that 82% believe that the technology positively impacts patient care. This is an article from 10th September 2019. And I continue that our ability to store, share, and analyze health information is directly tied to improved technology. The use of technology increases provider capability and patient access while improving the quality of life for some patients and saving the life of the others. And as my friend Christopher said, it is really a boon. I strongly accept his opinion. In this healthcare technology is at the cutting edge of this debate. Huge technology companies are moving into the health arena and their input could potentially be revolutionary, during it driving down the cost and boosting efficiency and helping to cure more sustainable and affordable healthcare. In my opinion, technology has decreased human errors like automated IV infusion, as my friend already quoted it. For example, in health, electronic health records can reduce the repetition of the diagnostic studies. Including the telemedicine, it also plays a major role in people's life. For example, I can give you everyone here in this community, no one is there without in telecommunication because everyone at home, they have a television. So giving an health education to an television is more important. And most importantly, I would like to quote it. During this pandemic situation, we were all under quarantine, where the mobile diagnostics, wellness apps, and healthcare video conferencing played a major role. It helped in patients to consult the doctors to video conferencing for consultation. And where also the nurses were able to give follow-up care to the patients. And some of the emerging technologies in this health care technologies are, the first thing is wearable devices, such as which will note the vital signs. Vital signs is the major thing which nurses do in the healthcare setting. And coming under this, the wearable devices were very helpful for the nurses to give their follow-up care to the patients during this pandemic at their own places. And it also helped in improving quality of the life of one to maintain benefits of integrating new innovations into the medicine, and medical technologies like minimally invasive surgeries were playing the major role. And coming to the main thing, that is artificial intelligence. Artificial intelligence is a major thing which plays a major role in lessening the nurse's work and also the physician's work. And technology helps us to accomplish the task in less amount of time with fast speed of communication. I'm giving an example of the technologies that emerged into the health community in the year 2020. So we'll see one by one. The first thing is virtual reality. Virtual reality played a major role in 2020, and precision medicine and health wearables, as I already said, and artificial organs, 3D printing, and wireless brain sensors. And the most important thing is the smart inhalers. Inhalers are the main treatment option for asthma, for the patient who have breathing difficulty. And if it is taken correctly, will be effective for 90% of the patients. And coming into the most important new technology is the virtual reality. It is the most promising technology, health technologies in 2021. With this advancements in telehealth nurses and advanced healthcare providers can provide health information and care to patients in rural settings from a distance. As Ms. Surya quoted, not everyone can reach the patients in the community. So not a single person can go and reach all over the communities, and these health educations through the television and telemedia will reach all the patients, giving the awareness about the preceding diseases and all. And technology is being utilized as a major form of communication for the nurses. More and more healthcare facilities are opting to use smartphones, which will enable them for a better and more efficient communication and using texting between the clinicians. And it also allows for the better access to the information. And finally, I wanted to tell you that we've reached the era of the Star Trek age in the healthcare technology. So using technologies will not lead us to the laziness. As Mr. Praveen Kumar said, technologies will lead nurses to the state of laziness, will lead them to lethargy. And I strongly oppose this opinion that technology will not lead the nurses to a situation like lethargy or any laziness. It is an helping device. Like technologies helps us to improve our the way of caregiving. So here I would like to conclude my topic, and I strongly believe that this is my strong opinion that healthcare technology in nursing practice is a boon. Thank you, ma'am, and thank you for giving this opportunity.
Ma'am, please unmute, ma'am. No, ma'am.
Can you hear?
Yes, ma'am. Yes, ma'am. Thank you.
Thank you, Ms. Jessica Sharon. She focused on without technology, we can't. Even classes, virtual classes, it has been went during pandemic period. Thank you so much. Now I call upon Ms. Shalini from SRM College of Nursing, and she is telling about it will make you tech is like a fish. It cannot stay longer in the shelf. If it is in the shelf, it will not give the desirable outcomes. So I welcome Ms. Shalini.
A very energetic good afternoon to all. Before discussing of healthcare technology in nursing practice, a ban, I want to code my topic a very strongest one by these coded lines. As we are nurses in the profession, it requires the core of what makes us human first. It's simply by paying attention, being empathetic and caring. And I say it cannot and it will never be replaced by technology. Then I want to discuss something based on technology, which is a ban. And finally, I hope you too will think that technology is someplace, some way, it is a ban also. Then, as my friend Sweta said first, I want to discuss our topic first. She said robotic surgeries from where? Are they from are they from cities or from villages or from urban areas or rural areas? I see lively every day on my clinical postings, all from villages. I'm very happy to say that our SRM college take vehicles to villages and collect peoples and bring them and serve them daily. It's not the thing of serving, is a thing that it shows the poverty of the people in villages. Yeah, all my friends like Christopher said, it online treatments, online everything, we can pay everything through online. How many peoples in village have smartphones? I don't see my village. I'm from village side. I don't see everybody is holding a smartphone. Still now I go in bus. I see some people says, can you make a call? They don't know to just call also. Then how do you expect persons to make online treatments and do such things? I think there a technology comes to an ban. Same, the cost, our technology has been improved. Think of it cost, how much it is costing now. Do you think everybody is affordable to get treatments? I think in that place, our technology is not failing. According to our society, it is not getting to the reaching level. And I want to say, Christopher said, vital signs. You check, keep on checking vital signs like pulse, BP, like that, like so on. He said, yeah, fine. New things are came, pulse, saturation machines. We can monitor through everything. Think once a patient comes to an cardiac arrest, yeah, we keep monitoring. Yeah, that is fine. We see everything. And one more thing, you forgot, my friend, that we start monitoring and we start same time the CPR, where our nursing skill and the doctor's skill, where the skill plays a vital role to recover that patient. I think in that place a technology comes down, and it so that I say it is a ban. Then to coming to a point, damage, I think most of them said nowadays are trending is laser surgeries like this. Yeah, I do say now it is quick and it saves our time and it is the latest technique also. But think once all we go, we cross. Pregnant ladies, be careful. It is a X-ray room like that. We say, why do they keep that caption there? Think once. Nowadays, laser surgeries are very famous, but the lasers are damaged. It can also damage our body cells at the same time. All we see positive. I hope I too like to see positive things, but think once the negative also, so that you can think. Then, at the same time, my friend Surya said it is a time-consuming recovery. I want to support that coded lines by saying, yeah, first of all, we have for checking BP, we have sphygmometer where we connect that pump and we tie that. Yeah, it is fine. When it is disconnected, we all know to connect it. Now think of manual BP checking machine. Start, stop, start, stop. Then if it is a error in that, what we do? We call some person or we give it for repair. There are time reduced and our skill reduced there. That time we go back and we take that machine out. There also a technology has become a ban. Then I want to say a main reason and an important reason. It is a malfunctioning of equipment. Yeah, nowadays it is the biggest headache. The technology has been giving us a useful and effective way to make it life easier. But think once, in case suddenly if it is unworking, what it will happen? For example, we all have a centralized oxygen cylinders. Think once if some error occurs, what we do? We rush. As a nurse, we all want to save the lives. We rush and we connect a single cylinders like that. Our skill plays a main role there. Yeah, the Christopher said in COVID time it is very useful. We kept the treatment in online phones, everything. Yeah, it is okay, but why do we made people to separate them and keep them separate and give them treatments? Why can't we say them to stay in house? Why we made that much of treatments? In Hence, I should end my topic by this coded lines again. We all know technology plays a vital role, but think once, none of the technology can give a nurse patient relationship, and none of the technology can give a psychological support to our patient, where we can give technologically wise we can work, but none of patient comes for treatment, but we touch our patient and if we say nothing is there, we are there with you. That emotional words plays a main role. To continue the treatment first, we should encourage the patient. We will give the psychological support. That psychological support only makes the patient to continue the technological treatment. Thank you.
Thank you, Ms. Shalini. She focused on human needs, social relationship, but especially when we are sick, we need someone to soothe us. In hospital environment, when the patient is having a high BP, already they mentioned, and anxiety, while talking with them smoothly with a therapeutic touch, with a smiling face, her anxiety will be reduced automatically. So we have to be empathetic. Thank you so much for all. Now it's the time to conclude. the results of tech versus touch, whether it is a boon or a ban. Healthcare technology in nursing practice, a boon or a ban. First, we need technology. We have to accept it to diagnose. Time saving, less work, but more production. We need it. Even virtual classes, it will be very helpful in a pandemic situation. We will be in online classes, but our students will stop the videos. They will mute them and they will do their own works. The results will show after the exams. During Corona, robotic nurses, it helps. But when we are in isolation, then only we know the social relationships. So, my result of tech versus touch conclusion is tech with touch. That means use technology with therapeutic touch. So, as the nurse leaders, we have to bridge the gap and join forces on technology in patient care as well as in the nursing education. So, we have to design policies and practices to improve the teaching and in patient care. So, always use technology. At the same time, the therapeutic touch should be 100%, which gives quality patient care. And I thank Dean Dr. Kanyamal ma'am for giving this opportunity. And I thank all the budding leaders. They have spoken nicely, even in the lunchtime. Thank you so much for this opportunity. So always use technology, but never forget we are therapeutic touch. Always be with the patient. Use technology. It will faster your function. But at the same time, health is a state of complete physical and mental and social well-being. That is, we have to keep it in mind. Thank you so much. Thanks, ma'am. Anyone wants to?
Thank you, ma'am, and all the students who really did their best in the given topics. Once again, I am very thankful the young birdies for the enthusiastic participation. Thank you all.
Thank you.
For good ideas and true innovation, you need human intention, conflict, argument, debate. Thank you, ma'am, for a engrossing debate session.
In technology development, significant advances are as often the result of series of evolutionary steps, as they are of breakthrough in even influencing in healthcare delivery. It gives me immense pleasure to call upon Dr. Revati, Ma'am, Principal, Velamal School and College of Nursing, Madurai, to deliberate about the healthcare informatics in nursing leadership. I call upon Mrs. V. Priya Ma'am, Assistant Professor, SRM College of Nursing, to introduce the speaker.
All. Never stop learning because life never stopped teaching. It's my great privilege to introduce Dr. Rebuttal Ma'am, Principal, Velamal School of Nursing and College of Nursing in Aripadai Video, Madurai. I welcome you, ma'am. Ma'am has completed PhD nursing at SRMC in the year of 2014 and MSc nursing in medical surgical nursing, critical care nursing in the year of 2016. She received the 2 gold medal award during her period and post BSc at ApolloCon in the year of 2004 with a university distinction and diploma course nursing in the year of 1987 with the distinction. Ma'am has 17 years of critical care nursing and trained pediatric critical care nursing at the Royal Hospital in Women. Ma'am has 32 years of teaching experience in the nursing field Ma'am has experienced and preparation for accreditation of inspector from MCI, UGC, SNC, IMC, Indian Nursing Council, and NRF, and NABH, and NAC, and JCA. Ma'am has organized many conferences, international level and state level. Ma'am has published more than 30 papers and presented in paper in various conferences. Ma'am is the member in an international Journal of Allied Medical Science and Research, and International Journal of Medical and Health Professional Research, and she is an expectation integration of council committee of SRM IST. Ma'am has visited the various country, that is international country like Oman, Malaysia, Singapore, New Mexico, USA. Ma'am has received the 2 gold medal award and the continuous service in the December in the year of 2017. Ma'am received Best Paper Award, Best Post Presentation Award. Ma'am has completed many certificate course in the after graduation research methodology, online course, ethics, research, and course relaxation therapy, patient safety, and fire safety. With this introduction on behalf of SRM College of Nursing, I welcome you, ma'am, with the quotes of she's present. She delivered the topic on healthcare informatics in nursing leadership. Thank you, ma'am. I welcome you, ma'am.
Thank you for such a good introduction. At the outset, I wish to thank. Yes, ma'am.
Good afternoon, Revati.
Good afternoon, ma'am. Very good afternoon.
Unmute
Very
your
happy to
mic
see
and
you.
then you speak.
Yes, ma'am. Yeah, I'll share.
Please unmute.
Yeah, ma'am. I have unmuted. Unmuted, ma'am. Can you hear me?
Yes, ma'am.
Yes,
ma'am. Yes,
yeah.
Madam,
Yeah, I have
unmute
unmuted. Okay.
Ma'am, unmute la ma'am irukanga. We can able to hear, ma'am.
Okay. I'll share my screen.
Could not able to hear.
Ma'am, 1 second, ma'am.
Ma'am, I'm.
Ma'am. Oh, sorry. Sorry. Very sorry. So now, can you able to hear?
It's okay, ma'am. It's okay. Yes, ma'am. Yes.
Yeah, I switch off because I am interacting with people from outside. Okay.
Okay, that's okay.
With my pleasure, we are welcoming you for your good presentation on informatics in nursing leadership. So please, after the presentation, I will talk to you. Okay. Thank you. All the best.
Okay, ma'am. Thank you, ma'am. At the outset, I wish to express my gratitude to SRM University and university officers and management. I also wish to congratulate my ever adorable teacher, Dr. C. Kanyamal, Dean, SRM College of Nursing, and her webinar. And I thank you for inviting me as a resource person. I will meet your expectation, ma'am. And see, today all of us are connected digitally, and that is a big live example that the technology is advancing. The COVID-19 pandemic has forced us to use the technology, and all of us know now nearly 500 participants are connected digitally. So with this small prelude, I wish to share a little bit of ideas. And now currently the healthcare is delivered in various settings. It is dynamic, complex, and it's ever changing. So today you see one thing and tomorrow you see different thing. And there are many changes in the medical treatments and regulations and the reimbursement and public knowledge. And there are big demand is created on the information from the patient side. So computer has moved from, early we were telling, it is very nice to know about the computer. Now the luxury item is now you need to know the computer, whether you are a nurse or a nurse manager or whoever it is. So it is you are in the place of that, you need to know the computer basic application. An average medical surgical nurse spend 34% of her time in handling the information. This is very, very huge. I mean, this very big. For decades, the nurse manager's primary role was to oversee the nursing staff and their patients. By overseeing, her time is spent most of the time. Today, the nurse managers have assumed a additional role, which is including the integrating the healthcare responsibilities and service and providing the information technology into the workplace. And she has to bring that information and technology into the practice field. That is the biggest responsibility of the nurse leaders. So health informatics, what is this health informatics? It is also called health information system, HIS, uses information technology to organize and to analyze and health records to improve the healthcare outcome. So it is a simple process of organizing and analyzing the health records which are available for the patients for the good healthcare outcomes. The health informatics deals with the resources, the devices and the methods and the utilization, acquisition and storage and retrieval and use of information in health and medicine. Whatever nurse concerned is, we all these things we do for the patient's record, patient's information, everything is utilized, acquiesced and it is stored and retrieved and used for the future reference. And health informatics also an important part of care and coordination in nursing. So the ability to track the staff, whoever is working with you, and workflow and effective communication, which may help the nurses to identify the areas where the current process can be improved, wherever we lack. Through this technology, we can improve. Evidence-based practices, always we go into the research, have long been an essential part of nursing. So we improve our quality of nursing care by doing these evidence-based practices. That's why we are all going for PhD in nursing and doing many projects and improving our nursing care. So what is the book says about the definition of this? Healthcare informatics is defined as the integration of healthcare sciences. So you integrate all the healthcare sciences within the computer science and the information science and the cognitive science to assist in the management of healthcare information. The complete information if you want to get about your patient and improve the quality. So you have to integrate all these sciences, healthcare science, computer science, information science and the cognitive science. So then only you will be getting the complete information. Healthcare information. This is given by Seba and McCormick in the year 2015. This is a very good definition which says about the process of all integration of all four sciences. So benefit from healthcare informatics, what you get? What do you get out of this technology? So it increases the patient satisfaction where you lively connected with the patient and you are interacting. So it increases the patient satisfaction and efficient and effective communication with other medical personnel. So we always go in a team like medicos and technologists and technicians and other people. So it provides a efficient and effective communication with other medical personnel, and it provides faster answers. So like very quickly you get the answer so that nurse can spend more time with their patients. So not necessarily you have to hang on with the records, and here you get faster answers and you can spend more time with the patients. And use of electronic health record EHR for charting the patient's information in the products and reduces the risk of errors by making it easier to monitor the patient. Whenever you go near the patient, when you monitor, so immediately you record it in the electronic health record system, so it reduces your time. So what is this nursing informatics? What is it all about? So the healthcare information and management system society defines nursing informatics as its specialty. I told you already that it integrates nursing science, computer science and information science and manage. Why it is there? It is to manage and communicate the data, information, knowledge and wisdom in nursing practice. Every day, this nursing informatics is helping you to improve your nursing practice, and you are becoming an expert in the field of nursing, and you improve your competencies. It reduces the time. Evolution, there is some evolution always, all the thing. No? The nursing informatics, also called health information technology, can be traced to that earlier days of modern nursing movement under Florence Nightingale. You know, Florence Nightingale is our founder of modern nursing. So during the Crimean War, you know, her work, Nightingale began, she started documenting her patient care to track health outcomes. So she only brought the concept of critical care and infection control. By her excellent documentation, we all took that concept and we emerged and we grown in research and administration and other areas. So hence now we are bringing all this technology, keeping her concept in mind, and we are bringing many development in the technological area. And then in the past decade, providers have been working to use technologies productively to benefit the patients and the medical staff. Many of the efforts have been focused on developing and delivering informatics competencies to the nurses at all the levels, whether they are at the bedside, whether they are in the community, or whether they are doing research or teaching anywhere. So any level, the technology is very useful to deliver the service. So which is very, very beneficial to all of us. Now, you know, the COVID-19 pandemic has forced us to use the technology. Currently, by the technology, all of us are connected digitally, and see, there's one platform by Zoom. We are giving the sharing the knowledge to many people. That is possible. So in the year 2006, a group of prominent nurses launched the Technology Information Guiding Education, which is called the use of information technology, IT skills and informatics competencies in the healthcare. So they started merging the IT, information and technology, and which is called Tiger. So these competencies will be useful for us in tracking the patient, and many things are applied in our day-to-day life. And so all nurses must possess the computer skills, basic skills. When I was in the service side, when I worked in abroad, Muscat, I was asked to learn the computer skills, basic typing skills, to update the daily patient's codex. We did not write it in the paper. We always used to record in the monitor, which is kept near the bedside. So the basic computer skill is very important. So they have to be able to use the application, what are all the application which is there, maybe your admission and discharge and intending and ordering medicine and all those things, all the applications they have to know and know how to manage the information and knowledge. And so why it is so important for the nurses and nursing leaders? The informatics enables the nurses to use the information and communication technologies in the field. You have to collect information. Data is information from the patients and various sources, and you have to use that information in application of everyday your nursing care and generation of knowledge to support nursing practice. From that information and whatever you are collecting data, you have to generate a new knowledge that should support your and improve your nursing practice. So that's why we are giving so much importance to the informatics in nursing. So what is this computer system? You know, all of you, network of computers. They use many programs and procedures in the organization, assist the health team with the decision making and for the effective communication. There are two most common types of computer system. One is managed information system, MIS, and hospital information system is HIS. So this, I mean, we often come across with these two things. So what is this managed information system is, which is designed to facilitate the structure and application of data, whatever you collect from patient and from the different sources, which is used to manage and organization of the department, and which provides analysis used for strategic planning, decision making, and evaluation of management activities. Whatever you plan, that will be evaluated through this management information system. So everyone who is working in the hospital should be trained to operate this management information system, and what all the different applications which are given in the management information system. And coming to hospital information system, all the nurses must learn this. That focuses on the types of data needed to manage the patient care activities while admitting, while discharging, while the patient is there in the hospital. So this is very important. Provides people with the data they need to determine appropriate actions and control them. So whatever appropriate time, this data is very much essential. So this hospital information system is very and very effectively utilized in all the small hospitals, if you see now current days. And what is there? Nursing informatics, practice, education, research, and administration, all the areas you need to apply this informatics. So nursing information system. So when time and energy are at a premium, so using a nursing information system in acute care settings, now we have no time. So our healthcare setting is dynamic, it is flexible, and it is changing place to place. So this in acute care settings can assist in applying nursing knowledge and wisdom to every day to improve the, so every day our goal is to improve the patient care and reduce the cost and reduce the admission days. So documentation can be more timely and more complete and more accurate when captured at the point of origin, usually the client's bedside in acute care settings. So we give so much importance so much, I mean, the stress is on there in the documentation. Okay, so nowadays the hospitals are and other educational institutions are going for higher accreditation. There the documentation is very important. That speaks for you. So this electronic documentation is very important. All the data are fed into the computer in the different applications. So everyone should be very, I mean, should be familiar with the information system and the technology. So all of you know the educational systems are going for NAC and other accreditation system. So all the information about the individual faculty or individual candidate is fed through the computer, different applications. And see functional areas of nursing informatics. So you see what are all the areas. So the American Nurses Association, they say some scope and standards of practice there in this field. So when you do the administration, leadership and management, say for example, a nurse leader in the hospital need to know about their staff, tracking of the staff and how many patients. So everything is achieved through the nursing informatics and the technology. So administration and in the leadership and in the management of the patient care, analysis of data and the compliance and integrity management. You have to maintain the integrity of the staff and other healthcare personnel, and consultation, teleconsultation, and she's available through the online for the consultation by the subordinates, any doubt, anytime. So they are available. And coordination and facilitation and integration of nursing services and the development, educational and professional development, policy making and advocacy and research evaluation. All these areas, it has a scope, and these are all the functional areas of nursing informatics. The goal of nursing informatics, why at all you want to have, to improve the health of the population. So you are assigned to serve for a particular number of population, communities and families and individual. How we are going to improve the optimizing the information management system and communication, getting accurate information, and you have to optimize those information whatever you have, and you have to communicate effectively and get the information from the patient so that you can improve the health of the population, a huge population. This includes the use of information and technology in the direct provision of care, in establishing effective administrative systems and managing and delivering the educational experience. You can teach also, and in supporting lifelong learning, not only one-time teaching and lifelong learning in supporting the nursing research. There are many modules which are uploaded in the system, and you can learn every day, lifelong. It will give you cues and questions. You can learn continuously. It will not stop with one sitting. So value of nurse informatics, what value it has got? It support nursing work processes using the technology. So as you go process your work, it is the technology is supporting your nursing work process. Suppose when you want to make a duty schedule when you are posted in the hospital, so the technology is useful. It designs systems to match clinical workflow. So you have many workflow in the clinical areas for different conditions, and telehealth, teleconsultation. So your nurse leader is available through the telehealth and giving suggestions to tackle the situation. Home health, when the patients are in the home, you can consult and give healthcare, nursing care suggestions and dietary suggestions, many things, ambulatory care, long-term care, acute care, all specialties, outpatient settings. So you see in the acute care settings, I mean in the ICU setups, critical care setups, you have central monitors. You can monitor all the 8 patients who are given in the ICU sitting in one place. In the center nurses station, you can monitor every patient. If suppose a patient is getting a ventricular tachycardia, you can trace from the central monitor and take a ECG print, and you can immediately intervene that particular emergency and save the patient life. So this is what the value of nurse informatics. And then software development, you have many software, and redesign your workflow. Suppose this is not working out, you can redesign your workflow and increase the accuracy and completeness of nursing documentation. So most of the errors, so sometimes the nurses may give correct care and give correct medicine, but the documentation is wrong. So this the informatics increase the accuracy and completeness of the nursing documentation, which save the nurses by this, improve the nurses' workflow, eliminate redundant documentation which is not necessary, automate the collection and reuse of nursing data, and which facilitate analysis of the clinical data which are collected from the patients and other sources. So using the information, which is evidence-based practice, that may lead to determining the standards and guidelines. So we do research and take the findings, and we with that we set our standards. So every procedure has got standards for admission and discharge and everything. So it has a standards and guidelines. We can set the standard operating procedure by formulating this guide for decision making process. So it helps you to guide how to go about and determines the best practice for our patient, because we have to serve the huge number of people, very big population. So nursing informatics can enable dissemination of new knowledge. Of course, practitioners update themselves of new development through journals, conferences, continuing education sessions. So this informatics nowadays, it is available online. So as we talk now we are in the webinar, we are updating our knowledge, the new development through journals. Now journals are online, conferences are online, continuing education is online. So we get even in our field nowadays, you see for the past 1 year, pandemic, COVID-19 pandemic, many webinars and many things, updates we have had, and we improved our practice in the field of education and in the service. Many updates we heard. And essential informatics computers for the nurse leaders. Why? The nurse leader, she needs to have the technical knowledge and leadership quality, and she has to not only having this knowledge and leadership quality, and she has to utilize. Okay, utility is very important. So see, technical competencies are related to the acute psychomotor use of computers and other technological equipment. You have to use your fingers and the knowledge. Psychomotor skill is very important. The specific nursing informatics competencies include, for specifically the nurses, the ability to use selected applications in a comfortable and knowledgeable way. See, now you see all of you are able to download this app called Zoom, and you are able to connect with the people, and you are able to deliver, you are able to speak, and simple applications. There are many applications. See, for example, in the hospital, there are different applications are there, and for the teaching and for the learning. See, now in the skill also nowadays, there are different apps have come, and you have to go through that. You have to enter and complete that skill, and your knowledge is improving. Even the skill competencies are improved through this technology. Nurses feel confident in their use of computers and software in the practice setting, especially at the bedside, in order to be able to attend the client at the same time. So this reduces your time. The manual time is reduced. So you go near the patient, do assessment, and you are taking some findings, and immediately you record it, which is available, monitor which is available near the bedside. You record and finish your work, and then and there. So there is no point of forgetting or false documenting or whatever it is. So it reduces the error also. And then technical competencies needed: word processing. You should be an expert in word processing, keyboard, how to operate the keyboard, spreadsheets and presentation graphics and databases, desktop publishing, peripherals. And you should be an expert in taking a printout, CD-ROMs and DVD insertion, and taking and recording, World Wide Web connection, email program. This is very simple application only. Nurses are expected to do email programs, expert data systems, and multimedia connection and telecommunication devices. So many of the nurses you see in the remote areas, they are the people who are residing in the cities. They organize a nursing lecture in taking care of the patients like burns, and many important topics are discussed through these telecommunication services, and the people who are in the remote area are learning these techniques and improving their nursing knowledge, nursing information system and hospital information system. These are all the areas the nurses need to be an expert in. They have to be very familiar in handling these applications. That's why the nursing curriculum, the computer applications, the computer science is the first year subject. So they have to learn all these things. Thinking when all the hospitals are nowadays going for accreditation, and almost all of them have NABH accreditation, and the nurses are the novice nurses are put into practice in the hospital when they are familiar in the student period itself, and they become an expert in giving the patient care. By excellently they organize their patient care and plan their patient care. So utility competencies, what are the utility competencies? Are related to the process of using computers and other technological equipment within nursing practice, education, research and administration. Not only computer, you have other technological administrations and different applications. And specific nursing informatic competencies include the process of applying evidence-based practice. So you have to use your research knowledge and then critical thinking, accountability in the use of selected applications in a comfortable and knowledgeable way. Leadership competence. What these leadership competencies are related to the ethical and management issues related to using computers. Some issues cannot be dealt with the computer and these things, and other technological equipment within nursing practice, education, research and administration. The specific nursing informatic competencies are process of applying accountability, how much accountable you are and how much you are confident, how much you are maintaining your patient or your staff's privacy, and quality assurance in documentation in the use of selected applications. Whenever you enter a data, how much you can rely on, whether the data is correct or not. So you have to assure the quality in documentation in the use of selected applications in a comfortable and knowledgeable way. So nursing informatics in leadership. The emerging nursing informatics leadership roles engage in the necessary transformation activities. Also, it bridges the new care delivery models into clinical practice. There are many models which come out every day to have, there are many clinical pathways, models into the clinical practice with the right technology solution for organizational transformation. We go every time, we update a new practice we bring. For that, this technology is very helpful. You see in the teaching arena, in the field of midway obstetrics and gynecological nursing, you teach the delivery in the mannequin. Okay, so nowadays the computer connected delivery mannequins are there, where you can see inside the womb. You can observe what are the changes going on, how the fetus is taking 1/8 rotation. So everything is very keenly observed. So that way, this technology is very useful to learn. And nursing informatics leadership role, what are the different roles? So you can plan the resource by having the technology. So what is the manpower you have, and you can make your budget and you can utilize and evaluate also. Technology assessment, administration, you can maintain policy and procedure, safety and quality care, and make judgments based on data, trends and patterns. You can, whatever the available data you have, whatever you have collected, and based on the trend and the pattern, you can make a clinical judgment and you can make correct judgment. You can be a consultant and you can be an innovator by having a different application, or you can invent a new application for your care. And then evidence-based practice, you can utilize your research and computer literacy skills, information literacy skills, project management skills, change management skills, process management, information management and communication is very much available, useful in the data analysis and trending and forecasting the results. So these are all the areas that nursing informatics and leadership has a very big role in this. So what you have to do, whatever the application you have, this may be simple or complicated, you need a training. You need to be, the leader should be trained and the staff need to be trained, so that you can become, all this role can be performed very effectively. So how informatics help the leaders? Though you need, the nursing leaders need this technology, how it is helping? Strategic planning for a year plan, and for the seasonal plan, strategic planning. So with this technology, you can plan your work. Monitoring and evaluation of monitoring and clinical outcomes. So you can make a budget and monetary outcome. What is the running this? What is the monetary outcome and the clinical outcome? How much the patients are benefited? That also you can identify. Cost control, it controls the cost. And patient, nurses and classification. You can classify your patient, who are all the acute care patients and critically ill patients and chronic patients, and the nurses also, senior and the junior supervisor. So you can make any classification through the information, and calculation of staffing requirements. So you can require how much you are running a big unit, like different, multi-specialty ICUs. What is your manpower requirement and what is the patient strength? Based on that, you can calculate the staffing requirement. There are many applications which are helpful to the nursing leaders. To educate the nurses, that's very perfect thing. So you can teach. So nurses after the shift, they can go home and you can, through this technology, different application, you can teach the nurses. Through the mobile app also they can watch. Reduces the paperwork on time. So most of the time it reduces the paperwork and reduces your time. So you don't have to sit and record. Suppose you are a teacher and your institution is working for NAC accreditation and you are going for a conference and getting a certificate. And so if you have to immediately upload your credentials into the system, that will be added. So it reduces the paperwork. Instead of taking a Xerox and giving and filing this, you scan it and upload it then and there. So your credentials are kept safe. It reduces the paperwork and time. It improves the communication and keeping the records available ready for reference. Not only today, if you keep it as in a file, paper, so after a few years, everything will be going up. It may get spoiled, or sometimes we may, by mistake, we may throw. So if you keep it as an electronic record, it is available any time for the reference. Keep it in your email or keep it in your somewhere in the computer. It is available for reference. And eliminating the multiple entries. If you have the technology, multiple entries are avoided. Bedside entry of data for the nurses, practicing nurses, it's a boon. So you immediately assess the patient. Patient is having some, when you assess, you are finding something, and immediately you document. Okay, you, without forgetting, you immediately document, without wasting much of time. You are immediately recording and intimating to the doctor, so that the healthcare, whatever is provided, the services, whatever is provided, is reaching the patient quickly. That is the main aim of bedside entry of data. So immediately when you document, you don't forget to call the doctor if there is any emergency. Then duty scheduling. So when you want to schedule the duty for your nurses, so that's very important. And the teleconsultation. So of course, I told you already, the teleconsultation, and you are become a consultant to give knowledge to the other people who are working in the remote area, or people who lack of knowledge, and you can share your knowledge through the telecommunication. That's very important. So electronic bulletin boards. So where you share your information in the electronic bulletin boards, this is very important for the nurse leaders. Email, electronic mail is very important, where you share your ideas, sending information and planning, confirmation. So many things are done through the email. Now also through email only we contacted. Okay, the informations are sent to the different speakers that you are so and so. This time you are asked to present. So many communications are sent through email, and we are in a world of electronics. And calendar filing, our Google Calendar filing. Every day your work, every day, 8 to 4 you are coming to the college, or you are coming for duty in the ward, and 7 to 8, 8 to 9, what did you do? 9 to 10, what did you? So you document your work. That will speak for you. And anecdotes about your staff, whoever is, whether you are an administrator or an academician or a nurse administrator, your anecdotes about your staff. So when you record it and keep it, it will help you to evaluate their performance. And the performance appraisal is very easy. But the promotion is very easy. Raising them to the next level is also very easy. As I said earlier, accreditation and compliance. For the accreditation, whether it is NABH or for NAC, so anything, this information and technology is very, very useful for the nurse leaders, where you store all the information, you upload all the information. So the entire thing, the 70% of the evaluation and appraisal is done in NAC is by the online only, not by the manual record, or they don't come manually to the place. So it is only done through online only. All of you know that assisting in maintaining these standards, if you want to maintain the standard, you need to have this informatics. So how patients benefit from nursing informatics? Definitely they are benefited. So fewer medical errors. As I said, the moment you assess the patient, you document immediately, call the doctor, solve that problem. And more informed and good clinical decision making. And immediately you make a decision of calling a doctor, or immediately you make a decision of, immediately the system says, there are many clinical pathways. Suppose your patient is having 101 temperature, you record immediately, the system says that give gold sponge or give paracetamol. So immediately your clinical decision making also possible by the system. Shorter hospital length of stay by this assessment, and by doing this, so your patient is staying in a very, very, very few days in the hospital, and lower admission and readmission rates. Because of this, the patient is not getting readmitted, and admission rate is also very less, because from the home they are consulting you and you are giving a best suggestion. There is no need to admit the patient, especially the COVID-19 pandemic. There are many patients who consulted from the home and got benefited out of that. And better self-management program through this effective communication system. So nursing informatics and practice nurses are expected to have knowledge about the benefits and limitations of. That's why we are organizing a webinar like this and sharing the knowledge. So there are limitations and benefits of technology, as the people have also debated now. And the communication and decision making and attitude needed to value the technology and use informatics to boost and support protect the client. So our technology should improve the nursing care, and it should protect the patient and it should support the nursing care. So we should not misuse that and patient data. So it should protect ethically and morally. It should protect the patient. That we have to remember in using the nursing informatics in our day-to-day practice. And documentation and medical record keeping. So bedside data entry, as I told, this allows recording of patient assessment and medication administration, progress notes, care plan, codex, and updating the client patient's acuity and acute charge. So all these things are recorded in the electronically and made it possible and very, very easy for handing over and taking over. You see here the patient document here. After the assessment, you find the feet is swollen, you immediately put the swelling. There are many clinical pathways, many critical care pathways, which says if it is swelling, elevate the foot end. So like that, there are many informations are available, which make your nursing care very, very easy, not complicating. Okay, whatever the rights, the standing order we have, based on that we can go ahead before calling the doctor. Then we can stand right and we can say, I have done this with that. It is not healed. The doctor's role is very important here. So this electronic documentation, see here, it is very beautifully given. The patient is having swelling. You put a tick. And here the triage score. The patient is coming to the triage area, whether the patient needs to go to the ICU or to the OP or to the ward. So the triage scores sheet, you yourself, the nurse herself can decide and make it. So the chief complaint and historical data, mode of arrival, everything is detailed, which you can do it through the, wherever you sit, you can do this through the computer. And here the patient preferred pharmacy. You order the prescription. From sitting in the ward, you order through the computer, whatever the tablet you want, that reaches. See, so when you order this, the pharmacy people will get the information. In ICU, there are good setups where there are small tele lifts are available, small lift, medication lift, that will reach the drug will reach you within few minutes. So after reaching the order, they will just immediately put that in a box. There's a connection like a rope car. There's a small box will be reaching your ward. Same way, there are many advancements are there in the nursing practice, which will reduce your time. Here, prescribing the medication chart. Here, after giving the medication, you enter your medication. At what time you have administered this drug, immediately you note it down and store it. And this, for the future reference, it is useful. So whether you have given or not, immediately you do near the system which is available near the bedside, so that you after when you are doing it in a paper, the documentation, you give the drugs for the 10 patient. Afterwards, you come and record, and you do not know which patient what drug you gave. So this system makes your work easy, and you don't forget to document, and you are standing ethically right, and legally you are standing right. So the terminals can be fixed or handled and hand-wired. The central system or wireless with the ability to transmit the data to distant sites. Suppose this, I told you, the central monitor system in the ICU. Suppose you have 10 patients ECG and all the parameters, whatever you monitor in the system, are also monitored in the central monitor. You get cues and it gives alarms. Suppose a patient is going into ectopics or tachycardia, so SVT, whatever, it immediately alerts the nurse leaders to go rush through near the bedside and find out what is going on, and it alerts you and keep the medicine ready for the doctors to arrive. So as soon as he comes and gives the order, you push the medicine and revert the patient. This is what the central recording system and the point of care, point of service computer. See here, the nurses are sitting here and monitoring the central monitor. Every bedside there is a monitor. See, nowadays the technology has improved. Even sitting in this control panel, you can change the ventilator mode. So you have to reach inside the ICU. It will take nearly 2 to 3 minutes to change the mode. So there is a remote. You can, from the control room, you can change the, suppose you feel that patient is breathing all right, so you want to wean the patient, you can switch to CME mode to SIME mode. So the technology is that much very much available nowadays. See here, the patient, immediately the nurse is recording here the assessment findings. Computer-based patient records, electronic medical records, computer-based patient records are available. So this permits the electronic, patient data entry and retrieval, everything, caregivers, administrators, accreditors, and other persons who require the data. Suppose if the patient is feeling tired, the attender who is standing nearby can record it there. The nurse who is coming for rounds can note it. If suppose if the patient is sleeping now, you find out that what time the patient had. But the information is, accessed very quickly by the system. Computer-based patient client records, computer-based patient records, and way of improving the healthcare. So how you are going to improve? Constant availability of patient health information. So it is not stopped continuously. The information about the patient is available. Ability to monitor the quality of the data, access to stored data, and ability of patients to share in knowledge and activities influencing their own health. So they can get information and about the information about their own health, and doubts and clarifications are they receive through the system, information system. See here, later those things can be taken a printout and stored in the codex room. So this is also very much very much possible and available. The neat and effective way of storage of the system, whichever storage of data, whatever is you stored in the computer, that can be for your thing. You can also store like this. And here the other way. So this is the another patient information. What is the reason for visit, and any allergy? This is the assessment form. So complete information is here. So you can go through this and you can fill this simply, and it will take you to the next level. What I have to do next. So all the informations are there. It makes your assessment and makes your next level of care, next level of planning of care, and whether to admit or send to OP or for the investigation, and everything is possible through this type of electronic assessment form, which is available near the bedside or for the patient. Here, sleep study center, advanced sleep medicine here. The patient is given procedure, any special procedure for this sleep study. So patient is having insomnia and you are sending the patient for this. So assessment is very important. So you assess the patient's sleep status and send for the investigation. So everything, the electronic record helps you to assess quickly and find out the data. So this is evidence based also. Suppose your patient said that I didn't sleep, and you can immediately take a record and note it. So open EMR. Here you see the whatever the unwanted data will be deleted, which you don't have to worry about it. And nursing informatics, an expert who combines the computer information and the nursing sciences. That's why you are studying the nursing and your behavioral science, okay, and other science from the first year you are learning, and you are learning psychology and your sociology. You are learning other subjects. It is beautifully organized in your curriculum, and your nursing science you are integrating with the computer and serves as a developer of policies. You use this knowledge to develop your own policy and procedures that promote the effective and secure use of computerized record by nurses and other healthcare professionals. So I'm not telling that you have to forget your psychology and sociology. Of course, computer is also important. By applying those knowledge with the computer science, you have to maintain the information. Computer-based client records, personal health record. It is an electronic document that contains the patient's medical, personal, and health information, but it's controlled by the patient rather than the healthcare provider. This is also available. The patient can control this record. This is an electronic document that contains the patient's medical, personal, and related to health information, but it is not operated by the healthcare provider. It is operated by the patient. So for the security purpose, privacy purpose, many patients, they don't want to show it, or others, the patient may not allow you to view the document. This is also very much available, which will be very useful. And then computer-based client records, personal health record, and electronic record of health-related information on individual that conforms to your nationally recognized interoperability standards that can be drawn for multiple sources while being managed, shared, and controlled by the individual person. He himself can control this record and manage, and they can share the information if they want. But the data is and the standards which are drawn from multiple sources. See here, this is the card. The ID card, med ID card is put inside. When you put this, the patient the patient is available. So this helps the nurse leaders to go through quickly and assess the patient and come to the conclusion that what is the care he needed. Suppose a patient is coming with a diabetic ketoacidosis, you put in the card, you get a clue that patient is diabetic, immediately come to the diagnosis, clinical judgment, and everything is possible, and the patient care is immediately available, and you are acting very quickly, and your competencies you are using and saving the patient's life. So clinical decision support system are electronic forms of charts, some templates, some algorithms, and the likes which incorporate evidence from the literature into a particular patient in order to guide planning. Some are simple alarms that appear when medical order conflict and another aspect of client situation, that is like allergies and contraindications. When you have this system, that will be warning you, so that you will not administer that wrong patient. Suppose patient is allergic to something and he is contraindicated to certain drugs. So this alerting system will help you to, this algorithm and these templates will help you to make an accurate decision and give accurate care to the patients, which will not, the unwanted reactions and unwanted things will not happen. Here, attention, renal adjustment is necessary for vancomycin. Suppose you are administering vancomycin. So here, renal adjustment is necessary. Your patient needs to have certain things. The maximum dose can be 30 milligram. Do you want me to correct? Yes. So when you go wrong, the system is alerting you. Renal adjustment is necessary. You know the complication. That's why we are studying pharmacology. So this system is giving you a warning, which is very, very important. It's a boon to our practice. Here also such thing, okay, labored breathing is or not. A patient who is having angina, so you are given assessment chart whether labored breathing is there, MI or oral rule out MI, substernal chest pain is there, history of coronary artery disease, any pain on one side, shortness of breath, whatever you learn as signs and symptoms and clinical features are given here. Whether it is there or not, you have to put a tick. That's all. Like your ventilator flow chart. Okay, the flow chart, every patient has got the assessment chart. Any disease you have, see here, all those things are recorded immediately. This will take you to the next level of decision and will alert you and give a care. Here, emergent condition, what is heart attack, whether you anticipate, whether you want to transfer the patient to ICU or you are going for ordering a ECG. So what is the admitting diagnosis, what is the length of stay, and whether any significant and eventful things, and what is the vital sign and patient compliance. So this will give you a picture to the next level of care, nursing actions. And here patient has been diagnosed with angina. This only I was talking about. So this quickly take you to confirm your diagnosis and give exact care to the patient so that you will not miss out any diagnosis. This informatics is going, I mean, we are going with using this informatics, we have to improve the quality of our care and speed up our treatment. So tracking the patient status, this is when the nurse can retrieve and display the patient's psychological parameters across time. Furthermore, standardized nursing care plans, care maps. You know, nowadays we are using care plans. For NABH, you have to do a care plan and you have to plan your care based on the outcome. Okay, your plan will be changing based on the outcome. So care maps and critical pathways, and it can be stored in the computer via electronic medical record. This is very, very, very important for the practicing nurses. So all these care plans, suppose a patient who is coming with the status asthmaticus, And you have to have a care maps and care plans and critical pathways based on the priority, which problem is first, which is bothering them most. So that type of things, care plans and care maps, critical pathways, if you store in the computer, immediately, quickly you can get it from the computer, refer it, and your action will be quick, so that you will not lose the patient's life, so that you will be very cautious. Here, patient who are diabetic, the blood glucose profile level is recorded, and it will be take you to whether they have to go for insulin or bolus is to be given. See here, the color code is given, bolus 6 and 4 and 14. So all these things are very much possible and available in electronic health records. This is very, very important, which makes your practice more easy, and it is not complicating you. Every evidence is available here through this informatics. So electronic access to patient data, client monitoring and computerizing the diagnostics. These devices with their minute but powerful computer chips make it possible to extend the nurse's observation and provide valid and reliable data. Such chips are available to extend your observation, extend your assessment, and provide more reliable and valid data, not doubtful data. More valid and reliable data are possible by this electronic, client monitoring and computerizing diagnostic. So you can give accurate information, not having a doubtful, maybe this, maybe that. No, that is not there. So more valid and reliable data are possible. Here you have, see here, the pulse oximeter is connected, and the ABG machine, and the patient is going for the CT scan machine and EEG. So when you have such chips, this patient's identification, the registration number will be there, the findings will be reaching their file. You don't waste the manpower to collect the report, and these results will be reaching the patient's report file. So from there, sitting in the nurse's station, you can view the reports immediately. Suppose patient is having some problem in the ABG, respiratory acidosis, you have to intervene quickly. You have to adjust your ventilator settings, so that it is very much, I can say this is boon. This type of practice is boon. So immediately this will, when you put the patient ID, the information is reaching to the patient in your computer, and you are acting very fast, and you are saving the patient's life, and you are not taking any risk. You are not at risk first. So telemedicine and telehealth, these are very familiar, uses the technology to transmit electronic data and observe the patients to persons at distant location. Suppose a patient who is having skin disease. So through the telemedicine and telehealth, patient is showing his back, and from here you can observe what is that. Is it a leukoderma? Is something else? It gives many ways. It gives you many, live, virtually you are assessing the patient and giving the clear information and correct information, and you are giving consulting. The patient gets some assurance, and their fear of the wrong diagnosis. Maybe they are having the fear of, I may have this and that. So by viewing this, you are giving assurance and the confidence to the patients, and this is helping us to do a very, very closer observation and give a correct decision and correct suggestion and correct reference to. Okay, you are referring the patient to the correct place. Say for example, not only diagnosing, your nursing care also, how to what to do with this. Maybe some wound they are showing it, and how to dress that wound. All those suggestions you can give through the telemedicine and telehealth facilities. The practice management terminals are there available to use to order supplies. Order your supplies like your goods, daily goods, test, meals and services from other departments. This we are practicing every day, nothing new. Computers used extensively for scheduling the appointment and staffing scheduling requests also. Okay, appointments are given through the computer from the clinics, and for insurance keeping, so that billing can be accurate. So this is very, very, the terminals are available even in India nowadays. Today in the small hospitals are practicing this, you all know. From the community and home health, a computer placed in a high-risk patients' families' house allows them to access information on a variety of top search, internet or email. A healthcare provider, the questions and concern, you can approach the nurse. Home alert systems that allow the patient to signal based on station in an emergency situation, and uses notebook computer to transmit data to the main office. This system is also available from sitting in home. Your data will be available and it will be transmitted to the main office, so that they alert that particular home or particular community. This is the health problem is available. So the healthcare delivery system is accessible, and it will be sent to your home setup. Case management, tracking of a group of clients, not only one. So here the caseload, the multiple patients keeps abreast of the latest regulations affecting the eligibility for healthcare benefits, suppose insurance, the reporting requirements of the payers agencies, and the details for about the variety of service providers that the patient may need to access. Here the the diagnostic related insurance facilities, so the healthcare benefits, what are they are eligible, the reporting requirement, what all they need to report to the payers agencies, insurance agencies, all those things are available in that group of clients. They can approach and get the information. Certification for informatics, there's a course available for the nurses in America, American Nurses Credentialing Center, that is called ANCC. To become a certified informatic nurse, it is also available. Okay, additional qualification should be a registered nurse and at least bachelor's in nursing. Continuing education and clinical practical experience should be there. So this degree is credentialed by the American Nurses Credentialing Center, which will be very useful. People who are practicing in a very sophisticated setup, such people need to get this type of a credentialing, this type of a degree. And then the ANCC offers a variety of certification options related to this position, that is Nurse Executive Board Certified credential. To become a certified administrative nurse, you must have a registered nurse license and must complete 30 hours of continuing education that is very specific to nursing administration within the past 3 years. That is very important. So these are all also available. So you may be thinking that how we will be how we will be trained, all those things. So this is all available in abroad, but don't worry, anyway in Indian scenario we have our basic computer skills which what we need to know, which are there in your first year. And even when you are put into the hospital for practice, you will be trained to do the basic skills and basic operations and basic applications. So totally for the nurse leaders it is very important. Informatics for the future of nurse leadership. As technology and information is continued to grow and evolve, nurse leaders will be increasingly expected to put technology into practice. So you have to incorporate your technology into the practice so that it should improve your, and wherever you are, we are put into the leader, position, whatever position, if you are a practicing nurse, that should improve the quality of care, it should save your time. If you are a leader, you should be coordinating the care very well and organizing and effectively placing the nurses, so that should be there. So creating a process that ensures all nurses adopt and adhere to the policies and procedures and principles related to the information system. You have to conduct research and explore how the top medical and administrative staff can utilize the informatics. So you have to do a research, the top administrative person, how effectively should utilize this informatics, that should be there. And building a culture that embraces the informatics as a regular part of practice. So it should not be starting with one particular period, one particular season. It should be a regular part of practice and supports the professional development. It should be supporting the mentoring and guiding education and career path exploration. So because computing is becoming continuous innovation and miniaturization of technology is evidence. So consequently, you have to partnering between nurses in all specialties, and new technologies is becoming imperative. It is mandatory. You need to undergo this. You cannot avoid technology, otherwise you are, you will not be updating your knowledge. So acute care, outpatient care and home care, all the areas are connected. Need knowledgeable practitioners to investigate, implement and use automation. Practitioners will be hired not so much for their knowledge of skills as for their ability to handle information, to make correct decisions that produce cost-effective results. Whatever the decision you make, that should give a cost-effective results. It should not be very expensive. You apply the technology, that should not be very expensive. It should be a cost-effective one. So what are the emerging roles? You have entrepreneurs, product developers, web designers, independent consultants. So challenges which are put into your in front of you is integration of data is very important, because there are chances of duplication of data often, and inability to access data for decision making. So you are not in a position to make a correct decision because of the inability to access the data. The accessibility is not there, so your decision making is poor. So these are all the challenges which are put in front of you for the nursing leaders leaders in using the informatics. So that there are very, very advancing roles are available. You can become an entrepreneur and you can become a product developer for the improvement of the nursing care. You can become a web designer and independent consultant for nursing due to rapidly changing scenario and technological advances. We need to update our knowledge in the technological aspect, and healthcare systems also assimilating technology into daily practice at a quick roll. You are forced to learn the technology and you have to update your knowledge in technology so that you can pick up the speed. And security and patient privacy must be upheld. That is very important. Security of the patient and confidentiality and patient privacy is very, very important. And so that you can achieve the goal of transforming data into useful knowledge. So if you maintain the safety and security and privacy and confidentiality, so your data will be transformed into the new and useful knowledge. So that integrating informatics with the evidence-based practice with your research can only help improve the care, whatever we provide to our patients, so that will be effectively utilized. So the informatics, whatever you have, should be effectively integrated with the research. Simply you cannot integrate the information. You need to do lots of research. Then only that will, the both thing will go in hand and improve the practice and the care. Applying technology to knowledge may help identify the potentials problem earlier. For example, with the use of electronic documentation, identifying the changes in the patient status, as I told you earlier, can occur quickly and because the information is readily available. So trending of patient vital signs is always accessible and the data are interpreted immediately and systematized and arranged. The nurse is able to use this knowledge to formalize an appropriate plan of action, an appropriate change in the plan of action, and make it gives you a flexible plan based on the priority. When you do this, then applying the technology, your priority is coming first. So you can, as we teach, no, priority is important. So this technology is helping you to prioritize the problem and give the exact care. To conclude, nursing leaders require a variety of unique skills, including informatics, to support the delivery of safe and effective patient care. So the future is now, let's embrace it. So this is what I want to conclude, whether the nurse leader may be in the academics or in the service side. So you need to know, require a variety of unique skills. So that's how we are all now learning and applying the unique skills, I mean, including the informatics, and to support the delivery of safe and effective patient care, not only in patient care, communication, sharing of knowledge, organizing a big conference like this, and many things we are doing by using the unique skills. And we are all nowadays, you see, after COVID-19 pandemic, we all became expert in utilizing the technology. The COVID-19 pandemic was a stressful thing, but still I thank that, because all of us know, I mean, learned some technology and we are able to connect digitally. It takes in a few minutes, we are connected digitally. Even if you make a phone call, many things are there, but within a few minutes, you are connected digitally. You are able to see them, you are able to share your knowledge, and then the sharing of ideas, everything is possible. So let us embrace it. Thank you very much for giving me this opportunity, and I thank Dr. Kanyamal, my teacher, beloved teacher and a mentor, who taught me many things from my student period till date. And I thank you, madam, for giving me the wonderful opportunity. Always you give me such a nice topic to explore and read, and you give opportunity to learn for me also. And thank you very much. And I thank your crew for organizing a wonderful webinar. Once again, I thank you all.
Thank you very much, Revati. So you have given justice. I know which topic who will cover in an effective way. So that's why whichever may be the topic I give, you will do justice. So that is my belief, and that is proof also. So I am very happy. It is highly informative. No one can escape from the technology. So along with all the technology, we also have to grow as being student or a faculty or maybe a staff or maybe a leader, whoever it might be. If we are just omitting technology, we are away from that healthcare delivery. So that's why So it is a very excellent, and then all sharing of. I am very pleased because you used to share many knowledges from you served in other countries also. So you used to give us like a rain. You used to give all the content. So that's why this topic is given for you, and I think I believe you have given justice for that. I wish you all good luck, and thanks for your cooperation, and then spending a blended that experiential learning with the technology. So nice. May God bless you.
Thank you, ma'am.
Yeah,
Thank you,
so
ma'am.
much.
Thank you, ma'am.
Thank you so much.
Thank you, ma'am. Thank you all faculty members. Thank you.
Thank you, ma'am. Ma'am, Revati, ma'am, we have a question from delegates, ma'am.
Okay,
So
what
the question is, how technical competencies will help for nursing leadership?
Technical competencies, how it will help. See the technical competencies in planning you're planning your staffing. Okay, effective. So if you are an expert in planning your in the computer, in the informatics, you will plan effectively the staffing pattern. You will anticipate and you will plan so that there will not be any shortage. Okay, the nurse leader anywhere the staffing is when it is planned properly, you will not face any shortage. So that there are many modules available that you can plan your staffing based on your patient care, patient strength, so that when you feed your number of staff, okay, when you feed your number of staff and the number of patients and what is the level of the care setting, whether it is acute care setting or the critical care setting, it says that whether the staff is how many ventilator patients, it says that your staffing is inadequate. So that when you improve your staffing, it improves definitely the nursing care. So it is very much essential for the nursing leadership.
So here
The leadership.
I would like to share the leader is not only the top level. So we have various level of leaders from morning. We are even from student. We are having a clinical leaders, and then the staff nurses, and then the supervisory level, then about to top level, and then to the head level. So all the level we need to have, because the technology, without technology we cannot for providing care or supervising or allotting faculty or staff, whatever it might be, it is not possible. If the leader is know about the technology only, if any error if it occurs also we can correct. So even for the supervisory role, and for a staff nurse, without technology she cannot able to teach. For example, in the integration component for the students are more technologically advanced, and they know better than us, and we have to learn from them. So these are the handicap which it have for the contemporaries. That's why we need to update in all the way, then only we can able to do justice whatever may be that kind of leadership level. So not only the top level, how it is useful. For everyone, it is useful only. Everyone is a leader in a different level. That's all. So that's what.
And one more thing.
Yeah.
One more thing, ma'am, I want to add. As madam said, to correct and supervise for the training and the development, the nurse leader must update their technology. So if they train effectively, there will not be any error, so that it improves the quality. That's how I meant. So when you train your staff effectively, your quality is through them, you are delivering a good nursing care, quality nursing care. So this, that's what I was speaking, how these technology is helping us to improve the quality of nursing care. As madam said, not only the top level leader, every nurse should update their knowledge in technology to give a quality nursing care. Thank you very much, ma'am.
Yeah, that is there. Even recently, I had one experience I witnessed in one hospital. So even measuring for the weight, the weight scale, there was an error, no calibration. It was done. So the based on that weight only, that other treatment modality it is going on for the kid. So that it makes a lot of differences without knowing the technology or calibrations and other thing, even at the top level or whoever the doctors, whoever may be. So doing for error, it is there. We need simple technology, I am telling. So for example, she was quoting about that mode, ventilator mode and an ICU setup. So without knowing, the students are also struggling, means you cannot be able to help the students as a supervisor if you go near to the bedside, or maybe the staff nurse, without knowing the setting of that, where to use synchronized or non-synchronized mode, which type of mode to be delivered or fixed for the patients, we may not be knowing on that. So each technology we need to know. One more thing I would add to, even the Prime Minister, Chief Minister, the MGR, once it came rounds for when I was a staff nurse in Salem GH. During that time, he was just seeing that X-ray top down, and without knowing. So that's what I am telling. They are also great leaders. They even run the nation. But what I'm telling, nation or a state, whatever it might be. So that is a technology, simple one, couldn't able to know. So that unawareness, it may lead into pathetic situation. So that it is a need, and we have to update with corrections, with calibrations, whatever may be the thing, at whatever may be the level, we need to be updated. So thank you, ma'am. Thank you.
Thank you, ma'am. Thank you, Dean, ma'am. Thank you, Revati, ma'am. I hope the delegates would have got answers from your from the questions, ma'am. Thank you, ma'am.
Thank you. Thank you so much.
Thank you, ma'am, for very informative content on how technological is so important in healthcare delivery system. Thank you, ma'am.
An ounce of practice is more than the tons of preaching, said by Mahatma Gandhi. This practice makes us more efficient with evidence. I'm so privileged to hear in-depth knowledge on leadership in nursing research and evidence-based practice by Dr. L. Lakshmi Ma'am, Dean, Satyabama College of Nursing, Chennai. Lakshmi Ma'am is my principal when I did my postgraduate. I'm so excited to hear your presentation after so many years, ma'am. Now I request Mrs. Valarmadi, Assistant Professor, SRM College of Nursing, to introduce the speaker.
We welcome you, Lakshmi.
Hi, ma'am. Good afternoon, everybody. How are you all? I know you are all damn hungry. I understand. My presentation will be very, very, very small. Don't worry.
Good afternoon, ma'am.
Yeah, please.
Yes, yes, yeah.
Good afternoon, ma'am. Thank you for this opportunity. Actually, it gives me an immense pleasure to introduce an eminent speaker, Professor Dr. Lakshmi, Madam, Dean, Satyabama College of Nursing, Satyabama Institute of Science and Technology. Madam completed her BSc in Annamalai University, Chidambaram in 1989, MSc Nursing in Manipal Academy of Higher Education in 1997. Madam received the doctorate in nursing in the area of geriatric nursing in Chettinad Academy of Research and Education in 2016. Madam's professional journey, Madam has completed 31 years of professional experience in the field of nursing. Still it's continuing, but I just give a expression towards the participants. Madam started her career at SRM College of Nursing from 1990 as an assistant lecturer and held various positions like lecturer, assistant professor, professor. Totally 15 years of experience at our SRM College of Nursing. Madam rendered her remarkable service up to 2005. After Madam held a position of professor cum principal in Belaras College of Nursing for 2 years and Chettinad College of Nursing for 12 years, and since 2019 to till date, holding a position of Dean, Satyabama College of Nursing, Chennai. Madam received many awards. Madam got a Best Community Health Nurse Award by Manipal University, Best Nurse Educator by Education Times, organized by Tamil Nadu Nurses Midwife Council, and Bharat Vidya Shiromani Award for Outstanding Achievements in chosen field at activity from Indian Solitary Council, New Delhi. Madam is an author of book, Textbook of Community Health Nursing, first and second, published by TNMC, and Community Health Nursing Logbook, and published by the TNMC. And Madam is the author of Textbook of Nursing Administration and Nursing Management and Nursing Administration, published by Elsevier Publication, a review of Community Health Nursing, published by the Elsevier Publication. Madam disseminated her professional knowledge through more than 30 national and international conferences as a resource person and more than 10 research papers and presented in the nursing conferences, organized many national and international conferences in the service, and 17 research articles in the national and international journals. Some other credential about Madam. Madam is an inspector for INC and TNMC and the executive member in the Tamil Nadu Nurses Council and Midwife Council and member of examiner for panel in universities like SRMC and Tamil Nadu in other state of India, moderator for PhD Vivavos in SRMC University, Pondicherry University and SVM University. Madam is an excellent nurse educator, nurse researcher and nurse administrator and nursing leader. With this quote, I request ma'am to take up this session to enlighten the participants' mind.
Thank you. Thank you. Thank you so much for your detailed intro. I don't know, credit goes to Dean Madam. Actually, I am known to everybody. All of the resource persons and the panelists are my friends and colleagues. So
Yes.
good afternoon to everybody. Before I could start, I would like to thank the management, our Dean Madam and the faculty members of SRM College of Nursing, SRM University for giving me this opportunity to join you in this platform. And the topic is really wonderful. So whoever has chosen, again, credit goes to the Dean and the team. So the topic is really a wonderful topic. Only the thing is, I have made it as so short so that you could go for lunch so early. So I remember a proverb here in Tamil. Sevikku unavillada போது சிறிது வயிற்றுக்கு ஈயப்படும். But in this situation, you will change the proverb. That is, வயிற்றுக்கு உணவு இல்லாத போது செவிக்கு சிறிது ஈயப்படும். So I will try to give you little to your ears. Okay.
Good note. Yes.
I will share my screen. My screen is visible?
Yeah, yes, visible. Yeah.
Yeah, thank you. So topic given is leadership in nursing research and evidence-based practice, EBP. We used to tell this term EBP in our clinical side. So as Selvi, post Selvi, somebody introduced me, I'm the dean working in Satyabama College of Nursing. So though the topic is well known about leadership, nursing research, evidence-based practice, but still there are few points to know about this, because you all have already learned a lot in your third year and fourth year. Most of you are from UG program and PG program. So you would have studied this topic in your management and administration, but still there are few brush-ups to be done by me. So what is meant by nursing leadership? Actually, what is it? Nursing, who is a nurse? Nurse is a care provider. We are all, we have known this topic well, the term well. So the nurse is a care provider. But the nurse, whoever is highly interested in her career path. See, if you ask me, I still remember when I joined in my UG program on the first day, my class coordinator of first year in Annamalai University, madam asked me, whoever with the interest have joined in this program, except me and a few more, most of the students, they raised their hands. So madam, then she asked me, why you didn't raise your hand? I said, actually I was supposed to join in medicine, but I didn't get it. Then I joined in BPharm. Then it was not interesting. Luckily, I joined in nursing. I don't know whether I am fortunate or unfortunate to join in nursing. That time I told, but now I'm proudly say that I am highly fortunate, okay, in joining nursing. So I said, madam, without with the high force and pressure from my parents, I joined. And so after that, once I started seeing the patients, the interest automatically came inside. So I am telling, unless you have interest to become a nurse, you cannot. Same way, unless you have interest to become a nurse leader, you cannot. Okay. So a leader within a healthcare organization who represents the interest of the nursing profession. So she is the representative. The leader is the representative. And she is also in refining skills to differentiate them from the competition and to the advanced practice level. Then Why it is important? Why nurse leadership is important? Uh, you would have heard about this freedom fighting stories and all. Everybody has started fighting for freedom. But what happened once Mahatma Gandhi ji entered into the war, then all the small leaders and others just joined hands to Mahatma Gandhi. Same way, a leader is highly needed. See this picture. This is a team where the leader, he or she gives the instructions to the team members about COVID care. Is it not? So a leader is necessary, highly needed in any profession, and especially in nursing. There is no wonder in it. So this is to improve the quality care and patient safety, and the learning oriented atmosphere can be created. That's why we are learning in the ward setup. Even today I am learning. When I went for rounds, I learned a lot. Then it provides a vision for the leaders, and to fulfill the objectives of the organization or the management, and it builds the gap between the policy and the practice. Finally, transformation. This is, though this term is very small, but it gives a meaning a lot. So transformation in the healthcare system, that's why nursing leadership is needed. Dr. Revati, she spoke a lot about leadership, but still I want to touch it. So what are the qualities of a leadership? In general, if you see, you have to have an awareness. Madam also mentioned, Dr. Revati also made a mention about it. So awareness, what is occurring, what is happening around us. So awareness, then decisiveness, empathy. I'm not talking about sympathy. Ayo, paavo, that is sympathy. Empathy means you are making yourself stand in the position of the patient, and you could locate the pain, you could realize the pain, you could feel the pain. That is empathizing. Then accountability, of course, we are all accountable, and confidence level should be increased, and you should be always optimistic, not pessimistic, always positive oriented, and very much honesty, and you should be always focused to your concept, and finally you should inspire others. Okay, these are the main qualities of a leader. Then coming to characteristics, characteristics are different from the qualities. Characteristics, of course, I have to be intelligent, I have to be competent enough, and I have to be always conscious what is happening. I should always be conscious. Then emotional intelligence. Then finally, I should motivate others, my team, my subordinates, my colleagues to involve in nursing research. Then only I can become a effective leader. I just want to show some of the pictures of leaders in research. Madam Dr. Soumya Swaminathan, initially she joined as the director in ICMR, Chetpet. Then she was promoted to World Health Organization, WHO, as deputy director. Then Madam Shanta, recently she passed away. So both are eminent leaders in research, especially I'm talking, especially in community research. Madam did a lot in community cancer research. Okay. Then Madam Soumya Swaminathan in community research in pediatrics. She did a lot. Okay. Then I'm proud to show the picture of my teacher, Dr. Aparna Baduri, who was an eminent leader and worked as the PG coordinator in Manipal University when I did my PG. She only taught me how a research should be conducted. She only taught me how a transformation process is required for a nurse. So I'm proud to show her picture here. So the leadership in nursing research, it plays a critical role in transformation. See, if a person comes from a village, he will be dead, he will be illiterate, he may not know, he will be so ignorant and innocent. Once he comes to the urban area, I'm a community health nurse, so I will use all these terms, sorry. So urban area, when his education level goes up, totally he will be transformed, okay? So totally he will be changed, is it not, in a positive way? So that is called transformation process. And nurse leaders should be in key positions like our madam. Then concerted effort. Concerted means it is coordinated effort. I alone cannot do any research. Even third year BSc nursing students, project work, group. They will form a group and they will conduct projects in different areas, pediatrics, medicine, surgery, and community. Yes, same way, you have to have this concerted effort with the other subordinates and other nursing staff and other nurse leaders, then only you can conduct an evidence-based practice. Actually, like epidemiological triad, this leadership is also a triad where you have to have a senior nurse leader, then nurse researcher, nurse manager, then only they will be called as leaders. So this is the triad. So it is again coordinated activity. What do you mean by evidence-based practice? This also again you would have studied in MedSearch. This is a problem-solving approach to clinical decision-making that incorporates a search for the best and the latest evidence, clinical expertise and assessment and patient preferences, values within a context of caring. So evidence-based practice, if you take this COVID example, initially the COVID was, the vegetarians will not get affected with the COVID, only the non-vegetarians. Again, depending upon the various strains of COVID virus, again, the concept was changed based on the ICMR research. So, why I'm telling, based on the evidences, based on the patient's problems and the signs, symptoms, it keeps changing. The solution for any problem will keep changing. So, you have to have, as a nurse, you have to have a problem-solving approach in the clinical setting. So, these are the different steps in evidence-based practice. First of all, what is EBP? First, you identify what is EBP. You ask yourself, P is for patient and I is for intervention and C is for control and O is for outcome. So all these things you would have studied in nursing assessment. Same thing, just I am presenting here. Then you have to have acquire knowledge. When you face any problem in the clinicals, first of all, you go through the literature, you go through the review, go through the various research articles done in other countries. Then you acquire knowledge. Then you make your appraisal. Finally, you apply and do a reassessment. Okay, these are the different steps in evidence-based practice. Why it is important in nursing? Nursing, as we all know, nursing is a science and nursing is a profession. Wherever we are working as nurses, whether it's in the clinical setting or in the community setting, but the research has to be conducted and in the grassroots level, it has to be conducted and it has to be translated into practice. Okay, so evidence-based nursing facilitates paying attention to efficiency. And what are the aims of using this evidence-based practice? One is to improve the patient experience and health outcome and decreasing the healthcare cost. Just to see the COVID-19 situation, initially it was, a package was 45,000, now it came down to 12,000, now it is on free of cost. Okay, then improving the work life of nurses and their well-being status. That's what is government, our Tamil Nadu government is doing now. Okay, and what are the benefits of evidence-based practice, madam? What is this, madam? Every day we go to the clinicals, we give care. And what is it? Why evidence is needed? Unless you have an evidence, care cannot be produced, care cannot be modified, is it not? So it helps in improving the patient outcomes and to raise the overall quality of care and lower cost of care and superior nursing skills. So these are some of the benefits of evidence-based practice. In 1990s, if you see, there were so many papers published compared to the recent period. In 1990s, there were so many papers published, so many articles published, and so many guidelines produced, and so many discussions and conferences were conducted in 1990s on evidence-based practice. But what happened? There are no worldwide studies showing what proportion of practice is evidence-based in nursing. So compared to other fields in nursing, it is very, very, very less. So you could not compare, or you cannot do any comparative study in other countries compared to China. What is the situation in India, COVID situation? So the studies are very, very minimal. Okay. Then nurse leaders are the central to develop evidence-based nursing practice. That is why we need nurse leaders. See the picture, how it is coordinated. So what are all the nurse leaders' role? Though it was mentioned by Dr. Revati, but still, one more slide I'm trying to show you. This is the nurse leader, she has to or he has to set the vision and establish the priorities. What is needed now, currently, what is the scenario, what situation is available. So establish priorities, then manage resources and facilitate for success. To lead a successful path, what steps we have to take. Then support evidence-based practice by communicating with unit staff. I have seen when I went for rounds, a small, the ANM, no, nurse aide actually, 6 months course she has undergone. She was just helping the nurse, okay. So what happened? She was telling, Amma, patients, இது ரொம்ப கம்ப்ளைண்ட் பண்ணதுமா, இந்த ஷீட்டு போட்டா கம்ப்ளைண்ட் பண்ணுதுமா, பிடிக்கலன்னு சொல்லுதுமா, நம்ம இந்த ஷீட்டை மாத்திக்கலாமாமா, நீங்க வேற கம்பெனி ஆர்டர் பண்ணலாமா. Then again you have to do a research to change the bed sheet. So you cannot ignore the knowledge, the assessment done by ANM or class 4 workers or the DIs. Who knows? In conducting deliveries, DIs are highly skillful. Experienced DIs are highly skillful. We may not know. So you please go reach them, collect their ideas, add them in your team. So teamwork is very, very important. There are 12 steps to lead the evidence-based practice implementation. One is you have to collect the data from the patients and the healthcare team, other team members, compile the data and find out the rationale. And based on the rationale, you just assess the organization readiness. I have collected the data, these are the problems, but how my organization is going to help me in reaching out the patients, okay? Then create a compelling and exciting vision for change. Then solicit input and vision from all the key stakeholders and the other staff members. Then convene a leadership team, convene a conference, convene a workshop. You discuss, then come to a conclusion. Then provide effective change and give them training, give them education, conduct orientation program, conduct in-service education program. You tell them what, whether this robo catheter is, this one, robot catheter is used or some other catheter is used for this endoscopic procedure. So all these things you, based on your experience, you discuss with your team members, okay? These are, and use evidence-based implementation. Then do a quick wins, engage in small change. That also you should get engaged. Finally, provide regular recognition and appreciation, okay? These are, and evaluate, finally disseminate the progress and find out the outcomes. If you couldn't reach the outcome, and again you do the reassessment, recollection of the data, then do your compilation of your data. These are the 12 steps in conducting evidence-based practice, okay, which is to be followed by the nurse leader. Then what are the different strategies to be used here? First one is engage and inspire curiosity of nurses. ஐயோ இந்த நர்ஸ் வந்துட்டாங்கடா ரவுண்ட்ஸுக்கு, ஐயோ போருடா, இந்த ஹெட் நர்ஸ் வந்துட்டாங்களா, பல 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 பலன்னு கத்துவாங்கடா. That should not be there among the staff nurses. So inspire curiosity. You ask them, என்ன problem நீங்க face பண்றீங்க sister, please tell me. Then improve safety and quality in nursing practice, especially in COVID. You have to improve your safety measures. Then motivate the nurses, give positive reinforcement. Suppose they convene something, if they conduct something, some workshop, some seminar or small discussions, you give them small, even or kuchi mithai kudu. As a nurse leader, you give a small kuchi mithai. That will be a positive reinforcement for the staff nurses. Then provide mentorship. Mentorship you would have known very well, especially in deemed universities. So mentorship is, you have to have a mentor and all the students will be the mentees, and mentees will discuss with the mentor about their personal problems also, why they are academically very poor. So the same way, you please conduct mentorship program in research. Okay, then stepping up and supporting research, utilization of evidence-based practice, then educate and renewal of research enthusiasm. Do a renewal. See, we are a license renewal we are doing. Same way as nurse leaders, do a renewal of their knowledge, okay, by conducting in-service education programs. Believe in yourself. Cultivate positiveness among the colleagues, junior nurses, junior team members. So as a nurse leader, these are the main strategies. So with this, I know I have done my presentation very fast, but can't help it. Anyhow, I will again share my PPT, detailed PPTs to your madam, so that to our Dean madam, so that she could send it by mail to all the participants. Extremely sorry to make it very short. Thank you so much. Thanks for patient listening. Really, I troubled you a lot during your lunch hour. Thank you so much. Any doubt? I know you could not ask me questions because if you will open only for your food, I understand.
Thank you, ma'am, for your insight knowledge on evidence-based practice.
Thank you.
Dear delegates, let's move for lunch. During lunchtime, the session has no break. Our technical team will be posting motivational videos. So enjoy your lunch with videos and join the presentation by 2:30 p.m.
Thank you.
Thank you, Lakshmi.
Thank you, ma'am. Thanks for the opportunity given, ma'am. Thank you, ma'am.
Not at all. You are welcome always.
Always I will accept for SRM because SRM is my parent institution.
Yeah, that calmness.
Yeah. From the tutor level, I worked. Actually, I joined in SRM. From the tutor level, I raised to the vice principal, and then I came out after 14.5 years. So I'm really proud to say that all these credits go to the SRM management and the team. SRM.
Thank you,
ma'am. Thank you, ma'am. Thank you.
SRM is a very good banner for everyone.
Everyone.
The management provides a very good platform to grow for everyone for the nursing. Really, we are in depth thankful for the management. So once again, thank you, Lakshmi.
Thank you.
Thank you. Go for lunch for you also.
Yeah, thank you. Thank you. Definitely.
Thank you, Ma. Thank you.
Bye.
God bless you. Yeah.
Thank you all. Thank you.
We got a rescue on our hands. You there. Here we go. Narito na. Wimpo! Okay, pivotara. Pomelo?
Uh-oh.
son. Move it, move it, move it. Hey, you there, pick up the pace. You're falling behind. Come on, let's go. Everyone, pull together. We got a threat to our hands. You there. Here we go. Norituna. Wimpo. Okay, pivotara.
Good afternoon.
Ma'am, please unmute, ma'am.
Good afternoon, ma'am.
Good afternoon, Viji. Good afternoon, Anita.
Sorry for the delay.
இல்ல அதெல்லாம் ஒண்ணும் இல்ல. ஆல்ரெடி நம்ம டைம் கொஞ்சம் டிலே தான் ஆயிடுச்சு.
இல்ல ma'am. For me, it's some technical error was happening between, so couldn't log in into that.
ஒரு செஷன் வந்து ப்ரீபோன் எடுத்து முடிஞ்சிடுது நமக்கு முன்னால இப்போ. அதனால வந்து கொஞ்சம் தள்ளி போயிடுச்சு அப்படியே. ஒரு ஸ்பீக்கர் கொஞ்சம் இடையில கொஞ்சம் ட்ரபிள் இருந்தது. அப்புறம் அதனால வந்து ஒரு செஷனை ப்ரீபோன் பண்ணோம். அப்புறம் அப்படி அப்படியே போயிட்டு இப்ப நம்ம தான் இப்ப மத்தியானம் இருக்குது. அது இன்னொரு ஸ்பீக்கர் கிளமெண்ட் வந்து கொஞ்சம் அவருக்கு ஆடியோ டிஸ்டர்பன்ஸ் இருந்தது. அனிதா,
என்னக்கா எப்படி இருக்கீங்க?
நல்லா இருக்கேன். எப்படி இருக்கீங்க?
நல்லா இருக்கேன்.
ஃப்ளாரன்ஸ் நைட்டிங்கேல், அனிதா ஃப்ளாரன்ஸ் நைட்டிங்கேல்.
Good afternoon, ma'am.
Good afternoon.
Good afternoon.
Good afternoon, Anita ma'am. Good afternoon, ma'am.
Good afternoon, ma'am.
Nice.
Good afternoon, Viji.
Good afternoon, Sidi ma'am.
Good afternoon, dear.
Hi all, nice to see you all. Hi.
Yeah.
Thank you, ma'am.
We are meeting in the COVID time. We met once and then again now we started meeting again.
Yes. Ma'am is giving us an opportunity.
He's also we all one. So it is not. No, we everyone have to be in a team and then we have to discuss and we have to share our experiences. So that's a way.
Anita ma'am, I'm seeing you after a long time.
I'm also seeing you after a long time. How are you, Sri?
Yeah, I am fine, ma'am.
Sidi ma'am, video காணோ. வீடியோ பார்க்க முடியல.
Video and audio.
Sidi ma'am வீடியோ இல்ல.
Nalini,
இல்லையா? வீடியோ இல்லையா? வீடியோ ஆன்ல தான்டா இருக்கு.
who's there?
இருக்கேடா.
ஆன்ல தான் இருக்கு.
Nalini ma'am, good evening.
Nalini ma'am.
Good afternoon.
Nice to be.
Good evening. It's good afternoon.
Ma'am.
Nalini ma'am, good afternoon.
Hi, Viji. Good afternoon. Nice meeting you all after a long time.
Yes, ma'am.
Yes, ma'am.
You're fine. Well, good.
Good, ma'am.
Your health.
Good.
Yes. Nalini. What, Nalini? Are you fine? What about
You're fine, ma'am. Everything fine.
Very good.
Completed our NAC inspection.
Very nice.
Wow,
Score
wow,
of
superb.
2.53. So that was the great achievement
Great
with the
job.
new year starting.
Great job you have done. Yes. Good.
Shall
Now,
we start
we
now?
had last year, I think we got it. So yours renewal is now. Huh? Good. Yes, all of us, we have joined the panel. Audience are there around 200.
Ma'am, Fabi ma'am மட்டும் இன்னும் வரல ma'am.
Yes, ma'am. Fabiola, ma'am.
Fabiola.
Yes.
Ma'am.
All of you have your
All of them have joined, ma'am.
lunch. Had your lunch?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Shall I start, ma'am?
Yes, yes, ma'am.
A good discussion increases the dimensions of everyone who takes part. Here we are going to have a rewriting panel discussion on collaborative nursing research enhances quality patient care. An eminent fascinating speaker as moderator, Dr. C. Kanniyamal ma'am, Dean, SRM College of Nursing. I request Mrs. Bhuvaneshwari, Assistant Professor.
Audio is disrupted.
Ma'am, am I audible now, ma'am?
Now you are at.
Yes, sir. Yes, sir.
Yes, ma'am. Sorry, ma'am. A good discussion increases the dimensions of everyone who takes part. Here we are going to have an rewriting panel discussion on collaborative nursing research enhances quality patient care. An eminent fascinating speaker as moderator, Dr. C. Kanniyamal ma'am, Dean, SRM College of Nursing. I request Mrs. Bhuvaneshwari, Assistant Professor, SRM College of Nursing, to introduce our respected Dean ma'am.
Oh, it is all known, not needed.
Okay, ma'am.
Everyone knows
Okay.
about me. No
It
introduction.
takes, okay, ma'am. Now I take immense pleasure in handing over the session to our respected Dean ma'am.
Yes. Very good afternoon to one and all, for the panel member and then the faculty and students of the audience for the panel session of today. So here I'll start the panel discussion with a quote of "Alone we can do so little. Together we can do so much." So it is a teamwork with the quote. So we will start that panel, the discussion theme on next one. Theme on the panel discussion theme. So the collaborative nursing research enhances quality patient care. So I myself as a moderator of this session and panel members, Dr. Anita Rajendra Babu, Principal, Rajalakshmi College of Nursing, and Professor Vijay Lakshmi, Principal, Tagore College of Nursing, Dr. C.B. Zos, Principal from Venkateshwara College of Nursing, Dr. S.J. Nalini, Principal, Faculty of Nursing, Sri Ramachandra University, and Dr. Fabiola Mercy Dhanraj from Principal, Arulmigu Meenakshi College of Nursing. And again, my colleague, Professor Vijay Lakshmi, Vice Principal from SRM College of Nursing, are the eminent panel members of today's session. Now, it is my privilege to introduce Dr. Anita Rajendra Babu. Anyone is introducing about, or I can proceed, ma? Do you have any plan? Priyadarshini? No. Okay, I think we all are known. We are introducing ourselves. So that's all. Anita and myself are co-classmates for MSCs, and till now we are with good friends, good note. I would like to introduce the speaker, Anita Rajendra Babu. She is highly dynamic and she is having a lot of inherent potentials either in the academic or in the administration. Lot many with times short. She has to move for some another meeting, so we don't want to waste the time. So everyone know about her profiles and everything. So I would like to start the session of collaborative nursing research enhances the quality patient care. So here the coordination and delivery of safe, high quality care demands reliable teamwork and collaboration within as well across organizational, disciplinary, technical and cultural boundaries. It is apparent that interdisciplinary collaborative nursing research is a necessity in practice disciplines such as nursing. Models of academic and practice partnership for nursing research are lacking. Reforming the organizational structure to facilitate collaborative nursing research is the need of the hour. So the nursing profession is facing increasingly complex healthcare issues driven by the technology and medical advancement. So we need a collaborative partnership between the educational institution and agencies in terms of to facilitate comprehensive coordinated services that are evidence-based. From morning we have seen what is the evidence-based and cost-effective and technological oriented. Everything we have discussed. The final discussion is with the panel. We are going to conclude the session today. With this note, I would like to call Dr. Aditha Rajendra Babu to talk about or to highlight on reforming the organizational structure to facilitate collaborative nursing research. What is the thing it has to be done? So this is what we are going to expect from the speaker, first speaker, so Aditha Rajendra Babu. So, yes.
So thank you so much for inviting me to your institution. Today we are going to talk about reforming the organizational structure to facilitate the collaborative nursing research. Research today is increasing in nursing. Important part of nursing is research has been become. So avenues for nurses is expanding their roles. So nurses are now wanting to do research more diverse problems and to observe patient in more than traditional hospital system. So independent research, many nurses has to rely on the hospital, physician, specialty areas such as psychiatry, where the diagnosis of the patient can be a particular importance and carry implications for research process. So when you talk about the collaboration with other disciplines in research offers a practical solution to many of such problems encountered in nursing research. It offers access to the patients who may otherwise is very difficult to find. And it is focused. When you're talking about nursing, the focus from being too narrow and it allows to a broadening of the viewpoint. Then collaborating with other disciplines, one have to build in consultation system. So this has many advantages, that main one being access to information such as diagnostic criteria and psychological testing. So collaboration allows other familiar with the expanded role of the nurse. So many nurses are researching concepts pertinent to a particular specialty area which may or may not be a measure to direct nursing action itself. So too many disciplines, this is seen as an expanded role. Before we can talk about reforming strategies, first we have to understand about by the collaboration. When we talk about the word collaboration, here the concept is widely used, like everyday language we use that what is collaboration. Here we say clear understanding. Some meanings of collaboration includes like many persons interacting to achieve the common goal, an active ongoing partnership between professional and the institution, and the process involves cooperation, communication, negotiation, trust, respect, and understanding to build an alliance that maximizes the contribution from each participation. So it involves work together, functioning cooperatively as colleagues and equals with the respect and view to find solution together. So in the essence, collaboration is the practice of sharing knowledge and ideas to achieve a common goal. If we see as a childhood, we are encouraged to work as a team. At the same time, we also retain our independence and skills to work alone. So that is more important. So in today's fast world, we need to face beneficial partnership to encourage creativity. This we can call it as another way. We can say like it is a wisdom of crowds. Like many people, like some call it as a wisdom of crowd, that is bringing, this process is of bringing together of people to work on something to solve a research problem or create a new idea. So we call them as wisdom of crowds because many people will be involved in this. So when we are talking about organizations are doing this by taking people from all level of expertise and seniority from different departments to interact and meet in facilitated session to help the solving the problems in truly imaginative and productive way. So this is about the wisdom of crowd. So just as a collaboration, it's important in every other field. So collaboration is also important in a nursing research. For example, if you have a community health nurse, you think about the problems faced by the local community. So you may have a skill in assessing the issue of the community area, and even you can collect the data, or you have the skill to assess the issues of the community. So everything will be there, but you need an epidemiologist, you need a statistician so to solve the analytical, for the framework of analytical intelligence. So through academic partnership, you can complement each other's work and evolve their ideas. So than just on one's own. So this is about the collaborative in nursing research. And when you're talking about strategies to collaborative nursing research, is first point is collaborating within the department. That is with the other, only one person, for an example, from medical surgical nursing specialty and one from mental health nursing can collaborate on research and do the research work. And before discussing about other disciplines, we can practice collaborating with our discipline itself. So academic service location, that is, here we can encourage collaboration among nursing faculties in a college and a nurse in a hospital. So this type of collaboration will bring the skills from the clinical and the academic side, resulting in a fruitful research. And interdisciplinary collaboration. This is a feasible collaboration which the leader or the heads of the nursing institution can encourage and promote. And we see such, we can see the effectiveness of such collaborated nursing research works. We can think about venturing into other disciplines. The third one is collaborating with the universities. Collaborating among faculties within the university system can be a good initiative. Faculties under College of Nursing can collaborate with other faculties, another discipline under the same university. So this type is called interdisciplinary collaboration. So this reforms can be brought about the key leaders in the university level of different discipline, and also give the creditability that need to be limited to one's own faculty. Then we have the multidisciplinary research. It takes from when place when faculty from different disciplines work independently on a common problem on a research question. So the faculty, in this approach, faculty share research goals and work on the same problem, but look at it from their own discipline perspective. So these findings from each discipline are supplementary to each other through the collaboration. So the advantage of multidisciplinary research is that each aspect can be analyzed by a particular specialty, which is often necessary to answer complex research problems. So when you're talking about, for an example, here we can have now we are in a pandemic situation. We have here a virologist. They will be studying the behavior of the virus and its mutation. Then the doctors were studying what treatment to be given for the patients, and as nurses studying the symptoms and the patients and the effectiveness of the treatment. Then we had a pharmacist doing clinical trials with the vaccines against the virus. So the information communication technology were created, awareness with the caller tunes like that. So while others were creating apps to track the viral outbreak hotspots, so we had several disciplines involved in research but all were working towards the common goal for fighting the COVID-19 pandemic here. So there were many healthcare institutions had organized strategy conferences where professionals from all these disciplines from all over the world had come in to share the key findings. That was crucial in moving ahead with battling the pandemic. So this is the multidisciplinary research. This is the example for the multidisciplinary research. So transdisciplinary research collaboration is here the research applies to the research efforts focused on problems that cross the boundaries of two or more disciplines, such as research on effective information management system. And when we collaborate with outside discipline, like an example, nursing collaborating with outside healthcare disciplines, collaborating with information technology or nanotechnology, such collaborations can be useful for product development, like developing a new technology for a diabetic patients. And best practices, when you're talking about the collaborative research, here across the disciplines, collaboration and interdisciplinary research is growing. As a teamwork and research increases, it's important to establish a good practice framework for collaboration. So here now what I do is I quickly share some key points we have to follow when we are involved in collaboration. Be strategic and don't overcommit. Like we have to accept every offer to collaborate, and we have to understand like it will not quickly we can't finish the research. It is easy way, so we should not we should not rush and we should not finish the thing, and carefully assess the time, resource, and it would be required for a potential collaborative project. Then second is like address mutual expectation. Here every member of team may have a different expectation about how each person will contribute, so they will be benefited by the collaboration. By discussing this expectation openly, it is easier for each member to contribute the project effectively. So here what I recommend is to keep the written record, so that it is most important that collaborators commence the project by anticipating and discussing and resolving possible areas of research. So then create a collaboration agreement. Whenever you are doing a collaboration research work, we have to have an agreement. Whether you are setting up a research collaboration or participating in someone else, so we need a collaboration agreement for that. Then these contracts are often used in a large and medium-sized collaboration or in a partnership in industry. But you can choose create a written collaboration agreement for a project of any size and scope. So transparency really helps to build trust. So your collaboration agreement can outline the key goals of your project. Then you have clearly divide the established who's responsible for each task. Like here you can have the collaborate, clearly divide and establish responsible for each task. A clear division of tasks and responsibilities makes each team member's role in the project clear. Determine authorship. So here in collaboration, it may appear that each person has a clear role. So this assumption, however, can lead to confusion and disagreement. So it is better to agree on authorship at the beginning of the project itself and decide who will be mentioned as the first author for the research. Then communicate frequently and bold type. Clear and regular communication is crucial to the success of any research collaboration. Keep frequent communication with the team. If you don't have a clear timeline and clear research goals, it becomes easy to be deviated. If you are not communicating for a month, there is a chance that the other person might have a different expectation about how much progress you have made. So 7th point is take minutes of meeting. Whatever the minute you have conducted, everything should be, all the minutes should be recorded And if you have a minutes of the meeting, so whenever you have, you can send an email or you can have a phone conversation, face-to-face meeting, everything should be documented. So if it is needed, you can be referred in the later conversation if you forget what was covered or if there is a disagreement about what was decided in the meeting. So the minutes helps to resolve the issues. Then you have to go for the access of the data. Access of the data, in some research, not all parties may have the access to all data, while in some projects, all the data are shared among those involved. A clear conversation at the beginning of the project is necessary to establish who will have the access to what information. Then you will have to discuss the expectation for the data. Discuss with all the researchers before research begins about how the research will be communicated in presentation or publication, how soon it will be shared after the research is conducted. Then shared responsibility of integrity in research. So collaboration on research also means a shared responsibility for integrity in research. When there is an error in data, it is vital that information should be shared with all parties involved in that. Be a good team player. One of the great strengths of the collaborative research is the innovation that comes from bringing together of the researchers of different backgrounds, experience and perspectives. Sometimes it can be hard to adapt to different ways of thinking and working, but being flexible and open to new ideas will benefit your research. You may be the world expert or something, but remember there is always something new you can learn from others. So being a good team player is the only way for a good collaborative research. So these are the strategies that can facilitate a good collaboration in nursing research. So in conclusion, nurses should be full partners with doctors and other health professionals in redesigning future of healthcare through research. The nursing profession must produce leaders throughout the healthcare system who collaborate from the bedside to the boardroom, who can serve as full partners with other health professionals and be accountable for their own contribution to delivering high quality research work while working collaboratively with leaders from other health professions. Thank you.
Thank you, Anita. So for giving some clue for how to go about with collaborative research, so in nursing. So prior to this, I would like to have some models for the collaboration in adding to Anita's presentation. So here we have a collaborative clinical education, a fourth decade model. So it was from the other developed country. They are following the model. So how the student is getting benefit out of the clinicals by the clinical nurse education is supported by the clinical facilitator, and then the clinical facilitators are supported by the hospital administration, and then in turn all this is coached for the student nurse is coached by the clinicians, that is the bedside nurses. So it is interrelated, that is nursing education and practice, how it is revolving. So together it is for to improve the quality at the bedside. So that is the one model. So I would like to add some of the strategy we can able to. So this model explanation goes in this way. In the effort to improve the quality of new graduate transition, Epworth Hospital, a Deccan University, ran a collaborative project funded by National Safety and Quality Council to improve the support base for the new graduates while managing the quality patient care delivery. So Anita has given a broader view. So in focus for the nursing, how it is this collaborative model can be useful for disseminating or helping the new graduates. And another one more model, even this model, it is utilized here in CMC, and then as well in NIMANS also they follow this kind of model. So for the integration of nursing education and service, so the can care model. So that is nursing education and practice partnership, how they are going to have interrelation with the integration component. So as the academician, dean or a director, and as a clinical side CNO or a director, so they are amalgamately, jointly they work towards to improving the academic organizational structure and healthcare organizational structure in terms of having link between the nurse learner and the nurse expert, that is the staff nurses, how interrelatedly act in any kind of nursing situation to improve the quality patient care. So this is what for the nursing course we are even the INC is also giving emphasizing that model of nurse practice, nurse education and practice integration. Now it is need of the hour. Many of the medical college attached hospitals they are trying for. The academia and practice leaders acknowledge the need for working towards or together, jointly working as a team to promote the education and recruitment and retention of the nurses at all stages of their career. The goal was to design an educationally dense, practice-based experience to socialize the students to the role of professional nurse. A secondary goal is to enhance and support the professional and career development of the unit-based nurses also, vice versa. Both is education and then the service side is getting benefit out of that. So the effects, it goes, the benefits are the improved patient outcome, reduce the length of the stay, cost savings, and increase nursing job satisfaction and retention, and improved teamwork. So these are some of the effect of the collaboration, why it occurs. The reforming. So here the reforming of organizational structure, here it indicates any public or a private sectors, we have that institutional change and the organizational change, and as well in order to get a good outcome of the service delivery. So we need to have a change in the organizational pattern at the institutional level and overall in the top level organization also as a system, structure and human resource. It is need to be have a change in various level to improve our product outcomes. So that is the in healthcare arena. So that's why we need a reformation in the organizational structure to facilitate the collaborative nursing research. We all jointly have to work. So that's why the reformation is required. That is the need of the hour to improve our nursing standard at the bedside, and then to strengthen our professional nurse as a new graduate or maybe the experts at the bedside also, vice versa. In turn, the good quality patient outcome. So that is the need. So I am thanking Anita has given a wide view, and then we have to apply for nursing, how far it will be useful for that reformation of the organizational structure is required. Then nurses at all level need strong leadership skill to contribute patient safety and quality care. So that's the one, and they play major role in reforming the organizational structure, and the nurses should lead by engaging all member of all healthcare team in an environment, as very, very rightly say, Anita explained very nicely the type of collaborations, interdisciplinary, transdisciplinary, multidisciplinary and inter-professional discipline, translational collaboration. So like that, various other types are also there. We have to move with, in which situation which is required, we have to apply and we have to improve our quality and standard. That is the one, it is helpful if we do a collaborative research. There are various types. We have to follow which type is amenable for and which is need for that situation we have to go about. Thank you, Anita, for a good contribution regarding the reforming of organizational structure to facilitate that collaborative nursing research. Now, the following speaker, Professor R. Vijayalakshmi, will deal about that gap from Tagore College of Nursing, and she is going to deal about the identifying the gap between the nursing research and practice. The problem of implementing valid research results in nursing practice is well known. Despite an accounting of body of knowledge about the effectiveness of some nursing interventions, a gap often exists between the known and what is practice. What we know and what we practice is differing. So identifying the gap in the between the nursing research and practice, and taking appropriate measures to fill the gap will promote the quality research. Now the forum is for Professor Vijay Lakshmi. So please take up.
Thank you so much, ma'am.
Yes.
You can share the screen.
Yes.
Research is not a new terminology for us. Everyone knows about that. I think it's only a profession. Only the nursing profession in the UG level we are starting with the research work. Okay, we can proudly say that.
Yes.
There is no other profession is not having the research in their curriculum. So research is not a new terminology for us. It is started from the era starts from the Nightingale period. So education preparation itself, we are starting in the BSN level and the master's level and the PhD level. And also we have how many colleges in around India, you know very well, and also in Tamil Nadu, more than thousands, and also 280 master's degree programs. So from that, we can think about that how many nursing research will be coming out from here and how we are going to utilize it. And there was a graduate nurses are about 40 to 50,000, and also 1,000 to 2,000 members are postgraduates are coming out every year. So you can think about that, the research project and group research work and how much we are doing in our education scenario itself. And also there was a study showed that the patient was only receiving 55% of evidence-based treatment as per the 2001. At present 2020 goal, they have started that at least 90% of clinical decision has to be evidence-based. They were requesting for that, how we are doing it. That is my experience, I would like to tell you. This is not from any other books. So we can think about that. In publishing history, if we talk about PhD dissertation, how much PhD dissertation we are doing. And there was I think from the university, 80% of nurses are doing the PhD programs in our MJ University itself. I think 82, every year 82 graduate degree holders are coming out. And MPhil thesis, that is 81%. Master's thesis was 48% was publishing. And all those things are non-peer reviewed journal, and also the peer reviewed journal was very less. So we have to think about the publishing history also when there is a gap. Next. Why there is a gap? This much we are doing. We are doing a research in the UG and Masters and MPhil level, and we are publishing also where there is a gap. There is no time for us to think about whether the available resources are not available in the clinical settings, or information is very hard to understand, or we are not understanding what is published in the peer review journal, or why there is no confidence in judging the quality information. Are we are getting a quality research work from their side? That's we have to ask question ourselves in the hospital settings. Where are the barriers to incorporate research findings? Lack of awareness, we can tell about. So much of barriers we are telling about, only time is not available. Every time we will be telling very coolly that blaming others is not. So time is not available to implement the research work. Lack of awareness, ma'am, I don't know what is happening in the theory side and the research side. Lack of knowledge, there was a studies proved that there is a lack of research process, how much the research work is going on in the nursing field itself. Everyone knows about that in UK and US, there was a robotic team of people, they have done a surgery and also assisted for surgery in the last month. That was came into the paper. Insufficient time to read and evaluate, implement the research, and also not enough support of organization support. Every time we will be telling support organization, it is not there. When I went to a conference or in a workshop I went, there was a nurse challenger role. I asked where you are from. He told very clearly, I came from Bangalore. Where are you? What is your role? I am a nurse challenger working in a hospital. So that was a new role. I started hearing that. That was a, why can't we post that the nurse researcher role in the clinical researcher role? in the hospital, each hospital. So the organization, that nurse researcher can support from the other healthcare professionals, and also we can have a collaboration with the theory and practice, and we can implement it so that the gap can be mismatched. And the lack of autonomy and authority to practice our whatever the research we are doing in our theory area or in the clinic website. And shortage of colleagues to discuss. We don't have any mentors to produce our research work and or implementing the research work in the clinical settings. Next. These are the barriers we are talking about. Lack of confidence is there in the many areas of research in the clinical settings. How to join this theory and practice. In theory and practice, we are talking about the decades. So much of every year. So from the nursing to Nightingale time, we are talking about the gap, bridging the gap. Then the evidence-based practice and best practice nursing. So this was a thing is going on still. So we need effective clinical leadership, and particularly in the clinical area, we need to have a clinical mentor, and also the nurse researcher or the clinical nursing researcher is very important. She should have a research qualification and the knowledge, skill supporter. She has to be a guide and motivator for all the staffs, and create an environment for the congregation to learn, and they can provide the resources, the computer, internet, and research papers and journal club and everything she can conduct in their clinical setting itself. Next. And what we can do? We are telling that this can be done, we can do with this or that. Conduct high quality research. Are we doing a high quality research? Scientifically meticulous in research, or we are doing? We can ask question ourselves. Is it like high quality research in the sense we are doing for 10,000 members and 20,000 members? It is not like that. We are not talking about examples. Conduct relevant outcome research. That is more than enough. There was a research the last month in UK. They were telling the post-operative client they received all are having a fever, but they have done a research. They have done a culture sample and other things, but it was negative. But what was happening to all the patients are getting fever after the surgery? So they were started that there was an area where they have done the post-operative care bundle. They have implemented the post-operative care bundle in the hospital, and they were following the steps of protocols. Then it was reduced the fever and other things and all complications and all this research. It was reduced. So why can't we do the same thing? The implementations has to be done when the problem comes. It is not like that. The relevant outcome research, where there is a research need is there, we can do it. So replicate studies in various population settings. We can replicate the, hello, excuse me, can you please put the previous slide? There is a problem. Okay.
Yes?
Yeah, there's a problem. Okay, I can. Replicate the studies in various population and settings. We can do it not only in our area, we can do it in the other departments and also in the other settings, and we can replicate and collaborate with the other practitioners. She was talking, previous speaker was talking about the collaborative research and the practitioners, how they will be joining us, and also disseminating the findings aggressively. So one for the paste, even when we are getting up, we will be going for the brush and the paste. So for the brush and the paste, they were doing so much of campaign about this paste is good and having these much of things. For a thing we are going to get a vaccination, in that how many components are there? Anyone knows about that? Even for the COVID, why can't we have to do aggressive dissemination, we have to do, and it has to reach broadly. Nowadays we are doing that and communicate the finding clearly. It has to reach the public also and provide recommendation for the clinical implementation based on the findings. We can do it in the clinical also. We have to read widely and also critically, and professional conference we have to go for that. We are doing that conferences and attending professional conferences also. It's very important, and rewarding the research utilization approach. So I told you that there was a one research challenge post in the hospital settings. The same way, we can implement in our hospital. There's a research clinical nurse researcher. The post can be given and she can do a small research and it can be collaborated in the hospital and she can disseminate in the hospital, then she can publish in the various areas. So like that every year in CMCH Vellore we are doing earlier, but nowadays also we are doing, but it was not disseminated to all over the world. That can be done, and also reward can be given to the nurse researcher. Collaborating with the nursing mentors is very important for that. So these are the things can bridge the gap between the practice and the knowledge. Next. As the next slide, please. The collaborating with the nursing council. The nursing council nowadays we are doing, our state nursing council is encouraging to do a research. She was asking for all the research work, and also Nursing Research Society of India is doing a research work. This can be done, and formulation of independent institute of nursing research, the National Council for Nursing Research can be done, and also explore the granting opportunities and agencies. I was talking to all my colleagues regarding this. There is a forum of research work by ICMR and the other areas. Why can't we get into the nursing collaboration, nursing colleges and the medical college hospital or attached with that? They can give a one topic to us and we can also do it, and also PhD program. They can get your funding from the ICMR and other thing. And we can do a research work and implement and give it to the government. It will be very useful for us. So exploring grant and opportunity. Where there is a grant is going. So all are available in the forum, but we have to approach it. Creating global collaboration to support the organized nursing research support, internationalization and nursing research. Nursing research scholarship is available. We can utilize that. Interdisciplinary, she was talking about interdisciplinary and transformative way of research work. That is very important for us. So these are the things that bridge the gap. And also one more thing, research utilization project was there in the 2000 itself. It's a key project, everyone knows about that. It was from the first nursing research utilization project initiated by the Western, initiated by the Commission for Higher Education. They were given the 5 components definition of nursing care problem. What was the problem in your hospital? Retrieval of relevant research. Please take up the research. What are the things they have done? So we can do the meta-analysis and also we can find out critical review. We can do it and development of research-based plan. You take out the implementation and evaluate and you can do a change. So this was a which project was doing in the earlier from the 2000 onwards in each hospital once. Next research utilization was done by Kern. Next slide, please. Kern model. This is not a model actually. This is a conduct of designed by increasing the use of research findings into the daily life, daily nursing practices. So there was given the 5 components. This was also done in the year of 2000. Identification of research studies. What are the research studies are there? How it was based on, what was the base behind that, and transformational findings of research-based protocol. They were started doing the protocol based in the hospitals and transformation the protocol into specific nursing intervention. Like that, we have got into the problem diagnosis and the intervention work, and the clinical trial was done with that, and evaluation of research-based evidence. So these are the models, 2 models. This is not a model. This was a project. It's done by the Commission of Higher Education in the 2000, and it was implemented by the hospital-based policies to change the protocol. So I would like to conclude this with that. So much of utilization gap is there still. I can accept it. And also the theory and the mentors like Dean are people of management and can collaborate with the CNOs as Madam said earlier. So we have to collaborate with the hospital-based people and what are the research we have done, and we can implement into the research findings to the hospital side. This was Archit Ramal Patel. He was a person, 13-year-old boy. I think everyone knows about that. In the Twitter, that Modi ji was mentioning that I got the best vote. So it is a Rashtriya Bal Purashkar Award he got in 2020-21 for innovative postpartum hemorrhagic cup to help to accurately measure the obstetrics blood clots. This was a thing is done by the 2021 when the lockdown was there. This was a silicone cup. Everyone can see that this is a silicone cup. The birth canal, it can be measuring all the blood losses. So this was done by the Rajasthan boy, there was a 13-year-old boy. The life saving of how the cost of silicon device and PPH cup is going to help and all. He was done all the projects. He was having a collaboration with the Indian government, and also he was doing a project in the Rajasthan. Why can't our people, the Tamil Nadu government, can take it and we can also do the research work? I'm ready to do the research project. So how to apply and other things so that we can communicate, and this can be implemented in all our areas. So with that we can bridge the gap between them. So what we can do with connect, contribute. We have to connect ourselves. What was the thing is happening in the Western country and also in the US and developed countries and also in our north, and connect it and contribute. We have to contribute from our side and collaborate with the clinical people and communicate, disseminate, so that we can bridge the gap can be minimized. Thank you so much for the opportunity.
Yes. So thank you so much. So we need to go a long way, as Vijayalakshmi tell about all these nursing studies which we have. We are having a lot of studies, but those studies cannot be implemented immediately as whatever doing a small project, and it cannot be even generalized the findings. So that is the reason behind. So we have a lot of gap. So here, so we are having a gap that research, whichever we are bringing, we are doing that as a student project, as a master project or a UG project, only at the PhD level, little large sample we are utilizing. That too, the interventional component of studies are very, very few, and it cannot be even generalized with all subjective findings. So these are the gap why we couldn't able to put those research findings into the in other countries. We are having a lot of structured methodology, and they used to do it in a larger survey sample and doing effectiveness study and evidence-based outcome. So they are proving with the generalization and doing meta-analysis, a lot many things in other countries. And at the clinical side, they are doing a lot of interventions, and then they are bringing it to the conclusion, and that it may be applicable to put it into the practice. But coming to our India, so we are still not even we are in an infant stage also. We couldn't even say that. So there is a long way and there is a long gap, and we have to identify, and as now only it is emerging as a collaborative funded projects with interdisciplinary and or within department, as very rightly Anita was telling about the inter department or inter college or inter professionals. So like that, various other discipline, for example, genomic studies, biomedical engineering, lot many things, not only in the nursing profession alone, because we are a healing profession, we are caring profession, and we are not having any evidence to produce. So nowadays only we are adding the component of that biophysiological parameters, some of the studies, and then we are bringing some conclusions with that. So like we need to go a very long way and to build the gap. So the gap is here, and we have to identify it, and then we have to fill it. It is the challenge for all the leaders and the forthcoming young buds. They have to spend, and one more thing, a lot of time is to be invested, and lot of funding is also needed. So these are the things we are in lack, but slowly now it is just emerging. Some fund, even Tamil Nadu Nursing Council is also funding for some of the projects, and some other with the medical professionals or biomedical, like that. If you have a go over collaborative projects, we may try to get some of the funding research, doing for a long time research, for a long very much of sample, we can, a large sample size can be utilized and generalize the finding. Then only we can able to put into the practice with all evidences and other thing, and it has to get the ethical concern, everything. Without that, we couldn't able to put into practice. So we have to go very, very long path. I don't know how many decades it will take, but we cannot sit saying this itself. We should not. We have to try. We have to try. Till our achievement of our aim or a goal, we need to try for that. So this is the one we need to think about. Next slide, ma'am. So here, put further development of leadership skill. Next slide. Skill among the nurses we need to have, and strategies to reduce the research practice gap. We have to inculcate the skills from the nursing at the clinical side, and development of research in the team, as I told, interdisciplinary and transdisciplinary also, and an increase of research component is the undergraduate, postgraduate courses, and improvement in the nursing research skill amongst the nursing lecturers also. Now we are just emerging. Some of the studies, now everyone is asking for even the ethical consent. Where is the novelty? What you are bringing? What is the outcome base of your study? So like that awareness now only it is triggering now. So in future, we need to think in all the way. We have to enhance the research with a large sample with evidence based. Then automatically we can reduce the gap of research and then the practice. So we need to go a long way along with this findings, whichever we have already, we can put into practice. So with the evidence base in future. Yes, thank you Vijay Lakshmi for your very good presentation on how to identify the gap and then fill the gap. So for filling, our CB Jose will take the session with the interviewing of all professionals, including nurses, must move away from the service-oriented delivery of patient-centered collaborative approach to care. The value within the health organization need to be underpinned by collaborative interprofessional patient-centered practices. So how she is going to enhance the current collaborative nursing research practices to improve the patient-centered care. I think something we will hear from CV Jose. Yes, we welcome for your presentation. Yeah.
Thank you, ma'am. Thank you so much. At the outset, I would first thank Kanyamal ma'am and the organizers for giving me this opportunity. Hope I'm audible. Ma'am, am I audible, ma'am?
Yeah, you are much more audible. No problem. Yeah.
Thank you so much. So my topic given to me is the current collaborative nursing research practice. Yes. Next slide, please. So the introduction is getting research into policy and practice in healthcare is a recognized worldwide concern. As an attempt to bridge the gap between research, practice, research, and funders are requesting more interdisciplinary and collaborative research, while actual experience of such processes have been there have been very less studies related to it. So the term collaboration holds a very positive connotation for today's healthcare providers. The act of collaborating is usually considered a necessary component of successful professional activities, whether among individuals or departments within a given organization or other organizations. So educational panels, professional or the educational organizations, and the grant funding agencies promote collaborations within and across the disciplines. Next slide, please.
Yes.
So the term collaboration is used interchangeably in conjunction with teamwork. So the root of the word collaboration, namely co and elaborate, combines in Latin to mean that work together. So Vijay was telling about unless we collaborate, we cannot achieve. So the collaborating experiences allow faculty, regardless of setting or nation, can themselves be successful both in collaborating activities and in integrating the three roles of teaching, service, and research for the benefits of student, community, and professional practice. So unless there is a collaboration, there is not going to be a success at all. We will not be able to achieve, as ma'am was telling about. Next slide, please.
Yes.
So what is collaborative nursing practice? So collaborative care is a healthcare model which aims to improve patient outcomes through interprofessional cooperation. This will commonly include a primary or tertiary care team working with allied health professionals such as dietitians or physiotherapists or mental health professionals or medical specialists. Next slide.
Yes.
This we can skip because Anita ma'am has gone in detail.
Yes.
Next, please. Next.
Yes.
So what are the current issues in nursing today? Or otherwise we can say, what are the biggest problems we are facing in nursing? So it is regarding staff shortage, meeting patient expectations, long working hours, workplace violence, workplace hazards, and personal health. So these all we have already seen. So I'm not going in depth about it. Next slide. So how do you effectively collaborate? So there are top 5 ways to lead a high performance team and collaborate them most effectively. So the first one is to get everyone on the same page. The most important thing you can do to collaborate is to get people to work with you on the same goals. Unless you are maintaining one goal, it is not possible. So all of them will have to, in number of people you can bring in into the team, but all should have a same goal. With one goal, you can set one expectation and use technical tools to work on it, and be open about everything, because each individual has got its her or his own ideas. So that collaborating means it should be pooled in, every people's involvement should be there. Only then we'll be able to bring it out and hold effective team meetings. By having team meetings, we'll be able to understand which level you are and how far we'll have to come up with. So the model of relating interprofessional education and collaborative practice as presented by the WHO, it shows clearly that in a local context, so we have local health needs are there that can be fragmented into the health system. So interprofessional education in the present and future health workers, when they collaborate together with the health workforce, you can collaborate into a very good practice. So this practice optimally gives the health services which strengthen the health system, and at the end there will be an improvement in the health outcome. So that is what we are aiming at. The outcome of the health should be improved. That is our ultimate aim. Next slide, please. So what are the benefits of collaboration? So collaborating usually provides a means for organizations or the institutions or the professions to achieve more than they can or on their own itself. Then business has used collaboration for many years to share costs, spread risk, and reduce supply chain uncertainty, while forming strategic economic alliances that also serve as fertile grounds for innovation and learning. So collaboration potentially reduces self-sufficiency in environments demanding great flexibility and innovation. So unless you are self-sufficient, it is just not possible. So what are the several benefits of collaboration? You can have opportunities to learn and go beyond traditional way of thinking. You can have access to people we could not normally reach in order to serve a larger people. Potential to develop lifelong relationships and bonds that may be beneficial in the future. You can gain from the wisdom of others, because every individual has got their own specialty. So unless you pool in all their knowledge, we will not be able to achieve a better goal. So access to new resources and the potential to work new skills. Increase productivity through doing more work in less time. Then sharing recognition and accolades. Association with others who are successful. So try to pool them, the successful people who have scored much better or something, like as Vijay was telling about that 14-year-old guy who had brought in his knowledge. So if we can pull in, if our health government, the Tamil Nadu government can pull in his knowledge and the knowledge of our own Tamil Nadu people, we can bring in a better production. So then sharing the cost, then improved access to money. Some funding bodies only support collaborative projects. That is something great. So we'll have to identify such people who funds only for the collaborative researchers. So those people can be utilized for funding and cross-fertilization across disciplines. And the end is pooling knowledge for tackling large and complex problems. So unless you pool in the knowledge from every efficient peoples, then the complex problem also can be handled in a very easy way. Like a recent example I've just said in here, stated that demonstrates how an interprofessional research team focuses on linking theory related to the concept of hope with clinical practice so as to interventions that would endanger hope in terminally ill children. Okay, this group included professionals from a wide variety of disciplines, which included not only nursing, psychology, occupational therapy, massage therapy, medicine, and education. So the traditional disciplinary specific roles and knowledge were actively negotiated and woven into a single framework by the team, with the result that disciplinary boundaries faded in importance and the problem was studied in a broader and deeper manner. Next slide. So their own disciplines were forgotten, or their own thoughts or ideas were completely focused on one aspect, one goal. And as this team worked together, the participants blended the competencies of all team members and performed functions outside of their normal scope of practice. So the team searched for the the commonalities rather than the differences in theoretical perspectives, and relinquished their personal and discipline-specific approaches. So the members generated a broad list of theories relevant to a hope intervention for the children with cancer. Then each member read about the theories, often in literature outside their own discipline. Then members developed a shared understanding that increased their ability to function at an interprofessional level. The team developed a shared mindset, and an overarching theory was identified by the team. That was the end goal. And they brought about a theory which collaborated so many people's mind together, so many disciplines. So these are few of the other collaborative research-based projects. One is that best practice for high need households with collaboration from stakeholders. So the purpose of this study was to clarify and redefine public health nursing interventions to assist high need households using stakeholder participation. So which include, like example, medical and welfare professionals, key informants, residents. So in this, the public health nurse, 9 of them, and faculty, 9 were involved in this study. Another study is to strengthen community general support centers to correspond with community health needs. So their purpose was to evaluate and improve community care prevention activities based on the preventive care needs of older adults. Another project was regarding a regional health planning to meet the objectives of Healthy Japan in 2021. So the purpose was to evaluate the current status of each regional plan and to develop effective method to implement the work combined with day-to-day work. So in this public health nurse 9, that is from the city, and 2 different towns were included, and faculty from all over their country, 8 faculties were included in this collaborative research. Next slide, please. A few other projects are evaluation of counseling guidance program for working persons. So the purpose was to evaluate the quality and effectiveness of counseling and health guidance provided to working people who receive proactive support. So these are some of the different ways where all we can involve and do a collaborative research. The last project is implementing competencies and in-service training for new PHNs. So the purpose was to evaluate in-service training using competency checklist check sheets for new PHNs. So in this, there were 2 PHNs and 2 faculty, 7 faculties were included in this study, and the findings were concluded. So this is concluded by the international journal. Few other abstracts and reviews I have. Next slide, please. Next slide. One of the study conducted by Lieutenant Colonel Laurie et al., clinical research and practice collaborative and evidence-based nursing clinical inquiry expansion. This is again another collaborative study. In this, they concluded that intentionally scheduled collaboration between PhD nurse scientists and advanced practice registered nurses is a promising model to promote an expanded culture. So promising model to promote an expanded culture of nursing clinical inquiry and should be considered for medical facilities seeking to enhance EBP and nursing care. Next slide, please. This is another study conducted by Heather et al. development of a regional nurse research partnership for academic and practice collaboration. So this was conducted in 2013, and they had found that 4 themes related to partnering were identified: harnessing new nursing voice and identity, developing as researchers, staying connected, and positioning for a collaborative project. So they concluded that academic practice research collaborations will become increasingly important with healthcare system changes. Strategies to develop and sustain productive partnerships should be supported. Next slide, please. So this is another study conducted by Jill Darwin et al. It is a collaborative model of community health nursing practice. So this study, this paper discusses a strategic collaboration partnership between a Western Australian university and a community health service based on practice research model. So the first session of this paper was drawn on the nursing literature on collaborative models and describes the broad background to the partnership and development of the model. The second session presents in detail the results of a recent evaluation that involved a brief survey and follow-up interviews to determine community health nurses' understanding and perceptions of the partnership model. Next slide, please. So they had 3 main themes emerge from the interview. One is like advancement of learning was there, job satisfaction and self-confidence was talked about, and situational opportunities. So the results suggested that the partnership model provided the nurses with the opportunity to develop an increased understanding of the role of research in clinical practice and confidence in their own ability to reflect on current nursing practice. So this allowed them to identify the clinical problems in order to deliver and evaluate best practice solutions as evidenced by a change in attitude. So it was also able to assess opportunities. Next slide, please. Another study conducted by Nystrom, the collaborative and partnership research for improvement of health and social services researchers' experience from 20 projects. So it was a collaborative one assessing about 20 different projects. So in this background, an attempt to bridge the gap between research and practice, research funders are requesting more interdisciplinary and collaborative research, while actual experiences of such processes have been less studied. Next slide, please. So the result showed that the collaborative process constituted the area for the main lessons learned as well as the main problems. So they also stated that difficulties concerned handling complexity and conflicts between different expectations and demands in the practitioners and researchers context, and dealing with human resource issues and group interactions when forming collaborative and interdisciplinary research teams were there. The handling of such challenges required time, resources, knowledge, interactive learning, and skilled project management. Next slide, please. So to conclude, collaborative approaches are important in the study of complex phenomena. Results from various studies shows that allocated time, arena for interactions, and skills in project management and communications are needed during research collaboration to enhance support and build trust and understanding with involved practitioners at several levels in the healthcare system. For researchers, dealing with this complexity takes time and energy from the scientific process. For practitioners, this puts demand on understanding a research process and how it fits with an ongoing organizational agenda and activities and allocating time. So some of the identified factors may be overlooked by the funders and involved stakeholders when designing, performing, and evaluating interdisciplinary, collaborative, and partnership research. Next slide. So these are some of my references. Thank you. Thank you so much for giving me this opportunity.
So thank you. So it is very, very elaborative, and all research findings she brought into. So the partnership, collaborative researchers, actually we have to think about this only in order to bridge the gap. So she brought many of the other studies which is in developed nations. So we are also here to start with that kind of partnership from academia to that practice side. So I think because of the lack of time, we couldn't able to talk more on this. So that is the thing. Many research studies. It is eye-opening, really. So it's a very good presentations, and we will think and then put into practice in our research areas also. So just I will conclude with one model. Yes, only one model. So I would like to have the current collaborative nursing research. So we know we need to identify where the problem and issues, and we have to conduct studies and evidence-based we have to derive, and then translation into the guidelines, put into practice integration, and again reevaluation. It's go in a cyclic manner as evidence-based model, the STAR model. So here the thrush areas. So as very rightly she told about many of the studies, we need to, some of the health innovations, for example, COVID vaccines and all other things in the medical field they are doing. Even in the nursing also we can able to think about maybe public health oriented, that is population health, and data science and genomic. So these are some of the biomedical related studies also. They are thrush areas. We can able to have a go for a collaborative and partnership that research nursing along with other discipline. So we can able to think about and we do conduct, and then we can able to generate fundings, and we can able to do our research findings can be generalized, and again we can put into evidence-based practices. Thank you, Sibi, for
Thank you, ma'am. Thank you, ma'am.
detailed research study reports which you have depicted. We will look in for the future. Yes. Now I would like to call the next speaker. So Dr. S.J. Nalini. So sorry, the time it's going up. So that's what. Otherwise we can talk more. Okay. And she will talk about strategies and techniques for enhancing the nursing research and practice. So we are eager to get some good techniques which we can go with enhancing our nursing research with Nalini's presentation. Yes, we welcome you, Nalini.
Thank you, Dr. Kanyamal ma'am. In fact, I would definitely like to appreciate the efforts taken by Dr. Kanyamal and her team to conduct such a webinar, which is very, very useful to all of us. I bring the warm greetings to each one of you from Sri Ramchandra Institute of Higher Education and Research. Can you move to the next screen, Janelle?
Yes, next slide. Yeah.
You know, research is very, very important, and we know that evidence-based practice has become the norm of the day, and for that we need research. Now, to convert this research evidence to practice is definitely a difficult process. Next slide.
Yes.
Janelle, if you don't mind, I can share the screen. It makes faster mobility for me.
Yes,
yes. You can stop it. Yeah. Thank you so much. I will share it.
Yeah, no problem. According to your convenience.
Yeah, that's better.
Yes. Yeah.
Thank you, madam.
Yeah, please.
Now, there are lots of barriers which others have already spoken. The first and foremost is probably the lack of knowledge, and then comes the time. So this is the biggest dilemma nurses have in reality, where they are not able to spend time because their daily demands often take up the precedence rather than research. Now, the other most important thing is most of them clinicians, nurse clinicians, they're not able to apply the research findings to clinical practice, and the lack of administrative support. So often if a nurse is interested to do research, there are others, they are pulling their legs and not allowing them to proceed further. That's another issue people find. And limited research findings that are applicable to, especially to nursing practice, another big drawback in nursing, and negative attitudes about nursing research. So this is what is the exact reality we find. Now it's important we try to bridge this gap between the nurse clinicians and the research, and we need to stop thinking that research is somebody's job. We have to think as nurse clinicians and nurse educators, it is part and parcel of our role to wear multiple hats and become a nurse researcher also. So what are those strategies and techniques? I've just pointed out few. I know many of my friends and experts over there were already shared a few things. So just to detail on few things over here, first and foremost, we must use to, try to promote the use of research, and then increase the awareness about research to our colleagues, and provide them all the access to the resources that are available, and implement research initiatives in your ward, clinical area or in your units. So the first and foremost thing is the attitude. The individual attitude has to improve, and the unit has to give all the importance for research, and finally the organization has to support. So each and everybody has to complete their role in perfection if you really want to implement research in the clinical practice. So some of the examples here is, whenever you're trying to take up research, do something which is very, very important to promote nursing care and the patient outcomes. Like you can address related to fall prevention, the importance of rounds, use of chlorhexidine. These are some examples that has been given. So which you feel is important for your clinical area or your unit, you can definitely take up. And the other important thing, what we can definitely do is educate the staff. Educate the staff how important research is and research processes. I was really happy last time when I went to the Infusion Nursing Society. I was astonished to see the nurses' input in research. Probably with little amount of input and the expertise we are going to give them and help them out, they can do wonders beyond the educationists over there. So let's keep our minds open to help our colleagues over there. And what is the next thing that is important is attitude and interest of nursing staff. So if you really find your nursing staff are having the attitude and interest, promote it, empower them to become good researchers. Now, certain skills you can foster so that they can interpret researches, give them all the available resources. Like Madam was telling about the ethical. So it's mandatory, ethics is mandatory. Support them on how to meet the ethical consideration. The articles and books on how to interpret research can be presented to them. In fact, if possible, we can give them some online tutorials. Journal clubs can be a regular feature in the clinical areas, and the advanced practitioners like the MSc practitioners or even our nurse practitioners, they can take up additional role in empowering the other nurses in the unit. We need to have a research committee, not in the education sector alone, but also in the service side, which is trying to promote nursing research, which is more oriented toward clinical area. Another thing is you need to provide access to research, provide them user-friendly information, put up a bulletin board, and this bulletin board can share the articles related to research for that particular unit, which has often been regularly utilized. You can have a research brief and call all the nurses and talk to them about the evidence-based practices that are there, how we can promote in our unit, and we can conduct new research over there. And support staff, especially the statistical help that is required, some epidemiologist help that is required. You can provide all these things in your area to the nurses and the nurse clinician. And it's important that we give them opportunities to disseminate their outcomes or the research work they have done. So how we can disseminate the outcome is by means of holding a local nurses week, where you call experts from other areas or other nurses from other hospital. Even you can have a national or international conferences, send your nurses to participate in these areas, give them, empower them in order to present the papers. It can be an oral presentation or a poster presentation. Help them. So that is what is required. Your support and help can make wonders. And when you try to publish, try to make them as mandatory partners in your unit so that good publications come up, which includes clinical focus. Now, other strategies, what you can do in order to implement research, identify, develop and implement projects, try to identify what is the current initiatives so that you can formulate good projects which are more required and recent and need-based, and then try to target what those indicators are which is going to help in the clinical outcomes. So these are certain clinical outcomes by which we can conduct some researches like patient falls, pressure ulcers. These are important points that are often taken into consideration for improving the quality outcome measures for the patient care. Now, certain other strategies, what you can do as an administrator is provide them adequate support. Give them mandatory allocation for research. Now, today, even NAC and other agencies are asking the nurse educationists to implement or allocate research hours incorporated in the calendar of a nurse educator. So like that, similar ways can be established even for a nurse clinician where time is allotted for them to do research. Again, you can create a formal project protocols, submit them to review board, ethical board, and then you can also appoint some project leaders who are good enough, and you can make them as unit-based champions also. It works out well when you give them the leadership. Next thing what you can do is you can showcase how certain research projects are helpful and how they can promote the interest in conducting other projects. Like, my friend Vijay Lakshmi and Sibi was talking about so many research projects that has come up. So you can showcase these things and you can instill that motive in the nurses to bring out more research work. You can also have a nursing grand rounds, initiate some formal programs, continuing education forums, newsletters can be updated, and whatever nurses have done, these can be added in the newsletters. Poster presentations can be in-house or even open to outside people. You can help them to participate in institutional research day forums where you can call in the nurses even to present, and not only the students and the postgraduates or PhD scholars, it should be open to each and every nurse. The next thing is funding. So when you try to seek funding, even as an educationist, partner with your clinicians over there and apply for funding, even for the clinical pilot studies, and try to link some participation of the clinical nurses with some incentives. Give them an improvement in the clinical ladder advancement or some promotion. You can consider research as one point of view when you are promoting nurses. And as I said before, publish and present research project. Now you can also organize a program which is going to be a course which is conducted for a period of time. It can be an online course or an offline course, whichever is feasible in your place. You can conduct a program of clinical inquiry, which is going to definitely help them to question and evaluate practice, and make them available to take up the research work and improve the practice through research. Now, this is what is important, where this clinical program, inquiry program should be shaped by staff nurses, clinical nurse specialists, and the nurse scientists and clinical leaders, where they put the primary person as a patient and family. They consider the core values and encourage the spirit of inquiry and bring in the concept of innovation. Most important, what is required is peer mentoring and coaching, which is mandatory for nurses. Starting from the research question to manuscript submission, they may require your help. And as a peer, you can mentor and coach them, which is very, very important. Again, all of us know that evidence-based practice is most important, and it is the norm of the day by which we can give quality care for our patients. But what is more important for us to realize is how we can implement this evidence-based practice, how we can make it happen. That becomes the major question. The first and foremost thing is try to make our nurses to ask good clinical questions. Now, this has to be cultivated from the childhood, like from the nursing period itself. Now, I don't find many of our students asking question. They are very, very, frightened in order to come out with their questions. So that should erase. Teachers should be ready and willing to answer the questions, whether it is small, good, bad, or correct or incorrect. Try to answer the question, stimulate and kindle their minds in order to ask the question. Unless and until we train our students to ask questions, tomorrow when they become nurses, they will not be able to ask good clinical questions. So empower them to ask questions, give them opportunities to take up risk and be flexible in the clinical environment. This is what is required. So as much of questions, why, what are we doing? We all know how to ask question, what, how, where, when. All these has to be applied if you want to really take up any evidence-based practice. And also see to that whatever practices you do, whether it is relevant to your place, whether it is relevant for your patients, and is it research oriented? Does it meet the standards of national organization? All this has to be pondered upon. For this, what is required is knowledge of the nurses has to improve. And as a nurse clinician, it is you who should always worry and wonder. Worry why something is going on wrong, or what has went wrong so the patient did not recover, and wonder how you can do further in order to overcome the issues so that a patient comes out good. Again, as I told you, ask questions, have an inquiry mind, search literature, keep yourself abreast with the literatures, and always become an expert. Collaborate with people. It can be your college partners or your other researchers or medical professionals, and be an advocate for evidence-based changes, and listen to your patients, because they are the one who is going to give a lot of questions to answer. So it is also told by institution of medicine that which supports that higher the education among nurses, the higher is the thinking power for them and ability to take up research. So it's mandatory. We need to increase the educational opportunity for nurses to move them up from the level of diploma to higher education. And again, try to collaborate. Nursing may not be an independent person to do research. Today, we can do lots of research work when we try to collaborate with others. You can find new avenues when you try to collaborate with your medical professionals or your engineering professionals. Very many startups have come up, and nurse can also become an entrepreneur for these startups. And what is required, only your partner to collaborate, whom you choose is very, very important. Again, as an academician, you can create some linkages with your hospital partners and hospital clinicians, collaborate with them, bring about joint research project between the academic sector and the health sector, strengthen the training programs for nurses, and whenever you try to teach your students, try to incorporate some nurse clinical trial coordinators also within the unit so that they can learn. And if you have a staff development program, bring the nurses inside to make them learn also. So you can create lots of linkages and become the lead in establishing the linkages, and expand your nursing faculty development program so that you can recruit PhD investigators in order to do multiple disciplines of research work in different areas. So always remember, research is the root. That is where things has to start, and that gets converted into evidence, and that gets converted as practice. So unless and until all of us join together, this will not be possible. So everything, in the impossible stands the possible. So everything is possible if we join hands together to do the best to bring out research focus in the clinical area. Thank you, madam, for the opportunity.
Yes. Thank you very much, Nalini. So I think you have given a very wide spectrum of strategies for all of us to think more about how to ignite the young brain of the students and then the staff nurses at the bedside. Definitely with inter-collaborative research with the medical team and then the engineering. So that's why that theme it arises. So because independently if we do, we couldn't able to give or match the evidences and other things. So that's what it is a real good ideas. So really many eye openings for all of us, I think, through this present. A lot many things are there to think about. Yeah, I think ideal person I have selected for this title, and you have given justice for this. We will take up some good points, how intertwinedly we have to grow along with the service and then the academy also, the strategies. We now here only mention about 32 research-based instructional strategy, but you gave lot many instructional strategies, how we can move with a good kind of research questions generate, and then from there the research methods also will be developing along with the interdiscipline also. So really it's a very good eye-opening session. So thank you so much on behalf of our team and myself. Really we will do practice for the students and as well the faculty also. It is eye-opening. Thank you, Nalini, once again.
Thank you, ma'am. Thank you.
I think some models which I depicted also you have also projected, so not necessary to give more on that. I think you also explained that. Yeah, thank you. So now the last session. So really the time is going up, but it is going on. All it is interesting. So that's why it is going on a little more extended time. So now we are going to have the session of emergence of dynamic nursing leader, their role in collaborative nursing research will be dealt by Dr. Fabiola. I think the app person, and she is very dynamic, and how she is going to lead with this session, we will see. Thank you.
A warm good afternoon to everyone. Sorry, I'm not putting the video on because I'm traveling.
Okay.
Thank you for giving me an opportunity to present the topic on emergence of dynamic nursing leaders and their role in collaborative research. A warm good evening to everyone. At the outset, I would like to thank Dr. Kaniyamma Dr. Vijay Lakshmi, and all the other staff for being to talk on this particular topic.
I think it is getting disturbed for madam. I think for couldn't able to come. Yes, you project. You just find out, ma, or otherwise we will conclude.
Yes, ma'am.
Yeah, you just find out with madam whether it is possible, or otherwise I will carry on and then I will conclude it.
Yes, ma'am. Yes, ma'am.
Just try to speak with madam.
Fabiola ma'am,
Or Vijay?
unmute ma'am.
Yes, madam. Need to call to madam, or otherwise she is in a muted situation. No.
Hello.
Fabiola ma'am.
Sorry for the interruption.
Oh, sorry.
It was
travel. Very sorry, madam. Yes.
no problem, not an issue. The talk given by all the previous panelists were excellent. I think they have covered most of the topic based on the emergence of dynamic nurse leaders. I briefly would like to say a few points on emergence of dynamic leaders and their role in collaborative research. Can you go to the first slide, please? So let's just see who are these dynamic nurse leaders. So when you say the word dynamic, nurses are at all levels who need strong leadership skills to contribute to patient safety and the quality of care. It is not only individually, it comes in all strategies, for example, laterally and vertically, horizontally. So when I go through the slides, you will understand it better. Can you go to the next slide, please? So to be dynamic leaders, what are they supposed to possess? Knowledge of the healthcare delivery system, how to work in teams, how to collaborate effectively within and across the discipline, the basic doctrines of ethical care, how to be effective patient advocate, and theories of innovation and the foundation for quality and safety improvement. So these would be a few of the points where a dynamic leader has to fulfill. And when you look at this, these are all critical components. A nursing leader needs to have these points. So what can be the obstacles of nurse leaders? As we all know, it's like an saying from the history onwards, nursing is a female dominated profession. So you can see that most of the time the public uses as a functional doers. So hindrances like nurses are not put into decision or policy making, which is very crucial in the implementation of frontline nurses. And definitely we all know that the critical knowledge and awareness of patients, frontline workers only know about the patient, their family, community, and the main drawback of nurses, especially in our culture in Asian countries, is they don't speak up. So nurses who are, that is very important. It's a big obstacle for nurses. And the last thing, nurses who are interested in pursuing entrepreneur and business development opportunities. So they move to other professions. So looking at the evolution of dynamic leaders, which includes two critical aspects. So when does the thought of leadership gets into a student or a nurse? When you see our syllabus, you can see in the 4th year, our syllabus has leadership and management. So that is the time we are already inculcating the values of being a leader. So the management topics, the administration topics, so putting them in board postings and other things. So once they do all that, they are actually inculcating those values. So what do we teach them? We teach them certain critical aspects like responsiveness, responsibility, accountability, and engagement of all nurses, regardless of position within the healthcare system, and the proactive and strategic collaborative actions to be taken by nurse managers and others in formal leadership roles to ensure changing healthcare priorities are managed. So for nurses, it starts right from the studentship till they become a staff. Once they become a staff nurse, I think it is their interest, and nowadays you can see a lot of the nurses doing MBA also to develop their potentials in HR and other things. It is something to be appreciated. And once they go up the ladder, they become ward sisters and in charges, and then go into specializations. And then in that stage also, they need to be, they need to understand what leadership role is. It is not that taking care of a ward. They need to think critically. They need to know what to do in a particular ward, how to collaborate with other disciplines, and how to go about and how to manage the system. And we all know that there was a speech which was conducted by the Ramadan Nurses and Midwives Council on leadership excellence and the professionalism program since 2019. They have approached or given training for around 50,000 leaders so that they get the values and then understand what action leadership is. And I think most of the people who are listening to have been having this program in their colleges. And then when you get into the program, I mean, it's really action that's very topics on communication and so many other things which are very important for nurses. Hello, can you hear me now?
Yes, voice is very much breaking, ma'am. Yeah.
Oh, okay. So it was conducted by the Tamil Nadu Nurses and Midwives Council.
Yes.
Next.
Next.
So the style of leadership needs to flow in all directions at all levels. That is very, very important. Leadership does not cater only to nurses and nursing discipline. It should go into all the directions, which is very quoted by backward and forward. Everyone from the bedside to the boardroom. I think Anita had also mentioned that must engage colleagues, subordinates, and executive so that together they can identify and achieve common goals. So that is the role, exact role of a leader. So till now we have talked about leadership.
Ma'am, please unmute.
Hello. How well it is? They have the qualities of the leadership, of a leader, a dynamic leader. Now looking into collaborative leadership, when you look into the next slide, you can see that how the leadership, that is how it is goes into different directions. What they have elements of leadership, the relationship between the team, effectiveness, member empowerment. So they are empowering each member, and that is only known as collaborative leadership. You can see how the arrows go on different levels and different strategies. So this is known as collaboration. When we meet with different gathers of people and categories of people, which is very important as nurses. We have to be the backbone of any healthcare sector, take care of the patient quality and safety. So one important thing I will talk about patient safety and the quality of care. nurses need to speak the language of policy and engage in political processes effectively and work cohesively as a profession, which is very important. See, now you can see two different words which are coming in, which is we need to be policy makers. We need to collaborate and think about voice in health policy decision making, as well as being engaged in implementation efforts related to healthcare reforms, which is very, very important. This is where, when we talk about healthcare policy and reforms, this is where comes the collaboration into the nursing research as such. So nurses should be full partners with physicians and other health professionals in redesigning healthcare in India. So we listen to all this. We listen to thoughts from Anika, Vijay Lakshmi, Siddhi, Dr. Nalini, and Mrs. Kannema, focusing on all these important points, the collaboration, the leadership, and how it can be integrated into research. I think Siddhi also explained it well on how it can be integrated into research and how the nurses can get it. So when you look into that, nurses who are informed decision makers whose interdependent actions are based on three important components. When you look into the three components, it is education, excellence, and experience, which makes a dynamic leader. So that is very important, and it has other. So let us introspectively points. There are some questions I thought everybody should ponder upon. So what are the few questions are?
Excuse me, ma'am. Ma'am, excuse me, ma'am.
Voice is breaking.
Voice is not clear, ma'am, actually.
Okay. A growing body of research has begun to highlight the potential for collaboration among teams of diverse individuals from different professions. So you can see how collaboration is very important. And there are a few points which I'd like to highlight. And every nurse in the conference should think about where they stand. We talk about so many things in the conference, but there are a few points where we can ponder upon where do nurses stand, especially in India. We talk about so many Western culture and Western things. So in India, where do we stand? Is there collaboration? Is there real collaboration? Do we try to conduct a research with a dietitian? Do we try to conduct a research with a physician? Do we take the initiative of doing it, or we're just passive listeners to what they say and just monotonously be function doers? Do we collaborate with an X-ray technician or a lab technician, or even 2-3 interdisciplinary people to do a research, which is very less frequently done in our country? And there are research stating that there is very less studies which is collaborative. Nurses should be full partners with physicians and other healthcare professionals in doing research and redesigning the healthcare. So that is something to think about. Even like Dr. Vijay Lakshmi had told about so many, about 80% of nurses doing PhD. So that is great when you look into the internationally. So many of them doing nurses is a pride to India. But how much is it being implemented? How much is it being generalized? How much is it going into health policies and reforms? That is a big question mark. And of course, it's a big gap. So how much, see, you have two questions now. Is there collaborative research, and how much does it actually get implemented? The nursing research itself is not getting implemented. And again, you can see a big gap. That is, we need to have interdisciplinary with other team members, even other categories of nurses we can do an interdisciplinary research and try to publish it. And Dr. Nalini has very enormously, elaborately told on publication and others. So nursing research and practice must continue to identify and develop evidence-based improvements to care, and these improvements must be tested and adopted through policy changes across the healthcare system in India, which is the place where the biggest lacuna is nursing leaders must translate new research findings to the practice environment and into nursing education. Very, very important. That is the benefits of collaboration among healthcare professionals and research. So if there are enormous research done in collaboration with other health professionals, what are the benefits? Improved patient outcomes, reduced length of hospital stay, cost savings, increased job satisfaction, retention among nurses, improve teamwork and interpersonal professional collaboration is seen. So these are the benefits of having an interdisciplinary or collaboration research. There was a study which was published in October 19, 2020, the role of allied health professionals and nursing research. So developing research capability and capacity within the healthcare professionals is definitely a challenge to diverse settings. So research on allied health professions and nursing research. So let's see what the results are. So the results of the study showed that vital mentorship support was lacking to bridge this gap driven by a lack of time and funding. The second point, the result which was came out was a partnership approach to clinical academic support at institutional level is needed with several international models offering alternative strategies for consideration. So you can see how important these 2 points are. And of course, there are very, very, very less research on collaborative research. Even in internationally, you can see there is not much of research or not just study on collaborative research in healthcare delivery system. Okay, now let's look at the obstacles in collaborative research. So first one, as many of you spoke, funding the research, not only funding. You can see many of them, they want to do research, they do not know where to go for funding. What are the different organizations? What are the different websites or who's offering a research? So this is lacking a lot. And mentoring the progress in all the levels. If a research is started, sometimes, many of the times I've seen the research drops off only in the proposal stage itself because of a lot of issues. So it should be mentored till the end. Support from the institution level is also very, very vital. Collaborative leadership. And the last one is implementation of the research findings. As many research findings were discussed on dissemination of the research and implementation of the research in different levels. These are big obstacles where it is not implemented or taken into health reforms or policies. Only lately, I think we had a health policy revision on midwifery also. So little things only just reach up to the top. Other, like one of the speakers said, 80% of the PhD studies, it's a big question mark again of why it is not implemented, why it is not taken to a different level, why nurse leaders, so-called dynamic leaders are not taking it to the next stage, or there are no nurses in policy making. So these are the different things which goes into the big gap when you look into collaborative research. So in conclusion, I would like to state that physicians, nurses, and other health professionals must work together to break down the walls of hierarchical silos and hold each other accountable for improving quality and decreasing preventable adverse events. So, like I always say, nurses need to be from the bedside to the boardroom as leaders and as researchers, guiding each person and helping each person to grow. It's not only the bedside, we need to reach out to different categories in the bedside and to go even to the institution level till the boardroom. So we need to show where we stand as dynamic leaders and researchers. Of course, there is a lot of lacuna in research, but looking into the different models and other things, we can adopt from international levels and other places to adopt these models, implement it, and go to the level of preparing healthcare policies. So nurses need to get involved into all those categories. So in conclusion, I would like to close with a quote telling that a leader these days need to be best. One who convenes diversity has to be a host, sorry. One who convenes diversity, who convenes all viewpoints and creative processes where our mutual intelligence can come forth. A quote stated by Margaret. So with these few words, I'm sorry it's a little disturbing because I'm traveling. So thank you once again for giving the opportunity. So we need to know it's just not stop just like yes.
Okay, madam. Thank you so much. So
Thank you.
Thank you so much. A very good.
Sorry, it was a little disturbing because I'm traveling. Hope I did justice to the topic.
I know, sorry for the inconvenience, but anyhow, you made it a point. You have to cover the entire things which you would like to say as a dynamic leader, and how to cross the obstacles. So you yourself you experience because of the travel and other things. Sorry for the time delay. So otherwise you would have come in a nice manner for the comments from the participants, voice breaking only, but you have given a very nice content and thinking about the funding and as well the mentoring and support from the institution and collaborative leadership development, implementation of the research and everything. It is in our hand. We can do it. So this is the one. So the leader, the dynamic leader with a team, with a collaboration, we can do it, not individually. So with a team effort, we can able to bring the collaborative nursing research through the dynamic leadership in forthcoming era. So we are just putting starting a dot. So we start a dot and it will go and it will come into a line or arrow mark to reach the goal. So this is the thing. Thank you so much because on our team Begaphone, I am just thanking you. With all difficulties, you have concluded your points in a nice manner. Thank you, madam. So now I would like to call the last speaker of the day, Professor Vijay Lakshmi, the Vice Principal, to have her deliberation on the challenges and implementation of collaborative nursing research. It is an important area to be focused upon to overcome those challenges and function effectively as a collaborative nurse researcher. Now the forum is for you, Vijay, please.
Thank you, ma'am. I thank our respected Dean, ma'am, for providing me this opportunity to be the panel member. I thank all the panel members, all the expert members who have shared their expertise on collaborative nursing research. Most of the challenges and obstacles already discussed by the previous expert speakers. I'm just going to highlight on the challenges in the implementation of collaborative nursing research. As pointed out by the previous speakers, collaboration in research, it is an essential component of knowledge development, and it is vital for the promotion of scientific nursing practice. For adding our base of nursing knowledge, collaboration is vital. Of course, it can be challenging and rewarding. Challenging all the challenges as discussed by the previous speakers. The time constraints, the fund for collaborative research, and of course, it is rewarding. The researchers involved, they develop their organizational skills, they develop their communication skills, they develop their knowledge base, and they develop their skill base with the help of the collaborative research. A few challenges to point out: finding an appropriate clinical site, gaining entry into the clinical site wherever the research is going to be conducted, and establishing a staff researcher relationship, recruiting the participants, finding time for the research, collecting the data, obtaining adequate funding. When we see finding out an appropriate clinical site, when the collaboration is between the nurse educator, nursing education institution, and the clinical hospital with the clinical nurses, practicing nurses, when they are collaborating. Maybe that is the case, or the collaboration between with different disciplines, among different disciplines, or with different institutions, or with different countries. Collaboration may be any one of this kind. So finding out an appropriate clinical site conducive for conducting the research, that is vital. And gaining entry. It may not be easy just for the researcher when they have to go collect data from the participant or the partner institution. A lot of procedures and protocols are involved. So clear guidelines need to be framed priorly before gaining access into the clinical site wherever the researcher is going to conduct the research, and establishing a staff researcher relationship when between the two partnership institutions or two agencies where the collaboration is going to happen. So the researcher will go to the different area, the partner institution, and they may need to collect the data from there. And the same area, the data may be collected where the researcher in-house, they may be collecting the data. In whichever place, establishing a staff researcher relationship is vital because staff contribute a lot and they help a lot in the collection of data. And another important component is recruiting the participants who are going to be the study participants. That is also vital to look into before getting into actual collaborative research. All these are challenges if they are not handled properly. And finding time for research, suitable time for research. In the partner institution, you can collect data, or in this in-house, the time, appropriate time to be finalized, fixed, and actual collection of data, proper methods and protocols, properly framed, structured before collecting the data. And as quoted by the previous expert speakers, obtaining adequate funding. That is very important. We can't progress without having adequate funding for the research to proceed. When we look into the international collaboration, we are going to have the collaboration with international agencies. So what are the things we have to look into? Language issues and translation requirements, they play a major role. With the guidance and leadership of our dean, ma'am, we had an experience of collaborating with University West, Trollhättan, Sweden. We are involved in a project, Linus Palma project, that is faculty and teacher exchange program. So while initiating that project, applying to this is a project funded by the Swedish government. So for the application, both the universities, that is Trollhättan, Sweden, University West Trollhättan, Sweden, and SRM University, that is SRM College of Nursing, we have to apply for the fund or the project. And the project head is the University West Trollhättan, Sweden. So when we were just working on the proposal or the application, both languages, that is Swedish language, the content was there, the application was there in Swedish language, and it was there in English also. So the partner institution, that is University West, they were drafting their content in Swedish language, and as from SRM College of Nursing, we were doing it in English. So in the same proposal or the same application, we had two languages. So language issues need to be considered, and communication, proper communication, as already, quoted or stressed by the previous speakers, proper communication, it is very vital, and planning the discussions for the progress of the project, that is also vital. When the discussion need to be planned priorly, proper schedule for the discussions need to be planned. And as I told you, the written components such as proposals, protocols, and instruments, all these need to be planned and structured in a proper manner. Otherwise, all these will definitely hinder the collaborative project with the international agency or institution. And communication mechanisms. In the same example, I can say, we were communicating with University West through email, and because through phone, it was not possible. So we were just communicating with email, but they were very, immediately they used to respond to us. So communication mechanisms, if we are going to collaborate with international agencies, that is very important. We have to find out which is feasible, suitable, and appropriate. And other challenges, as you see here, the communication records, this is also quoted by the previous speakers, maintaining proper minutes of the content of our discussions and planning, whatever we had, proper minutes of the progress of the research project, and the newsletters, the video conferencing. And for the other challenges, as we see here, the time, scheduling the time for the research study. Because if we are collaborating with international agencies, international institutions, we have to see the time differences in planning the schedule. So differences between countries in time scheduling for the research study, including planning, implementation, and data collection, for formulating the academic calendars, staffing schedules in different facilities, and the different policies in the international arena in the different country, the country which we are going to collaborate with, the international differences in the requirements, procedures for protection of human participants in the research project. So far we have seen the challenges and the recommendations as already quoted by the previous speakers. I'm just going to highlight a few. We have to identify and assess the resources needed and whatever is needed and whatever is available, so that we will be able to complete the research project collaboratively. And we have to focus on the personal resources, competent researchers who is available and who is needed in each clinical site where the data is going to be collected, and the other people who are going to help for the project, the secretarial staff, data collectors, data analysts, and the translation services. And of other resources, like whether we are going to have the research project in single discipline or it's going to be interdisciplinary membership. And other recommendations, financial resources, we have to focus on that. Already we have seen the budgeting or the finance that is needed and that is available. We have to look into that. So the support of personal resources, computers, software, these are the other resources. And the communication resources, whatever is available, and the potential consultants, who is needed and who is available, that we have to focus on. And the resources which have been determined can be shared or will need to be site specific. This is specific to the clinical area or the site where the research is going to be conducted. And this is also already detailed by the previous speakers. Commitment to carry out the study. This is the traits that is required for the researchers. Commitment to carry out the research study regardless of compensation, not expecting that we will get some benefit out of the study. Personal benefits. And select a supportive and committed clinical site, suitable clinical area, the area where we're going to do the study. Then allow adequate time for the entry process, the entry into the research site where we're going to collect the data. And we need to develop a trusting relationship between the researchers and the clinicians. The recommendations continued. We have to establish a firm plan for the participant recruitment, how we're going to recruit the participants. And like we'll have to finalize, if you're going to involve the student researchers, what are the incentives we are going to plan for them. Then proper time for the faculty, like if they're going to do the research in a part-time manner, proper release time for the faculty, that also need to be planned. Then we have to anticipate for any changes in the clinical practices, and we have to be prepared for that also. Then assure adequate funding before the beginning of the study. So these are some recommendations to enhance the collaboration. This study already discussed by Dr. Sibi ma'am, the collaborative and partnership research for improvement of health and social services. Researchers' experience from 20 projects. This is by Nystrom et al., University from Sweden. And this study concluded that allocated time, arenas for interaction, skills in project management, communication are essential components for collaborative research. And for researchers, dealing with this complexity takes time and energy for the scientific process. This is the thing that the researchers need to focus on based on the study. The study concluded that. And for the practitioners, they need to understand about the research process and how the research process is going to fit in with the organizational agendas, whatever is already available, and the activities and allocation of time for the research process. This is the study findings or the conclusion of the study quoted in the previous slide. So to conclude, financial commitment, inadequate regulatory frameworks, and diverse interests are among the potential challenges in collaborative research. So we have to design a structured framework foreseeing the potential challenges. Definitely, then we'll be able to expedite collaborative nursing research. Thank you for the opportunity.
Thank you, Vijay. So I just a lot of content with pictorial representation is there. Just giving an
Thank
eye
you, ma'am.
opening for all of us. And I will just
Thank you, ma'am.
conclude with this one challenges and implementation. In implementation of collaborative nursing research, here we have a lot of obstacles, and it is mentioned in the problems are mentioned this side, and then the solutions which we can go about with this. It is mentioned lack of recognition, lack of working hours, lot many things already we have covered with various speakers of the panelist. Everything is given in this. And then we have to overcome this with the all obstacles we need to convert into positive as an opportunities, and these things are over here. Kindly expand this one. So this one, shortage of staff and workplace mental violation, lack of synchronicity, and non-nursing role. So we here in Indian scenarios, we are facing with all kind of problems, and the solutions which we can have. So the positive practice environment, and then the teamwork and workload balance, evidence-based practice, as well the closing education and service gap, recruitment and retention policies. So these are the things with the positive note we can able to overcome the obstacles, and we can we can apply the collaborative nursing researches interdisciplinary. So this is what that is a big challenge in front of us. We have to think about all the leaders to help in all the way, either in the education or maybe in the service side. Yes. Yes, next one, please.
Thank you, ma'am.
Yeah. To conclude, so I have some of the points to be concluding, so that the strong points out to it is expressed by the study findings. Some of the experts they went to use collaboration and what cost factors deriving the strength and the intangible elements such as some of the difficulties overcoming and everything. So some 9 points it is there. Next slide. Move on next. So here, identify the appropriate barriers, please, and then the learning objectives and goals you have to set, and lot of effort, time, money, and everything we have to extend. So that is very important. Know when to stop the collaboration. So for example, Vijay Lakshmi madam was telling about that Sweden project. So that is a 8 years project. So if it starts without corona, probably this time the collaboration might have started, maybe little bit delay. And after that 8 years, we have to start that particular collaboration and may start a new one with another aim or a goal. So like that we need to know. So we have to check all these things, then we can start, get ready for the collaboration funded projects and other things. Yes, according to the study findings also the steps to be followed. And one more study also we have taken, the mixed method of study. So they have find out the results. They had differing perceptions of accessibility of the resources, participant in the practice settings, what are the notable things, difficulties they encounters, everything it is elicited through qualitative, and then they frame the quantitative method of study to overcome the obstacles. So like this some kind of academia and practice collaboration, the partnership collaborative study. So I didn't explain more. So the different studies are there, already explained many studies. So I really want to conclude. Yes, conclude slide, ma. Move on. So this is study findings. Study findings. So that the same thing I told. So this questionnaire is there, and based on that 14 questionnaires, the readiness for collaboration. We have to answer for all these things. So what, when, who, how, everything is in a questionnaire form. If everything is answering yes, then we can move forward. So we have to think about the readiness for the collaboration. Yes. Summary and conclusion in this: if everyone is moving forward together, then success takes care of itself. With the quote of Henry Ford, where we are concluding the session. The nurses require a great deal of practice, nurturing to implement collaborative research to improve the quality of care. Suggest to start small and first learn to work with collaboratively at the local level, maybe at the unit level, at the department level, then college level, then practicum, and then academia level, then interdisciplinary or transdisciplinary. We can start like that. With a small start, good begin. With collaboration, we can move further. So that is the one. The times are changing. Silos, that is, avoid sharing of information or failing or sharing information. And then national health burdens are being shared, and it is going to take much more than a single practitioner or paradigm to solve the serious healthcare issues, as very rightly told about many of the speakers. So we cannot solve only with the nursing. So we need to go along with other disciplines to solve, for example, COVID-19. So the same, it was explained by all the team members. All that the speaker also take out that thing. With the collaboration only we can able to bring changes, and then we can able to eradicate in future. So now, as on now, only the vaccine stage is there. So we may even eradicate that corona also with the collaborative effort and conducting research. Through collaboration, we can work together for a better future in all the way, now for nursing and all the discipline also. So thank you. So any questions, please, you can ask for. Yes, I would like to end with the quote: like working with people, I believe change can only come through collaboration. We need to work in a team. So academia and practice, it is a long gap. So we have identified many gaps with various speakers. That gap will be filled with the teamwork. Thank you for the opportunities of patient listening till up to extended time. So I think almost around 126 participants. Sorry for some inconvenience after the 4 o'clock. One session was a little bit voice breaking, but even then she was not leaving that, and that much of interest she has, Fabiola. So really I am thanking her also, because her interest to deliver the content. And madam is also there, Dr. Sundari ma'am is there still. We are thanking you for waiting for a longer time and joining along with. Thank you, ma'am. And I think Gobi Chandran may be on travel or something. He is also some blinking in the chat. Thank you all. Yes. Thank you, ma'am.
Thank you, ma'am. Our best comes out when we have honest discussion. Thank you, ma'am, for inculcating insight research knowledge on quality patient care. Thankfulness is the beginning of the gratitude. May I now request Mrs. Deena Jyoti, Associate Professor, SRM College of Nursing, to deliver the vote of thanks.
A very good evening to all. I thank Almighty God to given me this opportunity to propose vote of thanks. First, I would like to thank SRM ISD for their constant support to conduct this second national webinar. Next, my sincere gratitude to our Dean Ma'am, SRM Town, for her meticulous planning and execution of this second national webinar. Thank you, Dean Ma'am. My heartfelt gratitude to VP Ma'am, SRM College of Nursing, for her highly instructive mentorship and support for the success of this program. Thank you, ma'am. I'm happy to express my sincere thanks to all the resource persons, panel members, moderator, and students participated in debate. Thank you, ma'ams and students. My whole heartfelt thanks to all the participants from various colleges, hospitals, and also our SRM hospital. Thank you all. I thank ITKM team for their technical support for this webinar. Last but not least, I express my deep sense of appreciation and thanks to all the faculty members, students, non-teaching staffs of SRM Con for success of second national webinar. Thank you, one and all.
Thank you. There is a time delay, but however, it is highly meaningful. It is a very good sharing sessions. We couldn't able to stop the speakers, so that is only a limit. So we have to limit. So that is the one feedback. I mean, otherwise, no, we have gone a little beyond to the time. Otherwise, overall, it is okay. And the participants are also, I think, most of them got in. I think almost around 120 now. Thank you, all the participants, for the patient listening and attending until end. Thank you. Thank you, one and all.
In order
Thank you, ma'am. Thank you so much, ma'am.
In order to give respect to the national anthem, I request the gathering to raise for the national anthem.
Yes.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you all for your cooperation. I request all the participants to fill the feedback link, which is being posted on the chat box. Once you submit the feedback link, participants will receive the e-certificate in your registered mail within 30 minutes. Once again, I thank you all.
Thank you. Can we leave? Yes, madam is there. You would like to say, ma'am? Anyone would like to say, ma? Okay, can we leave it? Or Sundari Edwin madam is there? Would like to say something? No. Then we can leave.
Okay, ma'am.
Yes.
Ma'am.